And we are live. Welcome to the next summit, DMed. Let's pull up. Obesity affects a large percentage of the population, everything from young people to older adults. Today, we will focus on functional medicine and how functional medicine can help with diabetes and obesity. Our first speaker specializes in functional medicine. She's a functional medicine health coach specializing in not only SIBO, but also good health. And today she's going to talk about how, for specifically midlife women, they can work with addressing their diabetes. Angela, you have the floor.
Hello, can you hear me and see me? Give me a thumbs up if you can. My name is Angela Forrest. I am the founder and senior health professional with Robust Health Advocacy. As Samuel mentioned, I do focus on working with all types of people, but in particular, I work very closely with women in midlife, and particularly working with them on exactly one of the core topics of this forum, which is weight loss, which is one of the key symptoms that many women experience as they enter what I call hormonal transition, which is perimenopause, menopause, and post-menopause. So I wanted to get started with the slides. Samuel, if you are able to post those. So the first, if you can go to the next slide, I'll just go over some of the topics here. Quite a few topics to cover. I'm going to try and get to as many as I can, ideally. So some of the things I want to talk about, if you go to the next slide. Yes, thank you. Are understanding why weight loss gets harder in midlife, because it does get harder, clearly. And there are physical reasons for that, biological reasons for that. The role of estrogen in gut function and metabolism, the belly fat estrogen decline connection. There's a very strong connection there. We'll talk about that. How belly fat, which is also visceral fat, we'll talk about the differences there. It's not just covering your belly, it's literally covering your organs, and how this changes our metabolism and can contribute to chronic disease. Why women over 40 need to approach weight loss differently. We can't approach it anymore the way we did when we were 25 with eating less and exercising more. It actually doesn't work and can actually harm us in midlife. How we need to approach these things differently with diet and exercise. Hopefully, if we have time, I'll get into how vibrational plates and rebounding, which is using a trampoline, can help women with getting more movement into their daily lives, strengthening their bones and strengthening their muscles. And hopefully we will also get into GLPs a little bit, and then the infection, inflammation, metabolic dysfunction relationship. So Samuel, if you go to the next slide, I will briefly, again, talk a little bit about who I am. I'm the facilitator for this event, and I provide comprehensive holistic healthcare support. I have over 20 years of clinical experience and research knowledge. I first worked on myself to heal myself of a lot of digestive and metabolic challenges and problems. And then I began to move into working with others. So Samuel, if you can move on to the next slide. That would be slide 4. I can just start talking and the slide will hopefully catch up. So this slide is really about why does it get harder to lose weight in midlife? What is happening here? And what can women in midlife do about it? So a lot of us, when we start to reach our 40s and our 50s, we realize that the things that we used to do that really worked to help us lose weight in our 20s and 30s are no longer working. We're no longer getting the same results. So what's happening? Why is it different? Is it a question of we're just not trying hard enough? Is it a question of, something about us, our personalities, our motivation? And I'm here to tell you it has nothing to do with those things. It has absolutely nothing to do with your willpower, your motivation, your innate abilities to achieve anything in life. It has everything to do with your physiology, everything to do with your biology. And so let's talk about some of the things that are happening specifically. What's changed? Once women start to enter perimenopause, what starts to change is the estrogen and progesterone in our bodies becomes very, fluctuates. So Samuel, if you go to slide 4, I'm on slide 4 now.
Okay, I just gave you access, so you should be able to change the slides now.
You want me to change it? Okay. Yes.
Just try, see if you can.
Okay. Yep. Got it.
Okay, perfect.
So what's happened? So going back to what has happened during this time of life, the estrogen and progesterone levels in a woman's body once she enters perimenopause start to fluctuate. So specifically, that means the levels will start to rise rapidly and drop rapidly. That is one of the main reasons why women start to have some of these really common symptoms, in addition to weight gain, hot flashes, night sweats, all of the common symptoms that women often struggle with during perimenopause. The hormone levels are fluctuating. Once a woman enters menopause, and technically menopause is when you have gone one entire year without having a period, that you enter menopause at that point, the estrogen drops low and stays low. Once that process starting in perimenopause is initiated, muscle mass will start to decline because of the loss of estrogen. Energy, the way our body metabolizes the energy, the nutrients from our food, converts it into energy, that changes, it decreases. Sleep becomes disruptive as well because the estrogen drops. And also women in their 40s and 50s often tend to experience far more stress during this period of life than they may have experienced in their 20s and 30s. Often they have families. Often they are juggling multiple family responsibilities. They are typically at a higher place in their careers if they're working. More responsibilities at work, more responsibilities at home. The loss of estrogen increases the belly fat around the abdomen. It specifically targets that area for fat. So it's not just you. All of us who are entering this phase of life have that belly fat, and we'll talk a little bit more about what that fat represents. And because of the hormonal changes and the shifting, starting in perimenopause, again, the fluctuations, once you enter menopause, the estrogen and progesterone levels drop, and they stay low well into postmenopause for the rest of a woman's life, unless she gets estrogen replacement therapy. Okay, so that drop of estrogen also causes insulin sensitivity, and we become more stagnant metabolically. So in essence, trying to starve yourself, trying to work out all the time doesn't work when you are in hormonal transition. It does not work. It actually makes things worse. That's the main message here. Your gut is a metabolic organ. What does that mean? It means that your gut is a powerhouse for functions throughout your entire body. It is core and nutrient absorption, blood glucose regulation, blood pressure regulation, insulin signaling, Appetite regulation is directly tied to gut functioning. Bile creation, it plays a huge role in the creation of bile. Immune system is based in the gut. Short chain fatty acid production, the gut-brain axis, that ongoing communication, most of which is coming from the gut to the brain. The gut is communicating with the brain a lot. And the gut microbiome, which is our gut bacteria. We have a lot of, it's not just bacteria, it's viruses and all of these things that are needed to help our bodies function. Because of the central role that the gut plays, it is critical in any conversation about weight management. And we're going to talk about how things change when women enter perimenopause, because things do change. During the menopausal transition period, declining estrogen can interact with multiple parts of the body. So you have your gut microbiome, the interaction there, the estrogen processes and the bile production that's tied to the gut and to the hormonal functioning, all the things I mentioned earlier. In essence, one of the key things that does happen to our digestive system when our estrogen levels start to drop is that digestion slows down. The movement within the digestive muscles, known as peristalsis, starts to slow down because of the drops in estrogen. So we talk about the estrogen gut microbiome relationship, that connection. It's very, very tight. It's very strong, that connection. It's referred to as the estrobolome, and it's specifically talking about the bacteria in the gut that are impacted by changes to the estrogen, which the estrogen is dropping, starting in menopause. It's fluctuating in perimenopause, and then it starts to drop in menopause. So that means we have to do things differently. Because things are changing hormonally, we have to think about our diets very differently. We really need to think strongly about cutting back on the alcohol, the processed foods, the fast foods. We know we shouldn't be eating these foods, right? During perimenopause, menopause, and postmenopause, it becomes critical for us to really not have these foods, because these foods promote inflammation. And the loss of estrogen promotes inflammation. So when you enter your 40s, you start to enter perimenopause, and you're still grabbing that fast food, eating those chips, eating those foods that are not good for you, you are already entering a stage of life where your inflammation is going to automatically increase because you're losing estrogen. If you add processed foods and fast foods to that, then you're doubling the inflammation levels in your body. And that is not a good thing. We want women at this stage to really think about increasing your dietary fiber, really expanding your plant-based foods that you eat. But I'm going to say this, that protein still matters. And I personally believe that animal protein is an important part of the human diet, and there is a place for it. Too much animal protein is a problem, but there is a way to consume animal protein that is good, and I think is okay for the body. And women who are entering this hormonal transitional period need to increase their protein levels because it is directly tied to maintaining muscle. And the loss of estrogen can cause muscle to decrease, muscle mass. We can lose our muscle during the hormonal transitional period. Going back to the diet, fermented foods are helpful for feeding the gut bacteria. Our goal is to have regular, good bowel movements. We talked about, in a previous presentation, I talked about the Bristol chart. Please Google the Bristol chart. It will give you an idea of what your bowel movements should look like and what is the healthy range. If you are having a lot of diarrhea, having a lot of constipation, these can be symptoms of reductions in estrogen. That means you really need to be careful with what you're eating. It's just another reason to be careful with what you're eating. Again, I talked about really eliminating that alcohol from your body. Alcohol is pure sugar, and the ultra-processed foods oftentimes are high in sugar. And with these hormonal changes to the gut, you do not need more sugar. It will cause you to be in a situation where you can't lose that weight. If you're already struggling to lose weight and eating clean, think about how much more difficult it is when you're not eating well and trying to lose that weight. It's not going to happen. So we need to look at people individually. We need to look at women individually, where they are in their lives, the symptoms that they have, and particularly with weight, oftentimes stress is a big factor. The release of cortisol will promote people to hold on to weight. The body under stress is trying to stabilize itself, and it's trying to get through whatever the stress is. And it's not going to let go of that weight until the body mind is in a calmer, more stable place. It's going to hold on to that weight. We need to think about our stress. So the belly fat. This is the thing that women are always talking about. Why do I have this belly fat? Where did it come from? What's happening? Let's talk about what's happening. Lower estrogen. There's a signaling process that's happening that's causing this weight to accumulate. The estrogen reduction, again, the fluctuations also prompt the weight gain during perimenopause. So it is a communication that's happening throughout the body as the estrogen levels are fluctuating, starting in perimenopause and then dropping in menopause through postmenopause. The signaling results in this change in the way that fat is being stored in the body. The way the fat is accumulating changes because of the drops in estrogen, and the way the fat is accumulating on the body changes because of the drops in estrogen. There's a greater amount of fat accumulation that's occurring with these hormonal changes. There's more free fatty acid that is being delivered to the liver. If some of you may be familiar with the condition, it's fatty liver disease, which is one of the most common liver diseases currently in America. It used to be the most common liver disease was alcohol related, and now the most common liver disease is related to obesity, fatty liver disease. This is increased with the loss of estrogen. This process that allows the liver to accumulate more fat increases related to drops in estrogen. There's an impaired insulin response coming from the pancreas. Insulin regulates our blood sugar. When estrogen levels drop, that process of releasing the insulin is changed. It is not functioning as well. This can also promote the weight gain. And there's just a whole shift in how our body is metabolizing energy during hormonal transition. Yes, many studies have shown correlation between estrogen decline, more weight gain, impaired metabolism with fat being changed, the way the fat is being metabolized, and increased insulin resistance, which can lead to diabetes. During hormonal transition, perimenopause, menopause, postmenopause, that is the time when women are most likely to be diagnosed with diabetes. This period of time is the time when women are most likely to be diagnosed with high cholesterol. The loss of estrogen is significant throughout the entire body. This cannot be understated enough. And it's not just belly fat. It is fat that is covering your organs, which is known as visceral fat. Visceral fat can cause a lot of health problems. I'm going to talk about these problems. The visceral fat, as it accumulates, because of these hormonal changes, like I said, increased risk of type 2 diabetes related to insulin resistance, increased risk of fatty liver disease, high blood pressure, cardiovascular disease. These are all like metabolic changes and that happen with the hormonal shifts. And it's promoting inflammation throughout the body. Again, that's why you don't want to be eating a lot of fast food and processed food, because you're doubling the level of inflammation in your body by doing that. The drops in the estrogen and progesterone are already causing an innate inflammatory response. We got to do things differently in midlife. We simply have to approach things differently because the physiology of how we are is different. When you have this type of mindset, like my body is different, my body is not the same as it was when it was 25. I can't be the way I was when I was 25. But you still can be thinner, you still can be healthier, and you still can be fitter. Your body is different in midlife. Every woman's body changes dramatically. The three main hormonal shifts that women experience, and some of us don't experience all of them, but many of us do, are puberty, pregnancy, and then perimenopause, menopause, and postmenopause. These are all hormonal transitions that change us, change our bodies, change our minds, and these changes are often permanent, but the weight gain does not have to be. So this is what we do about it. The old model was eat less, do more cardio. Weigh yourself. Doesn't work. The new model is protect muscle, manage your metabolic health, improve the quality of your food, focus on strength training, weight resistance, weightlifting, address your sleep. This is a big challenge for women in midlife. You're juggling a lot, but you've got to get serious about managing your sleep effectively. Again, the stress management is critical. Learning how to manage your stress during the course of your day. And for midlife women, a lot of stress management is tied to relationship management. Managing those core relationships with your spouse, with your children, with your parents, with other family members, with anyone that you may have been tasked with providing care to. Midlife women are like the hub in the wheel. They are connected to multiple people and often engaged in caregiving. I work closely with my clients on this. It is so important to have boundaries in your relationships. It is so important to make time for yourself. Self-care at this stage of life is not an option. It is mandatory. You must engage in self-care. We need to make these shifts. We need to have women thinking about these things. It's not just about losing fat at this age. It's about, we've got to preserve that muscle. The loss of estrogen has caused the reduction in muscle mass. We've got to work to restore it and maintain it. Got to protect bone. Loss of estrogen. 20 women who enter perimenopause lose 20% of their bone density just during the course of being in perimenopause. I significantly have lost bone density. And that started in perimenopause. We need to be very conscious about that. And the way that you protect your bone is you make sure your diet is good and you engage in strength, weight bearing, and weight resistant exercises to strengthen our bones. And that involves movement, that involves exercise, but not cardio. Cardio is still beneficial at this stage of life. But training for strength is more, I would say, as equally, if not more important. It actually is more important than cardio. Cardio is good for our hearts because women need that strength for our hearts because estrogen drops affect the heart as well. So we do need the cardio, but we need to add the weight lifting, the weight resistance exercises. And keep in mind, when you exercise, you are helping better manage your hormones as well. Our bodies were made to move. We need to move at all stages of our life, and midlife is no exception. If you've never been big on exercise, Now is the time to get serious about it. You don't need to go and train for a marathon. You don't need to go in the gym and start lifting 20 pounds. Start gradually. Start with walking. 10 to 15 minutes a day can make a huge difference in your symptoms that you may be experiencing right now, your hot flashes, your night sweats, all of these very common symptoms, and it will help with losing the weight as well. You're better off being in a position to lose weight if you're moving at least 15 to 20 minutes a day than you are if you're not. Body was made to move. The weight loss goals, right, at this stage of life, midlife, are about sustainability as much as they are about losing weight. We, as midlife women, should not be focusing so much on our appearance, but thinking about things like muscle strength, bone density, brain health, heart health. Why? Because the loss of estrogen affects all of these areas. And we need to step up and make sure we're maintaining these parts of our body, including the gut, as best as we can. So, next slide. Let's talk a little bit more about maintaining what we have, maintaining our health, maintaining our vitality, maintaining our ability to enjoy life, and reducing the symptoms of hormonal fluctuations and estrogen drops involve a holistic approach. Movement, diet, stress management, relationship management, cultivating joy in our lives. These are all of the foundations of health that women in midlife need to actively be pursuing. Do not put yourself last. Do not forget to eat properly. Do not say you're too busy to exercise. There are ways to incorporate movement into your day. There are ways to make sure you're eating properly. As a holistic health coach, I work with women on this. Everything is possible. You can eat well. You can move on a regular basis. You can lose the weight. I'm going to talk a little bit about prioritizing protein at this stage of life. Prioritizing protein. Again, animal protein. It is important, right? If you're vegan or vegetarian, I respect everybody's choice. There are non-animal ways of getting protein. Tempeh, tofu, beans, and lentils. However, in midlife, with hormonal transitions occurring, you may be told by your doctor you still need to get more protein. An easy way to get protein is to buy protein powder and make smoothies and put that protein straight into your smoothie. That's a way to easily add protein, particularly if you're vegan or vegetarian. Because you really want to have that protein to maintain your muscle mass. Many of the serious illnesses that afflict people in their 70s and 80s are tied to loss of bone density with bone breakage as a result of that, and loss of muscle mass. The inability to effectively move and walk are common symptoms of not exercising enough, which can result, and also not eating enough protein, which can result in weakened muscle mass and weakened mobility. So we've got to get serious about our movement and building and maintaining that muscle. Part of that, in addition to prioritizing protein, you want to increase your fiber through vegetables and through nuts and seeds. I am not a fan of whole grain as much as maybe others are because of gluten. Gluten, it can be problematic for the gut. It can trigger inflammation in the gut. Again, we really don't want more inflammation at this stage of life because hormonal transitions are naturally generating more inflammation. We want to do everything we can with the food we put in our body to reduce that. I suggest to people that I work with, and I practice this myself, try to avoid gluten. Try to avoid gluten. Look for gluten-free products in your breads and pasta. Gluten is known as a major not only as a major contributor to digestive issues. The reason why is because of the manufacturing of gluten, and also they use glyphosate on wheat. Glyphosate is a chemical. It is made by Monsanto. It is very destructive to pests, but it can be destructive to human health as well. Don't forget about healthy fats, okay? Folks get so worried about fats, but there are good fats, right? Olive oil, avocado, nuts, seeds, fatty fish. And again, when it comes to carbohydrates, try to reduce or restrict processed carbohydrates, the potato chips, the types of fast foods, the processed foods, the breads. I love bread too. Like, don't get me wrong, it's one of my favorite foods, but cutting down on bread is helpful when you're trying to maintain your metabolism at this stage of life. Combination protein plus plants, but plus healthy fibers, healthy fats, and minimally processed foods will put you into a good place to be able to release the weight. Now, my slides are, at this point, I have finished with my slideshow. I have a few more things I wanted to say, so I'm going to go ahead and jump into these things briefly. Some women do have success with intermittent fasting. What is intermittent fasting? It's basically restricting your food intake after a certain time. For instance, if you eat your last meal of the day at 5 o'clock and then you don't have another meal until 8 o'clock the following morning, that is intermittent fasting. This can be helpful for some women. For some women, I think every woman is different, and it's something that you can consult with a healthcare professional to see if this could be a tool that could assist in weight loss. Again, it's not for everyone. If you're particularly lean, if you struggled with nutritional deficiencies historically, but the reality is stopping eating your meals, meal spacing and meal timing are very, very important ways of helping your gut function properly. And when your gut functions properly, you can lose the weight more easily and keep it off. So that overnight intermittent fasting really is really beneficial for a lot of people, and it really can help them in their weight loss goals. Another thing that people should consider is spacing out your meals. So having a 4-hour break between every meal, breakfast, lunch, dinner. Why do you want that? This is a very important thing to do to allow what's known as your migrating motor complex, or MMC. The migrating motor complex is a function within our digestive system that cleans out our digestive system between meals. Constant snacking is bad for your digestive health. It doesn't allow the digestive system to rest and heal and reprocess. So in midlife, you really want to not only think about the quality of food you're eating, but when you're eating it. And again, spacing out those meals. I also suggest that people do not eat while they're working, because you should be focused when you're eating only on eating. The body needs to be focused on digestion. If you are trying to send emails and eat a sandwich, the body has to pull away from focusing on digestion to focus on the task you're doing. Allow your digestive system to work at the optimum level, and try to have your meals away from work, away from devices, away from cell phones. This will significantly help the way that your digestive system functions. Try to also eat earlier in the day so that you can cut off your last meal before 7 p.m. And again, allow that digestive system to have about 12 hours of rest. This is very difficult for a lot of people. A lot of people, myself included, are in high stress jobs. As an entrepreneur, I'm under stress all the time. They're stress eating, right? Having something there to snack on. Now, I had a wonderful conversation with another member of this platform, and what she does, she's an entrepreneur. She keeps like a little box of healthy snacks near her, nuts and seeds and maybe a little bit of fruit. And I think it's such a wonderful idea. When you're stressed, when you have that desire to grab something and stuff it into your mouth, if you have something near you that is healthy, that increases the chances you're going to put something healthy into your body. We all have moments where we're under stress and we just have that stress eating, desire. Not everybody, but a lot of us do. Make sure you have healthy foods around you, particularly nuts and seeds, because that's protein. Another tip I recommend that women think about, if you do eat something sweet, if you have that craving, if you have a sweet tooth, you have a craving for sweets, try to eat some protein before you eat the sweet. The reason is, if you eat protein, the digestive system will process that, and it will, number one, it will slow down things in the digestive system because it has that protein. It takes your gut longer to digest protein than it does carbs. So if you have a protein, nuts or something that you've eaten, it slows down your digestive system and it makes you less hungry for sweets. And then if you still eat the sweet thing, it will not raise your blood sugar because it already has that protein to kind of balance out and keep the pancreas from having to be activated. If you eat a Snickers bar straight up, or you eat particularly like a high sugar drink, that triggers your blood sugar to spike. Having a little protein before, just be mindful if you carry like nuts with you. So if you're out and about and you're like, oh, I'm out with friends, I'm going to have this dessert, have a few almonds right before you eat that dessert. It will keep your blood sugar from spiking. So when your blood sugar spikes, it quickly converts into metabolizing that and then turning into fat. So we want to keep that process from happening as impactfully. The way to do that is to have a little bit of protein. That's why they sell, those snack mixes, right? Where they have the protein, they have a little bit of sugar in there. It is a good combination, but I would recommend make your own snack mix. Don't buy it at the store. Just make your own. A little bit of dried fruit and nuts. It's going to be so much healthier for you. We talked about the importance of resistance training and weight training. If you are not familiar with using weights, my suggestion is to join a group. If you can afford it, join a fitness club and work with an exercise coach, work with a physical therapist. Learn how to safely engage in weight resistance exercises and weight training, because it will do so many wonderful things. It will increase your overall strength as you age. It will preserve your lean muscle mass. Here's the thing. The more muscle you have, the more quickly you will lose weight. A person who has more muscle on their body, when they have that muscle, the metabolic functioning of the body, it causes you to burn more fat the more muscle you have on your body. That is one big reason why you want to have more muscle on your body. The other big reason for midlife is that it allows you, it's a cushion. It's a cushion as you age. If you fall, if you slip and you fall on muscle as opposed to bone, you're better off. So there's really practical and good reasons why you want to use weight resistance and lift weights to build and maintain that muscle as you age. It keeps you more flexible, stronger. Your body composition, again, you're going to lose that weight. The more muscle you have in your body, your metabolic health is going to be better. You're going to have lower blood sugar and ideally lower blood pressure. And then again, the bone health. Lots of studies show that, the benefits of that. Some ways you can start doing resistance training, easy exercises. You can Google this. Doing squats, doing hinges, which is basically you just lean forward. You're leaning forward and you're pushing, you're using your body weight to push yourself back. Pushing, anything where you're pushing with your arms, pushing with your legs, that is a weight resistance exercise. It's very helpful. Pulling is the same. Rowing captures both of those movements, right? Lunging, stepping up, stepping across things, that is building your leg muscle. It's also strengthening your nervous system, the connection between coordination. The mind-body coordination strengthens. And holding tightly, squeezing the muscles. It's called a bracing. That also is a resistance exercise that can strengthen and maintain muscle tone. So I'm going to just summarize this. Oh, before I summarize, GLP-1s. This is really crucially important. So you might have remembered from the beginning of this session, I talked about how the drops in estrogen lead to slowing down. The digestive system slows down in women. It is a natural slowdown. It's tied to estrogen drops. The concern with GLP-1s, and this is actually noted by the FDA on the GLP-1 injection medications. It is a black box warning. GLP-1s, the way that they work is that they slow down the digestive system. By slowing down the digestive system, they make you're less hungry. The less active the digestive system is, the less hungry you are. The concern with women in midlife, and the interesting thing is most of the people who are getting GLP-1 injections are women in midlife who are struggling with belly fat, visceral fat that they can't get rid of. So they're going to their doctors and they're being told, hey, get this GLP-1 injection. The danger, and it is a real legitimate danger, is that if you are already dealing with a slowdown in the function of your gut muscles because of drops in estrogen, and then you add a GLP-1 injection to that, you are doubling or tripling the slowdown of the functioning of your gut. The risk is that things could slow down to the point where they shut down. And if your gut shuts down and stops functioning, you are at great risk of dying. And that is the concern. I do not think that enough doctors are talking to their patients about this who are in midlife. But I'm telling you, it's a real concern. And there are people who have literally had parts of their colon die because it stopped moving. The blood flow to the organ, to the the large intestine stopped. And you are at risk of developing sepsis. And that is life-threatening. So I really think women should be thinking very seriously about taking these injections. And before they consider doing it, look at all of the holistic health options that are available to help you lose weight. Think about all the ways you can lose weight, which I've covered in this session, before getting a GLP-1. That is my suggestion. Of course, everybody has a right to make their own decision in this area. Talk to your doctor. The concerns are real. And look up the black box labeling on GLP-1 injection drugs so you understand the risks. The risks are real. I think I'm going to wrap this up. I will say one last thing. So many good things to share. There's a correlation between infection in the body and the inability of the body to lose weight. And so great, the loss of estrogen. The other thing that the estrogen reduction causes is a reduction in immunity. Because our immunity is based in our gut, and because so many metabolic and microbiome changes are occurring with drops in estrogen and progesterone, That means that our immune systems are going to be less rigorous, less strong. We're going to have more inflammation. We're going to have reduced immune protection. And that is hormonally induced. So this is what I want to say about infection, because this is my own personal experience. If you have infections in your body, particularly in your teeth and in your gut, I did a previous session on small intestinal bacterial overgrowth, known as SIBO. It's one of the most common gut dysfunctions that's occurring in modern society. A lot of people have it. They don't know they have it. If you have an infection like that in your digestive system, if you have an infection in your teeth, if you have an infection anywhere in your body, what happens is the immune system will cause fat cells in your body to grow. That means you may put on weight. Those fat cells will not shrink until the source of the infection is addressed. This happened to me personally. I had SIBO, I had small intestinal bacterial overgrowth, and I had 3 root canals, one that I had had for 20 years that were seriously infected. I put on weight during COVID. I gained 40 pounds. I was in perimenopause, and so I thought, well, maybe this is just perimenopause. It was not just perimenopause. It was mostly because I had massive infection throughout my body. And until I addressed the SIBO, which I did, and I got the 3 infected root canals pulled, those teeth were pulled, I did not drop the weight. As soon as I got the last infected root canal pulled in January of 2025, my body, my metabolism was able to get back into alignment and be restored. And I lost the weight over a 6-month period. So when I work with clients, I ask about root canals. I ask about any infections they may have had. And again, many people have small intestinal bacterial overgrowth. Most of the people I've worked with have it or believe they have it. So I strongly encourage people, as another means of looking at their weight, looking at infections, determining if they have gut infections. You can get tested for SIBO. It's a pretty straightforward breath test. And most doctors' offices offer it, and it is covered by insurance. That is all that I had to say. I think in summary, there's a blueprint for losing weight in midlife. It is not the same approach that you would take in your 20s and 30s. You want to eat to make sure your metabolic health is strong. You want to focus on building and maintaining muscle. You want to move throughout your entire day. You want to get adequate sleep at all times, no matter how difficult it is. There should be no compromising on your sleep at this point in your life. I should also note, when you don't get enough sleep, you are more hungry. There is a correlation between lack of sleep and increased hunger. I felt it myself. I always know when I don't get enough sleep, my hunger pangs are just so much more common. So again, if you want to reduce your hunger, your cravings, get adequate sleep and deal with your stress. I work with clients all the time on this. I provide somatic, body-based exercises to immediately release stress and trauma from the body. And these exercises can be done anytime, anywhere. Final message. The goal in midlife is not to become smaller, is not necessarily to fit in the tiny little bikini. The goal is to become metabolically healthier, stronger, and more resilient as we age. And that is beauty inside and out. Thank you very much. If anyone has any questions, feel free to ask.
Thank you so much, Angela. A couple announcements for everyone. At the end of this summit, we will do our round table. So please join us at 6 o'clock CST for our round table. The second announcement is that from now on, these will be live on DecentMed as well as YouTube. You can check out this summit at decentmed.org/functional medicine. With that being said, I want to bring up another powerhouse to the stage. She is, again, in the functional medicine arena. Unlike Angela, she focuses specifically on nutrition. She's a functional nutritionist. You can find her at nutrifyyourlife.com and decentmed.org/nutrition. Lori Graham, you have the floor.
Nice to see you, Sam, and thank you. I'm going to try to share my screen, and I believe it's this share screen. Hold on, I'm going to find my PowerPoint. Select a tab. Sam, I might need a
What
little...
you want to do is, go to present, click slides and PDFs.
Wait. Hold on. I'm gonna go to the plus screen.
Yep, presenter invite. Then you're gonna go to slides and PDFs.
Got it. Okay.
And then from there,
My computer.
Okay, yeah, we are live on decentmed.org/functional medicine. So if everybody wants to go there, move from the YouTube and watch it there at decentmed.org/functional medicine. We'll also put clips of all the providers on LinkedIn from my cell phone. As you see, their clips will be there, but only a small percentage so that you are incentivized to go to decentmed.org/functional medicine. So yeah, you want to go there. And
okay, I had it up on my screen already. That's the challenge. I was all ready, but I can't go that route.
You could share your screen too.
Oh, okay. Let me do that because I have it ready and loaded. So go back to here. Sorry, folks. Go to share screen.
And let me know when you want me to start.
Entire screen. Okay. Let me share the screen and get just slide to the right page. Hold on. And sit. Okay. I am ready. Do you see what I see? Nutrify Your Life presents.
Let me set up the camera. Yes, ma'am. There we go.
Perfect. Now will my face be there?
You want to go no face? It's up to you. We can.
No, I want face. I want face. Not
okay.
That.
We'll do this.
Okay. Hi, everyone. My name is Lori Graham. I own my practice called Nutrify Your Life. And today I'm presenting, since this is a Diabesity Summit, on how to support your heart health, but from that perspective to kind of lift the veil of some of the confusing information that we see with the debates about cholesterol and blood sugar and exercise and everything like that, when we're looking at social media. So we're going to talk about cardiometabolic optimization, but also I want you to walk away with a sense of empowerment so that you can make informed healthcare decisions. I feel that in the traditional medicine kind of insurance model, you can use it to your advantage for blood work, and you can have an intelligent discussion with some doctors, but you have to bring something to the table. And this PowerPoint that I'm going to share with you today will give you that power. So just a little bit about me. Again, my name is Lori Graham. I have no affiliations whatsoever with any of the companies that I might mention during this talk, nor with any of the blood test companies as well. But there's just some different tests I will mention from my functional medicine perspective. I believe I had the right influencers in my life because when I was in my 20s, I remember starting to meditate, starting to eat plant forward, but I had this parallel life as an occupational therapist, 38 years worth. And I literally felt like a square peg in a round hole because as far as traditional medicine was concerned, I did not follow those tenets. I was eating vegan and there was a lot of concern about people eating vegan. And so I was a lot healthier, albeit younger, than my patients, but even my patients' kids in the home care arena, which was where I was. So just understand that I'm a little bit rogue in that regard, but I do have a master's in exercise science, a postmaster's in clinical nutrition, and I am certified in functional medicine, which is what IFMCP is. So why do I love what I do now? And so I have the privilege of helping people like you transform your health. And my favorite type of person to work with is someone who really does find themselves unmet by the needs in the traditional medicine space, but is highly motivated to make the diet and lifestyle changes that are required to experience optimized health. So my great law, or my law of great health, is your health is more in your hands than you might think. And I think sometimes people get victimized in the traditional medicine space because sometimes people are shamed for what conditions they deal with, especially in the diabesity kind of, space. And so if you come in and you're overweight and you're on the verge of getting diabetes, that's what diabesity is. But saying it's your fault is really not right. I think most people just haven't gotten the education, or they're not in the kind of living situation that supports optimizing their health. And Obama actually said many years ago, the brutal truth, we're all going to die. And yes, we are. But how you die is really so very different than you're just going to die. I don't want to spend the last 20 years of my life in a wheelchair like many of my patients did when I was an OT. And that's my position about this. And the whole diabesity kind of epidemic that we see is leaving people in wheelchairs the last 20 years of their lives. I want to compress morbidity. So how we age is really a matter of choice. And during the next, part of an hour that we're together, we're going to cover all the steps to take to protect your heart and your metabolic health. And I promise you're going to walk away with an education you didn't think even existed. So, do you know that an estimated 80% of cardiovascular disease, including heart disease and stroke, are preventable? I presented this at a meeting when I worked at a traditional medicine center. I set up a functional medicine department, and I was told that I can't say 80% of cardiovascular disease, including heart disease and stroke, are preventable. I was actually told that by an administrator. And so this is the first place that we run amok in traditional medicine, because this was actually stated by the, the heart.org. And so this is prevention medicine. Cardiovascular disease remains the number one killer and the most expensive disease. It costs nearly $1 billion a day. And we think hospitals are going to stay open. I'm not so sure about that. So the World Health Organization says most cardiovascular disease can be prevented by addressing behavioral risk factors, such as tobacco use, an unhealthy diet, obesity, physical inactivity, and the harmful use of alcohol. But of course, everyone here knows this. And you are well on your way of optimizing your cardiometabolic function. And I really do believe, like most people know, it's not good to smoke, it's good to exercise, it's good to eat real foods. Sometimes we need some support to actually actualize those kinds of behaviors. So in my mind, the prevention of chronic disease by means of diet and lifestyle 90% of type 2 diabetes is reversible. That's amazing. 80% of coronary artery disease, 70% of stroke, 70% of colon cancer. I mean, just take that in. Those are astronomically high in terms of percentages of how our diet and lifestyle can prevent disease. How do we sail through into our 90s without these diseases? And the older you get without the diseases, the more likely you're going to leave them behind. So, folks, by taking powerful life-affirming action today, you are protecting the memory of you in the future. You know, think about, do you want to be a grandparent? Do you want to lift your grandchildren? Do you want to take care of yourself and carry your own packages into the house? Do you want to be able to take care of showering and dressing and cooking and all those things? Do you want to do it well into your 90s? And I purport that we can. So which way would you rather be remembered? My conviction is, in large part, we get to choose how we age based on our diet and lifestyle choices. So I wanted to just give a little bit of an overview of functional medicine versus traditional medicine. Functional medicine, you'll often hear root cause medicine, and that is very true, and that's one of the distinctions. In traditional medicine, we look at symptoms that are occurring, and it's symptoms, symptom focused. So this leads us to the next perspective, which is we look at systems biology in functional medicine, meaning that your GI tract, your heart, your nervous system, your, what else would I say? Your brain, your cognitive function, all of these systems are connected. So you have to consider it all together. But in traditional medicine, we often say it's very siloed, meaning you have a specialist for everything. And so specialists nowadays and hospital systems don't even use the same platforms for recording your information, regarding your visits. So the doctors can't even talk to each other. So you almost have to hold to account your physician to look at the records that you've had printed out, and you're going to bring it back to your physician so that you have somebody that's overseeing your care plan. And most people just bop around to different specialists in the traditional medicine space, and they're good. They are really good specialists, but nobody's at the helm of your care. Functional medicine and both traditional medicine are evidence-based, meaning that there are double-blind placebo studies that are done that we base treatment modalities on. But the functional medicine world is going to look at supplements and also diet and lifestyle. But in traditional medicine, they're just using prescription meds, a pill for an ill. I believe, and my patients do tell me this, that the deeper connection that you would have with a functional medicine practitioner is so much a part of a patient's journey to healing. And so, my patients tell me they see my passion, but I'm always researching some additional things for them. And they get that I'm deeply committed to them. But in traditional medicine, you have a 10-minute visit and then you're done. So it's more superficial. And I'm going to end on that note, actually, because in functional medicine, my visit might be 60 minutes or even 90 minutes, but in traditional medicine, you're out in 10 minutes. And so how deeply can you begin to understand in the traditional medicine world what is driving, the conditions that a patient walks in with? What's driving it? How can you do that in 10 minutes? I don't know. So most of the people watching this might be a little too young to go to the cardiologist, but did your MD or cardiologist ever suggest a specific diet and lifestyle interventions, or did they just say lose weight? Like you have diabesity, you have the diabetes, you have the obesity, you have the inflammatory processes, the high blood pressure. Do they tell you what to do? No. So you never get a workable plan from these doctors. So what's the cost of not being in optimal health? Think about it, okay? You have a cost to your energy. You might feel lethargic. You might not be able to go through your day without yawning. You might have a slump in the middle of the afternoon. Maybe you can't even have the patience for your kids at the end of the school day to help them with their homework. How about mental function? Anybody ever feel like their brain is a little mushy? Well, that's what happens when you're not in optimal health. Mobility, as we age, women who go through menopause oftentimes lose bone density and they're not as active and their balance is impaired, and a fall can literally cause somebody to end their life if they have to have hip surgery, probably in the next 6 months. But also, if you're morbidly obese, you have the same mobility problems because your joints are breaking down. And you want to pick up your grandchildren. And how many of us wait until we retire to travel the world? So think about that. When you think about the choices that you make in your life in terms of diet and lifestyle, for the fast food or the not going to the gym, every morsel of food that I bring into my home, I know the nutritional value of it, but I think, is this life enhancing or is this going to take my life or take from my life? So jot this down. It's in your control. Heart disease and diabesity is largely modifiable through diet and lifestyle choices. Choices, not prescriptions. How many people have been on a prescription and had a side effect from the prescription? I am afraid of taking prescription meds, honestly. So true or false, and I know I don't have audience participation here, but elevated cholesterol is linked to mortality. So most of us go to the doctor and we get a total cholesterol, we get an HDL, high density lipoprotein, and then we get a low density. And if our cholesterol starts going above 200, our doctor's talking to us about a statin. So this is a hot topic, and I want to unpack this a bit, okay? So cholesterol is not the bad guy. It builds the structure of the cell walls, okay? It's part of every cell membrane. It makes hormones, your estrogen, your testosterone, even your fight or flight adrenal hormones. And it produces bile acids, which help you digest fat and absorb certain nutrients. So is cholesterol good or bad? This is an important distinction. So a little bit of a deeper dive. Think of lipoproteins as trucks. They're going to carry triglycerides, phospholipids, cholesterol to wherever they are required or stored. HDL contains the highest protein to lipid ratio, hence most dense, and they absorb cholesterol and it carries it back to the liver. So just remember, HDL is literally carrying these materials back to the liver to be processed. LDL, the next one down, so it's not as much, it doesn't contain as much protein as HDL, but it contains chiefly cholesterol, a kind that's called ApoB100, and it transports fats and cholesterol that's produced in the liver out to the tissues. So they are both going different ways on the highway, much like cars do, okay? And ApoB48 is synthesized in the gut and is therefore, think about it, if it's found in your gut, made in your gut, then it is an incredibly actionable biomarker for nutritional investigation. It's in your gut. Your VLDL is made in the liver. It mainly carries your triglycerides and it goes to the tissues. HDL to the liver, LDL to your tissues, VLDL out to the tissues. Okay? A little bit deeper here. When you overeat, your body stores fat in the fat cells to be used when you need them. So most people don't really know this, but we're born with a certain amount of fat cells. And whether we lose weight or not, or even thinking about Angela's talk earlier, you know, your fat cells swell when you overeat and then they shrink. And this is the problem with fast weight loss. The fat cells just kind of go back to the way they were before, and GLPs, you know, can sometimes be a big part of that. So just think of when you're losing weight, you want to lose weight in a sustainable kind of way. Triglycerides also get elevated, and this is part of the metabolic and the diabesity picture, but they can be elevated from drugs like diuretics, your estrogen, your progestin, retinoids, steroids, beta blockers, which are heart meds, even some immunosuppressants and some HIV meds. So, you know, a doctor could be looking at your triglycerides going up above 150, but another doctor might have put you on a diuretic because, I don't know, you're spilling too much calcium into your urine because you have weakening of the bones, so you're spilling calcium. Like this is where medicine is, and one doctor doesn't know what the other doctor is doing. Cardiovascular health, we look at a number of different things in a more optimal kind of way, is the way I look at this. We look at what's called anthropomorphic measurements, meaning your waistline, your height, your waist to hip ratio. We're going to look at those numbers. We look at blood sugar. We look at blood pressure. We look at triglycerides, your cholesterol. And here are the three things that most doctors in the traditional medicine space are not looking at. And that's inflammation, oxidative stress, and genetic factors. And we're going to kind of dig into this a little bit. So understanding more about cholesterol, we do have total cholesterol, HDL, LDL, VLDL. They count the number of cells. They can calculate the number of cells, but they also can examine the quality. Quality over number. We can examine genetic influences. The liver production, you know, how well can the liver produce that cholesterol? The intestinal absorption, inflammation, oxidative stress, and also clotting factors. So we're going to go through all of these in the context of a more advanced cardiovascular panel that your doctor's probably not running. But let's look at the inflammatory response. If you get a bug bite, it's normal to have some inflammation. Okay, that's the way the body heals. Inflammation for something like that, or if you bump yourself, it helps bring circulation to that site for the nutrients, for even some of the white blood cells that might need to attack the bug bite or the injury, right? Well, more the bug bite, not the injury. But inflammation is normal when it's post something like that, like after something like that. But chronic inflammation kinds of, experiences, when they're unresolved, they can have an impact on our genetics. And so we talk about the epigenetics, like just because you have a gene that says this might happen, you've got to do a lot of things really wrong to turn the expression of those genes on. And inflammation, that inflammatory response, when it's chronic, can make a change literally to the milieu of what's going on with the quality of your cholesterol. Oxidative stress is literally an imbalance of free radicals and antioxidants in the body, and that imbalance is now going to be favored towards oxidative stress, and that can lead to cell and tissue damage. So the oxidative stress is going to change the quality of your cholesterol. Cholesterol in and of itself is just cholesterol. And oxidative stress plays a huge role in terms of atherosclerosis, but something that's called endothelial dysfunction. And we'll dive into that a little bit more deeply as we move on. So, what do you think are the potential sources of inflammation? Food, the source of it in particular. Genetics can play a role, infections. If you're eating conventional versus pastured dairy, stress, sugar, gluten, food sensitivities, and rancid vegetable oils. So I'm not a person who thinks that vegetable oils in and of themselves are bad, but they only tolerate low heat. And so if you're overheating them, they can oxidize and cause inflammation. Oxidative stress, potential sources. We have current medications or certain medications, diets high in fat, sugar, and processed foods, exposure to radiation, obesity, pollution, exposure to pesticides or industrial kind of chemicals, smoking, cigarettes, or even tobacco products, and alcohol consumption. So the oxidative stress and the inflammation, the environment within which the cholesterol is existing, is what causes the cholesterol to do its damage. And so on the right side here, what you see is a normal artery and more of an atherosclerotic kind of artery. And normal on the inside, you have what's called the endothelium. And that endothelium are single layered cells. They can be provoked very easily. And you have other layers. We're not going to get too deep in the woods here, but a normal artery should have a nice, what's called a lumen, through which all your cholesterol and all cells kind of move through in your blood vessel. If you get a clot, it will actually make an ulceration, and it breaks through that endothelium, and it forms what's called soft plaque on the inner wall, and that's literally pushing out towards the inner wall of your lumen of the vessel. And so you see here, This is very exaggerated because normally you wouldn't really see this soft plaque around the whole circumference of the, blood vessel. You might see plaque over at one end of it, and then a little further down the pike, you might have another pushing out because of this kind of soft plaque down the road a little bit. So just know there are 4 layers of cells that constitute the thickness of the artery wall. So the artery wall is not a thin parchment-like wall. And the endothelium is not tested ever. And there are markers to look at, and there are supplements to address the endothelium, and even a more inner layer that I'll show you further on. But how plaque develops, if anybody's ever heard of a calcium artery score, it looks at the hard plaque that will soon develop over this. And sometimes when people have a 0 calcium artery score, they walk away and go, oh, I have no problems. But the truth is that everybody gets some soft plaque as we age, largely to the metabolic issues, largely, and inflammation and oxidative stress. And so by the time we arrive at 70, we're going to have some, but there's as many heart attacks happening with people who have a calcium artery score of 0 as people who have a calcium artery score of, 200. So just having a 0 calcium artery score does not protect you. This is an amazing piece of microscopic footage. So this is what's called the inner lining inside the endothelium. And there are these hair-like projections all the way around that keep the inner, environment of your arteries like slippery, so things move through. And it's literally a sophisticated protective barrier between the endothelial cells that I just showed you on the slide before and the circulated blood. And it plays a crucial role in terms of maintaining your vascular health by regulating the interactions between the vessel wall and the components in the blood. And we can test this, and we can also support it with a plant-forward diet and even some particular supplements. Glycocalyx dysfunction is an early marker of endothelial dysfunction. Most doctors don't know about it. It's closely linked to conditions like diabetes, hypertension, and atherosclerosis. So here's another hot topic, blood sugar, right? Let's unpack this. And this is what's really metabolic health is huge. So this is a graph. It's not an actual picture, but it's the best depiction I can find. And it shows what elevated blood sugar does to the inner lining or the endothelial lining of your blood vessels. So it's often said that an elevated blood sugar acts like sandpaper, literally scratching away at the inner lining. So every time you eat junk food, processed food, too much sugar, your blood sugar is going to spike, and continual spiking, or I'm going to say diagnosed type 2 diabetes, will actually do that to the inner lining of the blood vessel wall. And this activates that cascade that I spoke about before of inflammation and oxidative stress that forms the soft plaque. So perhaps we should be thinking more about our metabolic health than the number of cholesterol particles that we have. So blood sugar, to me, is highly actionable. It's probably the most highly actionable of every metric that we use. There are some other functional medicine labs that we can sometimes do to help understand what might be driving the inflammation and the oxidative stress. There are food intolerance tests. I, do happen to use KBMO, but there are other companies, and I have no affiliation. There are genetic labs. Genetics, again, we have to activate those genetics. They don't just happen without continual impact in a negative kind of way. And Boston Heart Lab is the lab I'm going to be showing pictures of, but Cleveland Heart, Quest, all these companies now do comprehensive cardiovascular labs. You don't have to stick with any one company. The KBMO, it looks at the delayed response to an array of foods, and you can choose two panels. One has 132 foods, one has 176 foods. What that enables a functional medicine practitioner to do is it says, okay, you're forming a delayed response to chicken, okay? And so what that means is beyond the inner lining of the blood test, of your gut rather, the lining, you have blood vessels that are supposed to be picking up the most microscopic broken down parts of the food that you ate. But if you're not breaking down chicken in this case, you will form an inflammatory response. So this is one place which is highly actionable to help us figure out what's driving inflammation in this process. Genetic labs, and I think you heard about this earlier, but they are a genetic PCR is what they're called. They do it through saliva. They run it through an algorithm. And from a functional medicine perspective, we're looking at the biochemical pathways to see how we could personalize perhaps diet and supplements to help the biochemical pathways run efficiently, kind of like a jigsaw puzzle. If a couple of pieces are missing, you're not going to, if you think of our physiology like that, you need to have all the pieces in the right place. And Boston Heart Lab, along with some of the other companies I mentioned earlier, they're very user-friendly. They color code the labs, as you'll see, but they're using more obscure, kinds of markers that you don't typically get unless you're looking at comprehensive, panels. So this happens to be just a little clip of Boston Heart. It's just a great thing that I could find online to display this. But everything, like I said, is coded in green, yellow, and red. And LDL-C is the amount of cholesterol in the LDL truck, in the particle. Non-HDL-C is the amount of cholesterol in all atherogenic lipoprotein particles. Your ApoB or your LDLP are the number or the quality of the atherogenic lipoprotein particles. And small dense LDL, so SD is small dense, the size, the quality of the particles, these are small dense, or they can be larger, but the point is the small dense ones can get in through that endothelial lining, especially if blood sugar's been, scraping away at the integrity of the endothelium. And something that you'll hear a lot about on social media is lipoprotein little a, or LP little a, and it is the inherited atherogenic and prothrombic, meaning it can cause blood clots, lipoprotein. And the reason why it's so, it can be so damaging is because it has a little tail at the end of it, and it can get caught or snagged in soft plaque. Okay? And these are the numbers, here, your ApoB and your LPA are two that you can really be asking your doctor to add to the standard. And I would look at small, dense lipoprotein. Okay. So a closer look at the atherogenic, lipids. So some of the people here may have gotten C-reactive protein. This is high sensitivity lipoprotein, the HSCRP. And under 0.5 is ideal. And we talked about hard plaque a little, a few slides ago, but PLA2 is showing whether you're plaquing. So if this number is normal, you don't have to do a calcium artery score or, something more for your soft plaque as well. This marker here, the OXPL, so this is showing how much of the ApoB, which is part of your LDL, is oxidized. MPO is myeloperoxidase. It shows if you've had any, if you have any chemicals that signify some heart tissue breakdown, which would happen during a heart attack. Interleukin 6 is hard to get. It's probably you have to pay out of pocket, but interleukin 6 is an inflammatory response. And TMAO, trimethyl arginine oxidase, this is higher in people that consume a lot of meat. And this is considered correlated, not causal, but it's considered very correlated with heart disease. Another test that Boston Heart Lab does that I haven't seen in the other companies I mentioned earlier. So we're looking at production of cholesterol, and we're looking at absorption in the gut. And so this lethosterol and this desmosterol are made in the liver, and in this particular sample, they're low. In this sample, the beta-cystosterol and campesterol, they're high. So they're just saying that this particular sample person is absorbing the cholesterol from food at a high level. And then you get a balance score that would suggest whether this is an area. This test is more used as an area to determine how plant forward somebody really should make their diet. So it is useful in that respect. Our HDL is considered protective, but if it's really high, it might not be. That's the current thinking. But on the surface where you see kind of like the mustard color threaded kind of coiled, material, that's the protein part of HDL. And there are like 5 sizes. We want all of our HDL to be more buoyant. Larger suggests more buoyant, meaning they'll move through the blood vessel more easily. And so when people have, more buoyant HDLs, they actually show a protective benefit to the heart, in terms of heart disease or to the heart muscle. There's some other markers that can be done. Sometimes people choose to go on statins, but some people also have muscle pain from the statins. So there's actually a gene that would tell a doctor ahead of time. I know we don't always test for it. ApoE is an incredible number. And, they say what's good for the heart is good for the brain, but ApoE has ApoE2, ApoE3, ApoE4, and you can have 6 different combinations. But if you have an E4 in the equation, you're more likely to have a twist in your cholesterol metabolism, which can also affect Alzheimer's besides just your heart. I'm not going to really go through, I think I want to talk about this one. So MTHFR is a gene, and I think everybody should have this tested because it's responsible for this particular gene is responsible for about 40% of methylation. And that's what converts folic acid into methylfolate. And why is that important? Because we give folic acid to women that are pregnant and they may not be able to use it. So you need it in the methylfolate form so that you can utilize it. But it's very important in terms of metabolic and cardiovascular health, as well as your liver function. And since your liver is making your cholesterol, it can really, if you have a single nucleotide polymorphism in this gene, it can have a pervasive impact on your heart and on your metabolic and, detoxification patterns. Okay? So I want you to walk away from our talk today and think about another possible conclusion. If, this is going to sound bizarre, but I love this analysis. If an alien comes down to Earth and it sees a huge traffic jam, and it sees this big truck, it's called an ambulance. Did the ambulance cause the accident, or did something else cause the accident? And so we think that cholesterol, just by its very nature, is really doing the damage, but it's not. And I do hope that with some of our time that we spent today, that we can rethink and advocate for ourselves as we navigate moving through life with some of the changes that happen as we age. So lifestyle choices, and I want to leave you with this. Regular exercise. Avoid sugar and refined carbohydrates. Eat real food, please. Lose weight. Remember, diabesity is a combination of diabetes and obesity, but losing weight alone most of the time causes the diabetes to go into remission. Avoid trans fat and hydrogenated oils and fats, and limit or just literally avoid alcohol. And what you want to look for in good functional medicine, somebody who's certified either through IFM or A4M, a certified health coach. Please learn to understand anybody in a health coach kind of role or a certified functional medicine practitioner. They're going to spend time, and you're going to learn so much to help you along the journey of healthy aging. Learn about some of your important genes. And I always say, be an informed consumer of your healthcare. Be the driver of your healthcare journey. Possible action steps: eat more plant-based, consume a rainbow of colors daily, eat organic, consume grass-fed free-range animal products, but at a lower quantity, and please don't eat packaged bologna, salami, and all that stuff is so bad for our hearts. Bacon, all bad for our hearts. Consume wild, not farm-raised fish. Minimize processed foods. Drink pure water. Exercise at least 20 to 40 minutes, 5 days a week. Good sleep hygiene. And the research is so strong on this. Hug your friend, your spouse, or your dog. Our sense of community has such an effect on our heart health. So for everyone here today, I do have 2 offers. I do have a copy of my newly released book, Dysfunctional Medicine. And I'm also offering a one-time 30-minute medical symptoms assessment. So it's a form that you fill out with me for $39. Thank you so much for listening. I really believe that understanding this kind of information makes you empowered in terms of your healthcare choices. There any questions in the audience? Or maybe we'll do that on the round table.
All right. So you can visit Lori at NutrifyYourLife.com. Again, like I said before, the full summit will be available at DecentMed.org/functional medicine. And you can watch her clips on LinkedIn as well. But the full summit will be at DecentMed.org/functional medicine. So we have multiple nutritionists in here. And one of the focuses that they talk about is sugar and how sugar affects heart health. And you broke down today from a meat perspective and you went through labs. How much, in your opinion, does sugar affect these labs?
Repeated elevated blood sugar rises or spikes creates a huge demand on our pancreatic beta cells for making insulin. And as somebody tracks into the kind of insulin resistant mode, they're not a diabetic, and it's most easily reversible at that point in time. But once somebody crosses beyond 6.4, those blood sugar spikes are now higher, and those higher spikes will impact the inner lining of the blood vessel.
So and I know Angela spoke about midlife women. So, and I know you work with midlife women and women that are postmenopausal as well. Can you touch on what are some things that you have done as a woman who's turning 70?
You're not supposed to say my name.
I meant to say 7. I meant to say 17.
So I kind of feel like I've been protected because, I said at the beginning of my talk, I had these influences earlier in life. So I was exercising, in high school, besides being active as a kid, but I was playing tennis, I was playing racquetball, and then I started running and doing marathons and triathlons, but I also ate plant-based. I actually went vegan. And so this is what I would tell any woman aging, is that you think you got it nailed, and then the rules change. You go through perimenopause, and all of a sudden you're packing on some weight, and the rules change. And then this is because estrogen is dropping, and that's why women put on the weight, and that's why hemoglobin A1C goes up. Estrogen has a protective role on our heart health and our blood vessel health. And this is something we need to be very focused on to continue staying active and vital. So for me personally, the first thing I did was I noticed I wore CGM. So easy. You put it on, and you don't get it from your insurance company, and they're not going to pay for it if you don't have a problem anyway. But invest the $80 and get an app with it. And the nice thing is, and you can reach out to me and I can arrange for that, but with an app, you can put your data in, like I ate this, and this, I exercised, I argued with my kids, and you can begin to see what is driving your blood sugar spikes. Once you figure out the pattern, then you can do something. And so you need data. You have to test. That's the first thing I would do, is make those dietary changes, make the lifestyle changes. Going for a 10-minute walk after dinner will bring down a post-meal spike. Those are all things we can do. There are certain probiotics on the market that have been well researched. But I think you should do the food first and the exercise first, but then you could pile on, some of the probiotics that are around there, particularly high doses of Akkermansia can help. And beyond that, I hate to say it in the context of the supplement before, but I think very, very low doses. And I don't want to say I think. I know that there is research that supports the lowering of blood glucose with some GLP-1 agonists. Excuse me, not agonists. I can't even say the word because it's been an hour, but the GLP-1s. And the benefit for someone my age, microdosing like once a month instead of once a week, and I mean really microdosing, like below even 2.5, could help with somebody who doesn't have the ability to lower their blood sugar with more dietary and lifestyle approaches.
100%. And thank you so much, Lori. You can visit Lori Graham at nutrifyyourlife.com or decentmed.org/nutrition. One model that I found from all of our functional medicine practitioners and nutritionists is what Lori just said. Don't guess, test. And that's something that I think everyone needs to do. Again, you can catch the full summit at decentmed.org/functional medicine. I like to switch it up on these summits, and I like to have a diverse panel. I decided to choose a guest speaker for this summit. And speaking of sugar, he's going to talk about the cascading events when you take sugar and when you're eating a large amount of sugar. With that being said, I want to welcome Dr. Harvey Loomstein to the stage.
Hey, thank you, Samuel. I am happy to be here. And I would like to first, compliment previous speaker. I know her well. She's done an excellent job of talking about what goes on inside of your body from a physical medicine point of view. I am going to talk to you in not so many scientific terms, rather explain things. But first, I think that I need to introduce myself. That's what I think. And if I share my screen.
Yep, I'll add it. When you share your screen, I'll add it to the stage, no problem.
Okay, so I'm sharing my screen now.
Okay, I don't see it unless is this you? This is you, right?
Hang on.
Or is that Lori? I think that's Lori's.
There we go. You see it now?
No, I don't. I don't actually. So go press present or invite and then share screen. You did that?
I did. Slides. Share screen. And I'm going to share this screen. And I'm going to share it on this screen. So let me see. Do you see it now? I guess not.
No, I do not. Here we go. No, that's Kari. No. Yeah, you should be able to. The others have been able to.
Wait, let me try this. How about now?
Nope.
Well, I know I'm on there, and I'm sharing the screen.
It's weird. So I'm not.
Okay. Oh wait, hang on. No.
There we go. Now I see it.
Yeah, you have to do. You got to do the whole thing. Okay. You see that, right?
Yes, sir.
Okay. So I want to thank you all for being here. I want to introduce myself. But first, I have to take care of the government and the legal by saying, and you'll notice mine says this course, webinar, seminar, podcast, etc. And you've all seen that before. However, I want you to note the bottom. Please note that medical conditions and treatments may vary from person to person. The information provided on this talk may not be applicable to your specific situation. It's important to consult with a healthcare professional for personalized advice. By participating in this presentation, you agree to the terms of the disclaimer. Okay, that's pretty straightforward. The next one is, who am I? Well, I could go on and on. This is probably the latest one I've done, little indomitable force. Let's just say that I've been doing holistic medicine for so long, they spelled it with a W when I started. That's where it was. I've been treating brains for 50 years. That's what I started out doing in 1971. And 1976, I went into practice. And that's when I started treating head injuries and brain injuries. These are all of my credentials. And at one time, I could have 35 letters behind my name. And that may not mean anything to you, but I could walk into a 7-Eleven and pay 75 cents for a cup of coffee. You'd have to pay 6 bits. So there you go. I also want to say to you that I am 80 years old. I've been a diabetic for a while, since 1996. I started the road on what I'm going to talk to you about in 2023. My last A1C was 5.8, and I don't take any medicine. I do what I do for food, with food. So what happens to your body when you eat sugar? And I want to say to you, not only sugar, but all the things the last speaker talked about. At the very end, all the things that you're putting into your body that cause gut dysregulation. Because the answer to everything is in your gut. No matter what, if you don't fix your gut, nothing out there is going to work. So what happens? When you eat sugar, it's supposed to get digested. It gets absorbed into your blood. Your blood glucose rises. Pancreas releases insulin. Cortisol is also released. I'm going to come back to that because that is very important. Cells use glucose for energy. Here's the thing. Excess energy may be converted to fat. Blood sugar gradually returns to normal. Now, folks, this is biology. This isn't anything you're doing wrong. This has been going on since the time that the memory of man runneth not to the contrary. We've been doing this, and we've just started having this problem with blood sugar. So what you have is what happens when you eat sugar and you're insulin resistant. And I would say that probably half of the population out there is insulin resistant. Your blood contains too much glucose, pulls water from your tissues, forces your kidney to remove sugar. Well, was talking about the blood vessels and the small blood vessels. What happens when you get sugar in them, the blood vessels become thick. Well, your kidneys have little blood vessels too, just like your eyes. This becomes more damaging to blood vessels over time, and it creates an inflammatory response. I'm going to kind of show you what she was talking about. The silent struggle of the compensating body. When the last speaker talked about what happens when you have a glucose spike, you can have a diabetic-like reaction. You don't know that. You don't feel it. You don't see it. But let me share something with you. When I was a kid, and I had just gotten indoor plumbing and electricity, we used to hear, and I remember my parents talking about this. They go, well, you know, old Fred went to the doctor. Fred's dead. You know, he went to the doctor that day. He had no problems. He had a great checkup, and he walked outside and died of a heart attack, and nobody knows why. Well, we know why now. And we know why because, again, we are only now just be able to measure this process. We talked about a continuous glucose monitor. So you don't know whether you're having this or not, this struggle, this spike. And you don't know what effect it's going to have on you. But you can look at your genetics and come up with something like, does diabetes run in your family? Does heart disease run in your family? Do gut problems run in your family? You can get an idea. And if you're concerned, get a glucose meter. Because there aren't any you don't have symptoms from this. You know, we hear about people now, and I've heard about this now for the last 6 or 7 years. Guy goes into the doctor. He's got a few vague symptoms, a little tired, little aches and pains, maybe his joints hurt. They do his blood and comes back and says, well, you got stage 3 kidney disease, or you got stage 4 pancreatic cancer, or you got a problem with a valve in your heart. It goes on and on. And the problem with that is the continual impact, the cumulative impact of trauma to your body from these spikes. Now, let me talk a little bit about how we got to where we are. I'm a big believer in understanding how we got to where we are, because if we don't know that, we don't know where we're going. I was asked to do, I write things for various platforms, and I was asked to write about why was it easier to lose weight in 1960 than it is now? And this was in 2022 or 2024. Well, how is that? Here's the thing, and one of my advantages of being this old. In the 1960s, like the middle to late 60s, there appeared this little restaurant called McDonald's. And it was wonderful. You could just drive through. You didn't have to leave your car. They put your stuff in a bag, you take it home and you eat it. It was great. And by the 1970s, this concept of fast food, it became ubiquitous. It was everywhere. And we built a lifestyle around that fact. We quit cooking at home. We ate out. And then when we ate out, the goal was to make the food taste good. It had to taste good at every single restaurant that was in that chain. And so we see the chemists starting to manipulate flavors and kinds of chemicals that they put into the food so that you can't just eat just one. It's tough to eat one McDonald's French fry and throw the rest of them away. That's why I don't eat them anymore. So what happened from the 1960s to the 1970s to the 1980s? Some of you are going to remember in the 1980s, we supersized everything. We got gigantic Cokes. We got the Whopper. Remember the big Whopper? We got the king-sized version of everything. And they made it so it only cost you 10 or 15 cents more. What a deal it was for the restaurant, because here's the thing you didn't know. It only costs a restaurant, out of every dollar you spend, they only spend $7 for the 7 cents for the food. So what does it cost them? Another penny to add more for you to eat more? Oh, and then you think it's a good deal. Guys, it's all a con, and it's all set up to make you eat, and make you eat food that really isn't good for you. So we moved from the 1980s, where everything was supersized, to the 1990s. What happened in the 1990s? We had an explosion of diabetes. It was showing up everywhere. It was on the news. It was in the newspaper. It was all over. Everybody was writing articles about it. Why is everybody getting diabetes? They don't put together that it's the food, but it's okay. What happened after that was in the 2000s. And in the 2000s, we saw what? We saw the growth of dialysis centers. Why? Because when you treat the diabetes in the medical model, all they have is insulin. Insulin is a two-edged sword. Insulin can save your life, or it can kill you. Ultimately, diabetes is a progressive, degenerative disease that is going to get worse no matter what you do. And so are all the other metabolic diseases that come from this. High blood pressure, skin diseases, gut diseases. They just get worse. We'll talk about why they get worse. The other thing that came from this in the 2015s was we saw this explosion of a rise of cognitive disorders. Well, this rise in cognitive disorders, this got people thinking, my brain isn't doing well. This is really affecting my livelihood or what I do. And so we're going to come back to how you fix this. I want to talk to you and bring up about how the blood, taking effect what the last speaker talked about and showed you the pictures. Think about this, because this is a diagram of understanding diabetes. And the problems that gets into diabetes, but particular heart disease, stroke, and kidney failure. And that happens because as your blood sugar goes up and cortisol goes up, your blood gets thick. It's like if your reading is 250 to 70, your blood is thick like molasses. And you'll say, well, what difference does that make, Doc? Well, it's got to get into the capillaries. And if it gets into the capillaries and everything's bent and squished together, oh, what effect does that have? All of this stuff has effect downstream, the way we're calling now, we talk about root cause. I go back, I treat root cause. I don't want to treat the symptoms downstream. Giving you insulin or giving you metformin or glucophage, that's treating things downstream. By the time you get down there, folks, you have had a lot of damage done, and you don't realize it till you really get older, and you can begin to see what happens. So the key, and this is my bias. Your body is a battery. And unless you put in the vitamins and the minerals required to make the battery work, you're going to keep losing power. The other thing that can make your battery go out is the alternator. And the alternator is sleep. Now, I want you to know that in 1985, I started using magnetics and electricity to treat chronic pain, chronic fatigue, head injuries, depression. And I wrote this battery, The Body is a Battery, in 1991, because I saw people getting well, and I'm saying, what am I doing? They're not supposed to get well, according to Western medicine. But what am I doing that's making these people well? And I came away with, I'm putting energy into their body. That's what I'm doing. I'm recharging their battery. And you know what? In 1985 to 2000, it was pretty easy to do that. It isn't so easy anymore. We talked about exercise and why exercise isn't enough. And that's because as you age, at certain stages, you go through certain processes. And I can tell you, I used to teach a course that involved the diagnosis of neuromuscular disorders. And what we were trying to show is why people can get a significant injury in a rear end automobile accident. I also did a lot of seminars on why people can have a head injury, pretty significant head injury, from a low impact rear end collision. So anyway, I was teaching lawyers and doctors and judges about this. And I remember, because I was about 40, saying, well, you know, when you get to be about 40, you jump out of bed, not like you did when you were 20 or 30, and you got a little crick in your back, and you walk over to the shower, and you stand under the shower, and then all of a sudden you can stand up. Oh, okay. And then I joked about what happens at 60, because I wasn't 60 and I didn't know, but I watched people who were old. Now we have technology, and we know that somewhere around 50 years of age, everything begins to change. How you digest food changes. The chronic stress in your life builds up. And most of all, we have these environmental toxins. So it isn't just enough to do exercise. If you don't replace the chemicals that you need, if you don't replace them and build that battery back up, you're going to end up with a metabolic disease. I will tell you this. You can have a metabolic disease, but this is my belief with 50 years of experience. All diseases start in the gut. And if you've got an inflamed gut, you're going to have an inflamed brain. Now, here's the thing. The degree of inflammation in your gut is not necessarily the same as the degree of inflammation in your brain. Why is that? Well, because God gave you this really important thing called sleep. And sleep is the alternator. It is what recharges your battery. I can tell you that on October the 6th, we are going to start a 4-week course that is really going to go into all of this. And why, when you get to be 50, there are certain things that you have to do. Or you're not going to live to be 80 or 90 or 100. And just keep in mind that the warranty runs out at 120. So I don't want to share my screen anymore. Okay. Are you there? Do we have any questions? Well, if we don't, I'll just go on talking.
Yeah. So this is I guess my first question would be, because we touch on a wide range of ages on DecentMed, what would you say for people that are under 30, how important should they start taking their relationship with sugar?
From the time they're kids, little kids. You know, I'll tell you, I love my daughter-in-law. She's a doctor, but she understands diet. And I take my grandchildren out to eat, and they don't eat junk. I mean, wow. My grandson is 17, and my granddaughter's 14. I mean, when you're 14 years old, you're going to eat the same junk that all your group works. But she stays away from it. And so does my grandson. He stays away from it. Because you have to start early. Let me share something with you about food. Somewhere back in the annals of the research and education, which goes back into the 30s or the 20s, the Journal of Educational Research, there's a study that was done where they took a group of kids at a summer camp, and they were there for 6 weeks. And the kids could go and they could eat whatever they wanted. So naturally, when this process started, the first thing they did is they ate dessert. Well, you should always eat dessert first because life's short and you never can tell. By the end of the 6 weeks, they were eating a well-balanced blood sugar diet. So there you have evidence that the body has a desire to be healthy. That's the first thing you have to take into effect. The body has a desire to be healthy. The other thing is, we live in a polluted space. I don't want to share my screen anymore. In 1987, I started, because I worked with head injuries and brain injuries, I started seeing a different kind of client show up. These people had something wrong with their brains. But their brain didn't have a tumor. There was no trauma. And remember, back in this time, we didn't have CT scans and MRIs. CT came around in 1993, and MRI came around at the beginning of the 2000s. But what we did have was neuropsychological testing and something called quantitative EEG. Well, when these chemical injured people came in, I really didn't test them. We gave them our standard protocol, and they got better, and we were happy. And I figured that the reason they got better was because I was putting energy into their body. But no, what I was actually doing was I was making their microbiome work again and fixing their detox pathways. So we had two groups of breast implant ladies come in, one from New York, one from LA. They were a mixed group. And we didn't test, as I said, the chemically injured people. I didn't think what we did would have an effect. Now, why not? Because these chemically injured people, you know, they had brain fog, they couldn't figure things out. But I didn't see that the tremendous change that we measured. So I said to Camille, who was my vocational evaluator, I said, Camille, can you put together a little 20, 30-minute test of before and after what we do? Now, our protocol back then was 2 weeks at home and 3 weeks in the clinic. And the admonishment was, do not get on the plane unless you are having a bowel movement 30 minutes after you eat. So you can see the gut was working. I didn't know until 2018 that it was called the microbiome. There you go. So the people would come in, and we would test them. And they would come in on a Sunday, and we would test them, and then we would test them when they leave on Saturday, 3 weeks later. And I said to Camille, I don't expect this to show anything. And she showed me the changes, and I was amazed. Here is a hallmark of all brain injuries. All brain injuries have a slowdown of processing. That's the hallmark of a brain injury. Everything slows down. Well, in this case, their speed of processing, their ability to recall, their fine motor coordination. We did a test for mazes, you know, all stuff that didn't take very long, a minute, 2 minutes, 3 minutes, but they all improved. And I was like, wow, which led me to write an article called There's a Link Between the Gut and the Brain. I started out in 1985 thinking that the gut was in the brain. I spent a lot of money buying equipment that I thought was going to show that. It didn't. But we used the equipment for EEG biofeedback, which now is called neurotherapy. It is what recharges your battery. We found out that cleaning the gut is the key. Recharges your battery. When somebody comes in to our clinic, When somebody comes into our clinic, we do an evaluation. We also do a screen. We use something called the AO scan. The AO scan is a voice resonance screen. It can be done over the internet. It's based on your voice. And I will tell you that it is really, really accurate. The first time I had it done, and I had it done on me, I bought into it right away because I saw that it really gathered all the things about my body that I knew were wrong with me. It is based on, after having done 200 or 300 of these, it's really based on Eastern medicine. I'm an acupuncturist, but folks, I'm just a technician. In fact, if I were to go back to school, I would become an OMD.
I mean, this man talk all this shit, and he can't even do a presentation that's longer than 15 minutes.
Wait, where are you?
Hello?
Are you there?
Yeah, I'm here.
What is it?
Oh, sorry. I was on mute myself. I was trying to prepare for the next speaker.
Okay. You have any questions you want to ask me?
So when you talk about sleep, can you expand on how that plays a role in managing blood sugar?
When we think of sleep, we think we go to bed and we flick a switch and we go to sleep. And that's not true. During the night when you sleep, your brain cleans itself out. But it only does it at certain times. Part of the problem is that when people have their diabetes and their blood sugar is out of whack and they've got these cognitive problems, they don't sleep. That is one of the things I saw in the people that I treated who had chronic pain, chronic fatigue. They didn't sleep. It's also true if you look at nurses and police officers or anybody that their job requires split shifts. And there's all kinds of evidence. This evidence has been around since the 40s, but we don't change. What happens is your body is always preparing itself to recover. So think of this when you go to sleep. Your body's job is to clean out the offices in your brain. And all the workers are there, but they don't have the materials that they need to clean your brain. The same thing happens in your body. Only your body is going through a continual cleaning and rebuilding. What happens in the brain is the little street cleaners go in, and that's what I call them, and they clean up the cells. And they go into the cells, and they have a couple of things they can do. Our body is excellent at refurbishing itself, because there's no way we continually make all the cells that we use and need every day. We have 57 trillion cells, give or take. So we need a way to do that. So we have something called autophagy. And autophagy or apoptosis goes in and takes the cells, and they're no good, and they throw them away. And autophagy goes in and looks at the cell, well, maybe we can reuse this. This is a mechanism that's used to protect us. So when you don't sleep, you don't get into, there's REM sleep and non-REM sleep. And non-REM sleep is where you get the deep, slow waves. That is where your body repairs itself. Your REM sleep is where your brain consolidates all the stuff that's happened to you during the day. Now, I can tell you this. It's not a good idea to study for a test and put the book under your pillow, or dictate it and put the speaker under your pillow. You're much better off, if you've got a big test, to go to sleep and sleep soundly. Now, how do you know that you sleep soundly, or how do you know you have a sleep problem? Well, you wake up in the morning and the alarm goes off, and the first thing you do is you hit it and go back to bed. It becomes a struggle to get out of bed. You walk around for the first hour really trying to get acclimated. When you've had a good night's sleep, you're laying in bed, you get up, you get going, you have the energy to do what you need to do. That is what is going to get your body working again. And I will tell you that there are keys to falling asleep that are steeped in nutrition and not medication. And that you first want to do a sleep history to see what the problem has. Does the person have a problem falling asleep, staying asleep, or getting up early? Because each of those three problems are different, and they involve different parts of the brain and different parts of your body. So what can you do? Thank you for that. Yes, 1/3 of the adults. But when you deal with people with chronic problems, they have chronic sleep problems. And they may say to you they go to sleep, but you put them in a sleep study and they don't go to sleep. Their brain locks out. And there's been some new things that have come out about sleep. I just started reading this research this week. It seems that vitamin D3 has more to do with sleep than was previously thought. And the thing is, when you go into REM sleep, your eyes are moving, your body's going up, you're always up and down. But your brain has a little part in the medulla oblongata, that's the lowest part of your brain stem. And there are little cells in there that get triggered by vitamin D3 that tells your body you're hypnotized. I'm sorry, you're not hypnotized. You're paralyzed, and that's why you don't get up and walk around, although some people do. They're also finding that vitamin D3 has a lot to do with the quality of sleep that you get. That's the good news. We know that. The bad news is they don't know the amounts. And I had a woman come to me, and she was taking 9,000 units of vitamin D3 a day. And she says, "Do you think that's a lot?" I said, "What do you think?" Well, we cut that back, and all of a sudden, she's better just by cutting out the D3 and a few other things. You have to remember, the human body is complex. I go back to the point that I have 57 trillion cells, and you have 57 trillion cells, and my 57 trillion cells are different than your 57 trillion cells. I'm going to respond to things differently than you're going to respond to them. There are 13 trillion or so cells in my brain. You have 13 trillion or so cells, but they don't fire the same way. It's what makes everything individual. And you have to look at people on an individual basis. You always have to ask yourself what and why. If you can't ask yourself that, you ought not to be practicing, because not everybody is going to be the same. Now, some people tell you the same story. That's the downstream. But when you begin to examine and go upstream, you find out that the causes are different. They have the same symptoms, but the causes are different. So if you treat everybody the same, statistically, you're going to hit, 67, 70%. But you've got to figure out specifically what it is and what's missing. We start in our program at Biotech Institute, we start with supplements. And then after 6 to 8 weeks, we try to switch people to food. Why? Because the typical person that comes to see us, if we had to use food to get their body in a position where it could respond to food, it would take forever. Supplements work faster, and they're faster and they're cheaper. So we use that. And then we get them to use food. Now you're going to say, okay, we got a problem. Problem is the food out there is toxic. It is. So what do you have to do? How do you get away? How do you get away from plastic? Because I want to tell you something. Plastic is not going to go away. We are not going to get to the point where we put glass bottles of shampoo back in the shower and those bottles break. It's not going to happen. Plastic is going to be around. But if your gut is open and functioning, you can handle that. Your body's made to be able to handle that, but you got to get it into the right shape. And if the gut is not open and the gut is not working, you are not going to have success. You may have success in remediating the symptom if that's what your goal is. But your goal ought to be to get the person back on the road so they become their own health consultant. They have enough knowledge to they have enough knowledge to be their own healthcare professional. That's what we want to do. That's our goal. That was my goal back in the 80s and the 90s, to make people their own therapists. I don't want you coming to me forever. I want you to go out there and learn how to survive in the world. Interestingly, my wife and I were discussing poison a couple of days ago. And she says, well, is diabetes a problem all over the world? I said, well, yeah, it is, especially glucose intolerance. And our glucose sensitivity. And she says, well, what about the food they eat? I said, well, the food isn't their problem. What's their problem is the chemicals coming over. When it rains in your neighborhood and my neighborhood and any neighborhood in the world, it rains glyphosate. And that's going to have an effect. When you absorb heavy metals, when you absorb heavy metals, that takes an impact on your brain. In fact, if you look at the body like this, let's assume you've got 100% of your energy. 95% of your energy is going to be used every single day, 24/7, even if you're lying in a coma. Your body needs the energy just to keep the processes working. So that only leaves you 5% to deal with all the other problems that you have in life. Like a smart aleck kid, or a boss who doesn't really appreciate what you do, or a spouse that's having a bad day. Used to be when we would have a bad day, we'd come home and kick the dog. That always worked for me, but then we had to get rid of the dog. So you have to find ways to control what's going on in your head. Now, interestingly, back in the 80s, there were these chairs, they're still around, Sony makes them, and they're the chairs that vibrate and the sound is in your ears. And we built something like that at Biotech Institute. They were called Alpha Rooms. And we started doing alpha EEG. But what I used with the chronic pain patients and the chronic fatigue, in addition to using the supplements and the herbs, we did subliminal hypnosis tapes. And the tapes that we used were able to do a progressive relaxation. At the end of that progressive relaxation, the person was asleep, hypnotized, whatever. And they were belly breathing. That is, again, one of the most important ways that you treat people that have chemical injuries. You have to treat the whole person. You have to make sure that they drink water. You'd be surprised how many people you're going to talk to who have these problems and they drink diet soda or they drink regular soda. They do everything but what is really needed to make them well. Sam?
Yes, sir.
Do you have any other questions? I can keep going,
so we got about 8 minutes left. What's interesting about Dr. Loomstein for the audience, and other providers on DecentMed, is that he, like our platform, operates at the intersection between energy medicine and functional medicine. He talked a little bit about hypnotherapy and his experience with what some would consider as woo-woo medicine. Can you touch a little bit about how frequency and energy healing can help with something like high blood sugar, diabetes, obesity, and some of the ailments that you've talked about today?
Sure. Your 57 trillion cells produce energy. Your body doesn't work without the energy being produced. Your body needs to have, your body absolutely will not work without potassium, sodium, magnesium, and calcium. It will not work. You've got to have that. Got to have oxygen, or it won't work. And you certainly have to have water. What you're doing, what we're all doing, is we're helping the body create the energy that God meant for it to create by finding out what's really good for energy, or how do we produce it. Now, yeah, you got to remember, we didn't have the technology back when I was doing this. I just looked at it and said, why are these people getting better? I don't know. Why? Well, I think what I'm doing is looking at what's happening with them. Is I was putting energy into their body, and what I was doing was I was putting medicine into their muscles. And their muscles, you can tell, because they took less energy. The key, in no matter what you do, is to increase the bioavailability of energy. You cannot heal without it. Let's take calcium. You may or may not, as you grow older, get enough calcium in. But you got to have calcium. Calcium is one of the main chemicals, minerals. Well, you know what? If you don't eat enough calcium or get it in your food, you're going to get it taken from your bones. And then all of a sudden, people end up with osteoporosis or osteopenia, or their teeth falling out. It's all a system, and it's all held together with energy. You've got to do the certain things to keep the energy up. And the easiest way to keep the energy up is through nutrition, because that's the way you were made. And one other thing. Through the years, we have moved inside. We were actually outside. When I was a little kid, I know you see it in Facebook, but I was a little kid, man. We'd go out 7:30. Well, not 7:30. We'd go out about 8:30 in the morning in the summer, and we'd come back home when the street light comes on. And we played. We went to the park. We played baseball. We did a lot of. We didn't stay inside. Well, with COVID and with weather and with climate change, our methods of living in today's society has changed. And so now we're inside. One of the things that's happened in work is that people used to have jobs that they had to get up and walk around. They had to get up and move. Not this again happened in the mid 2010s. Jobs began to be more sedentary, so that a lot of people just sit for 8 hours a day, and then they have bad knees or bad backs, and then they wonder why they're losing strength. And it doesn't take a lot to keep your strength up, getting up and moving every 5 minutes, doing resistant exercises. What back then we called isometrics. That helps you build muscle. Yes, walking is important, but if you don't have resistance, because that's what causes muscle to build. And what do muscles do? Muscles are your powerhouse. Muscles are where the glucose goes to make the energy. Muscles are really important, and you have to have those muscles working. The other thing you have to do is you've got to make sure detox pathways are open. If you have people come into your clinic, what you want to notice is, do they sweat? I ask people that because usually people that are sick don't sweat. That tells you that their kidneys aren't working. The skin is your second kidney. Your gastric muscles is your second heart. Those are things that you can ask people and you can get an idea of what is going on in their life at that time with their body. And then you do the AO scan and you find out specifically what's going on. Because we're looking at the blood and we're looking at the skeleton, we're looking at what goes on inside the body through an MRI type of thing, and it's absolutely just fascinating. So,
thank you so much for joining us today, Dr. Loomstein. You can visit biotechinstitute.net and check out Dr. Loomstein's podcast, as well as he has an upcoming program for sleep in October. I think it was October 6th, right?
Yes, October the 6th. And the week before, we're doing a webinar on why are you a diabetic when you don't have to be.
And there is so much more to come from Dr. Loomstein. You can also check out.
And I'm willing to give anybody as a freebie. I'm willing to give them an AO scan for free.
Perfect. Get your AO scan today, and like I said, and like he said, at DecentMed, or DMed now, we operate at the intersection between functional medicine and energy healing. Check out his 15-minute presentation on my LinkedIn, and the full summit is available at decentmed.org/functional medicine.
I wanted to add,
yes, sir,
a link.
Yeah, if you could put that in the private chat, and I'll put that.
Okay, there'll be a link that you can click on and fill out, and that way you can get the invitation to come to the.
And send that to me, and I'll also put that in the LinkedIn post that's now live, or you can just comment on LinkedIn yourself. I tagged you on LinkedIn so people can get a hold of you.
And again, thank you for your time, folks. I really appreciate it. I hope you come away knowing things that you didn't know when you showed up today.
Yes, sir.
All right. Thank you.
Take care. Our next speaker is we're going back to functional medicine now with our next speaker. Her focus is on functional medicine health coaching, similar to Angela, but she focuses also on hair loss. And today she's going to go with a more holistic overview on how functional medicine helps with diabetes and obesity. Kari, you have the floor.
Great. Can you hear me okay?
Yes, ma'am.
Okay. Thank you for having me. I'm going to get my slides up here. My computer. Nope. Oh, share screen. All right. Is that working okay? Is that working?
Yeah, I just saw it, Kari, but it went down. But it
Okay.
just worked.
Okay. Oh, good. All right. Great. So my name is Kari Lockrem, and I am a functional health coach. I have a telehealth business in Minnesota, and I'm also a hairdresser. So I have 30 years of experience as a hairdresser. And so I felt like where my worlds would collide well would be hair loss. So I can bring in the knowledge that I have about, the health of the scalp, hair, but also functional medicine. So what's going on internally in the body. So hair loss is a big piece of my clientele, and also I love studying on and love learning and helping people with gut health, and also metabolic health. So that's what brings me to the Diabesity Summit. And my disclosures are I don't have financial ties with medication manufacturers, labs, or pharmacies, but I am an authorized shape reclaimed practitioner. I will talk about that later. And this is for educational purposes only, and nothing here is for individual medical advice. Decisions about your care belongs with you and your own clinician. So I have a telehealth business in Minnesota, and my whole reason for becoming a functional medicine practitioner is my own story growing up. I had gut issues my whole life growing up, and not really knowing. At that time, food allergies weren't something that the pediatricians right away looked into. And so it seemed like it was just, I was just a complaining child. My stomach hurt, my stomach hurt. And so I actually had my first endoscope test at 9 years old because I really did have pain all the time. And nothing was found. All of my, structurally, everything was fine. There didn't seem to be a problem. So I'm back to just the complaining child. So I remember in high school, I would walk around with a bottle of Maalox in my hand because, with a spoon on it, because it's the only thing that made me feel better. I didn't know at the time it was magnesium, but it was magnesium. And at the time, it made me feel better, for a short period of time until I ate again. But I had no idea what was driving my symptoms. I thought it was, I didn't connect it to being food. Functional medicine wasn't something that was mainstream back then. So then, it was inflammation, but it was from food reactions, is what I found out later in life. So I have two daughters, and they both had same thing, problems with their stomach pain. And I also it eventually started affecting me in other inflammatory responses like acne. My skin was terrible growing up. And it got worse as I got older, actually, because remember when there was this whole soy protein is such a great thing. And not that it's not, but it's just not for me. Soy, I was having soy milk, soy protein, whatever I could have because I wanted to be healthy, right? Well, actually gave me cystic acne because I was so allergic to it. And I would ask my doctor, do you think that this is what I'm eating? And she said, no, definitely not. Definitely not what you're eating. So as I got older, made my decisions for myself, I decided, hey, I'm just going to put myself on a diet of chicken, vegetables, and rice for my skin. That's what I was doing it for. And my skin cleared up. but also for the first time in my life, literally the first time, my stomach didn't hurt, which was a miracle for me because that was never my case. And so now what? What do I, where do I go from here? I took everything out. I'm hardly eating anything. What do I add back in? I went to the doctor and got a IgE, food allergy test. Sorry, food allergy test is IgE, and found that I had a lot of actual food allergies. But since I had went so many years with food allergies, I had destroyed my gut so much that I had a long list of food sensitivities. So IgG mediated immune response. So I had just a mess in my gut at that point. It took me a really long time to get it better. But as my children got older and were having some problems, I decided that's it. I need to learn what's going on. Both of them have anxiety. And I wondered, is this all connected? How do I go about, what do I do for them? So functional medicine was starting to be a little more talked about. I was finding books about it at the health food store and started researching on my own, and eventually took my youngest daughter to a functional medicine clinic. And that was it. That was a light bulb above my head. And this is it. This is the answer that I've been looking for myself for years. And finally now I can figure this out for my kids. So then I went to school for functional medicine and actually worked in that same clinic that I took my daughter to for about 3 years. So it was a nice full circle moment. So I learned from my experience and my children, and then just working with the patients in the clinic, searching for patterns and not blaming them because, I had no idea I was damaging my gut. I had no idea my acne was from what I was eating, not because I didn't wash my skin enough, right? So this developed into a passion for gut and metabolic wellness. And I think it's important that people are educated. I think if you have education and you understand what's going on in your body, you're less likely to be placing blame on yourself. And if you understand it better, you know exactly what to do to fix it. So diabesity, I would explain it as a close relationship between obesity, type 2 diabetes, insulin resistance, as many of the presenters talked about today, can promote fat storage and expanding adipose tissue. So actually the fat cells get inflamed. So not only are there more fat cells, they're full, but now they're inflamed. So this sets off a cascade of, really hormones, inflammatory signals to the body. And this also affects how the body utilizes insulin. And it's just another cycle that people just can't seem to walk out of unless they know what's happening and they're intentional about how to break that cycle. And this is why I love being a health coach, is because, walking people through, the whole, what the doctor says is eat less and exercise more. What does that look like? What should I be eating? For every different individual person, some people need a certain diet. Some people just need different macros. And I love digging into each individual person and helping them walk that out. So, it's not just one thing, it's not just food. And I used to think that type 2 diabetes was the person's fault for not eating healthy or eating too much or not moving. And there's so much more that goes into that. Yep.
I just realized, Kari, your slides aren't showing. Do you want me to help you with that?
Oh, okay, sure.
Yeah, I just noticed that.
Yeah. Okay. That's okay. I can catch up too. I didn't get too far. Okay, so if I'm showing from my
you're going to click on presenter invite. Is it a PDF?
No, I just have it. Maybe I should make it a PDF. Maybe I should. Maybe that would be better.
You can just share your screen.
I did that. Let me see if I can do. Hold on.
Yeah, try to share your screen.
I did. So I do have it.
Because I saw it before.
Okay. Share screen. Oh, allow share window or share screen. I'll say
Share screen.
okay. How about now?
Yeah, I can see it.
Well, then will you see my notes too, or do you just see the slides?
Yeah, I see the notes too.
Okay. Just fine. Let me just.
But try to just do the slideshow side, and then yeah, right there, you're good. You're good.
Is that good? Okay.
Yeah.
So okay, great. Thank you for letting me know that. Okay. I think I was here. Yes, these are the things that are all part of insulin resistance, excess adiposity, and then diabesity. So this, I think, is so. This kind of blew my mind when I learned about this in school. This is literally root cause right here of diabetes or just metabolic dysfunction in general, which leads to diabetes. Potentially, it could. So, and I want people to be educated about this so that you know what to ask for it with your doctor, or someone that can run your labs, and then you can stop the progression of these stages before you have diagnosable type 2 diabetes. So stage 1, because of modern life, our diet, our stress, and everybody has talked about earlier today about our diet. Obviously, people know that I'm not supposed to be eating more calories than what my body can burn in that day. So, but what people don't realize is the food companies make it their business really to get you addicted to their food. MSG, sugar, all of the things that they know make you want to eat more. Like, when did you ever eat one Dorito? MSG, you want to just eat all the things. I remember making sausage for my daughter, and it was Jimmy Dean's, and I tasted it, and I was like, oh, this is really great. Well, it has MSG in it, and it has sugar, so there you go. So I want people to not feel shame about having metabolic dysfunction, because you're kind of set up for it by the food companies. So can we make different choices and not have packaged foods and fast food? Of course. But also, when we are in busy times in our life, we have kids in sports, we have, Wednesday night youth group, whatever, we're going to grab food on the way, or we're going to grab food on the way home. And there's not a single fast food restaurant that I've ever seen here, at least in Minnesota, that does not contain unhealthy inflammatory oils that they cook in. Sure, they're cooking chicken, and sure, it could be not breaded, but it's still cooked in soybean oil, which is inflammatory. So it's hard to get away from inflammatory foods if you're not taking time to eat whole foods and cook your own food. I understand that it's difficult. So I just want to say, I'm not shaming people at all, because I get it. Diet, stress, poor sleep. We just talked about that. If you have one night of poor sleep, you are insulin resistant the whole next day. And when you have poor sleep, when you're tired, your body wants fast energy. So it's going to tell you, it's going to crave sugar and carbs. When I'm tired and I'm craving food, I don't crave carrots. I crave something carby and soft and warm, and that's going to give me fast energy. It does, right? You eat a higher carbohydrate or something higher in sugar, you have fast energy. But there again, and I'll show you on the next slide how that's a cycle. So you're eating this fast energy food, it burns, it's gone, and now you're hungry again because you didn't have any nutrients in that food. So it's just such a cycle. So getting stuck in this, liver and body fat can start to climb, but the labs stay normal. If you went and got your labs drawn, your your glucose is going to look fine on your CBC panel. It's going to say around 100 when you go in, depending on if you had just eaten or not. So your doctor's going to say, oh, it's fine, no problem. It could be 90, could be depending on what part of the day, it's fine. Labs look normal. So stage 2 is where insulin starts to get high, because insulin is what brings down glucose. That's its job. It goes to the cell. It says, hey, cell, can I bring my friend glucose in? And the cells say yes. Typically, yes, come in. I need that for energy. Well, eventually, when it's too full, when you have a high glycemic diet, the cells say, no, I have enough insulin. You can't come in here. So it shuts down the receptors. So now there is insulin and blood sugar running around through the bloodstream, and the liver has to do something with it. So it packages it up in triglycerides and fat, and puts it out right around the liver. And this is where earlier this afternoon was talked about visceral fat. This is where visceral fat starts to develop. So, but if you were to get your labs drawn here, your blood glucose will still look normal. What they're not checking is insulin. Check your labs, what you have saved on your computer or on your patient portal. I guarantee there won't be an insulin. If you checked your insulin at stage 2, metabolic dysfunction, you would see insulin is starting to creep up. Your insulin should be between 2 and 4. I see insulin very often 10, 14, and definitely have seen it worse than that. But you don't know that. Insulin is doing a great job insulin's up because it's working really hard to pull down that blood sugar. Sure, your blood sugar and your A1C look great, but what's the insulin doing? And at this point is when we could really walk back this dynamic that's happening in the body, but we don't know it yet because our labs are normal. And then we get to stage 3. So stage 3 would be, oh, well, the beta cells now are getting tired in the pancreas. So they can't keep up with the glycemic load. So it can't make enough insulin anymore. Well, now you're getting more blood sugar left because it's not able to cover it anymore. So it'll start showing up in your A1C, and your glucose will start showing. So now your labs are flagged that there's a problem. Your A1C might be 5.9, and your doctor will say, hey, you really need to make a change in your diet and your movement. But it's no problem. We'll just keep watching it. Well, has he checked the insulin? Probably not. So, but at this point, there's already a problem because already the pancreas is being affected. Now, beyond that, because you didn't change your diet, because you didn't take it serious, maybe because you didn't have all the data, then now the glucose is high, triglycerides are high, but now HDL is too low. Now you have high blood pressure, and now there's damage in your vessels, in your blood vessels. So at this point, there's damage done in your body, and this leads to so many other diagnosable diseases if this doesn't get under control. But at this point, you're over 6.2, you're at 7, whatever on your A1C, and it's a lot harder to walk this back when when you've got to this point. But you didn't know, you had no idea that you were here because in stage 1 and 2, nobody was looking. So I encourage people to ask for fasting insulin always, all the time, should be part of your panel. So this is the cycle that I was saying. So eating refined carbs, excess energy, meaning more calories in general than what you're burning in your activity. And stress, this was talked about earlier too. Stress raises your cortisol. So whatever the stress response from the brain to the adrenal glands is, if it's internal stress because of infection, bacteria, overgrowth, or if it's external stress, you're running late to work, you got in a fight with your spouse, whatever it is, all of that raises cortisol, which always raises blood sugar. When blood sugar's up, insulin's up. Insulin's your fat storage hormone. So if your insulin is spiking, you're telling your body, insulin is telling your body to store fat, store. So if you've got this coming up throughout the day so many times, you've got a stressful morning, even though you didn't even eat, your blood sugar's up because your cortisol's up. So it's just like eating a high carbohydrate meal. So on with the cycle. Glucose starts to rise, the insulin demand increases, and eventually the cells respond less and less to the insulin over time. They stop hearing the signal. They stop letting glucose and insulin come in. But the problem with that too, of insulin resistance, is when the cells are pulling in receptors to insulin, it's also pulling in receptors to other things that are other hormones that are important. Your sex hormones, your thyroid hormone, everything is affected when you're in an insulin resistant state. So more glucose gets stored in fat tissue, the fat tissue expands. Since glucose isn't getting into the cell for energy, you don't have enough energy. Your body's telling you need more energy, so it makes you hungry. So you're hungry, you're fatigued because you don't have the nutrients and you don't have the sugar in the cell. So it's just this forward, terrible, self-reinforcing cycle. At any point, you can break this cycle and start to unwind this process. So what drives the cycle in the first place? So refined carbohydrates, which means pastas, breads, rice, white rice can be an issue here too, and added sugars. So added sugar, that's what I have my clients look for, is what's the added sugar. If there's something that you're eating that has a label, look for added sugar. You should be under 25 grams of sugar per day. So if you're getting a Starbucks in the morning that's got 60 grams of sugar, it's you're setting yourself up for that whole cycle already first thing in the morning. So processed fats, processed fatty, I think fats are very important. Healthy oils, nuts, and seeds, and the healthy fat that comes from our meat. But more processed fat, all of this starts creating this whole cycle of what we're talking about here. So also sitting most of the day. I just talked to somebody today about, get up off of your chair at least once, if you can, once an hour. Do some air squats, do 15 air squats, do some lunges across that's all you have to do. Certainly, once you eat your meal, engage your muscles, because the muscles pull in glucose. They don't even need insulin for that. They just pull in glucose and use it for energy. So the more we engage our muscles right after we eat, the more we're pulling in glucose and it's not being stored. So sitting during the day, not sleeping, and steady stress, keeping cortisol high, glucose is high, it's hard to clear, especially when we get insulin resistant. And also genetics. So if you've got someone in your family with type 2 diabetes, if your mother had gestational diabetes when you were pregnant, if you had gestational diabetes with your pregnancy, usually are genetics that make you a little more susceptible to type 2 diabetes if all of these other factors aren't kept under control. So, and remember, genetics and family history load the gun, and your daily life pulls the trigger. So as someone talked about this morning, I know that I heard it at one point this morning, it's epigenetics. So the things that we do in our lifestyle is what pulls the trigger. And when we're missing nutrients from an unhealthy diet, from a processed diet, you're not getting the nutrients that your body needs for insulin to work properly, for metabolism to work properly. So the body works on nutrients. Without proper nutrients, all of the processes in our body can't work properly. So we don't have what we need for our thyroid to work also, which will slow down metabolism. So most of these things we can change except for genetics. And this is where the root cause work begins. So this is why I love being a coach, is let's look at all of these places in your life and let's see where we can button it up, see where we can make some changes, and dramatic, wonderful side effects happen from changing these things. So this whole, eat less, move more, leaves out most of the story. And people are told that all the time when they don't have energy and they go to the doctor, or they're gaining, or they do have belly fat and they don't know where it came from. And that's usually what they're told, right? But it leaves out the genetics that sets your susceptibility, your environment, your food environment. What do you have in your pantry that you had from the event that you had on the weekend, or for your kids' lunch boxes, or which is a whole nother issue that we could talk about another time. But, you know, what do you have in your cabinets? What are you picking up? What are you prepping or not prepping? You know, if you don't prep, if I don't prep my food, I'm going to eat. If I'm hungry, I'm going to grab something that's easy and fast. So if I prep my vegetables and I prep whatever meat source, then I always eat so much better. So muscle and movement, you know, I know you heard that earlier today, how much muscle is your metabolism. So if you're not continuing to build muscle after, you know, I understand we're not playing sports as much anymore when we're, you know, in our 30s, and then in our 40s, we've got kids and we're doing all this stuff with them. And so we're not getting exercise in, but you have to be intentional about your movement every day and actually building muscle. Sleep and stress, we talked about that already. Medications, what medications are you on that are adding to your insulin resistance? And hormones, your other hormones need to come into play here. You need to be looking at your thyroid hormones and your sex hormones for men and women, and then the gut ecosystem. So what's going on in the gut, and we'll talk about this a little more in depth here, really signals to immune and metabolic systems both. None of these systems are in a silo. Everything works together. There is crosstalk between every system of the body to another. So when one is off and one's not working, it does have a direct effect. So when there's specialties in medicine, you know, things aren't separate. You know, your thyroid is not separate from your sex hormones and is not separate from your metabolism. It's all the same. It's all working together. This is functional medicine. So sleep, stress, and muscle move the same dials. So all of these have an effect on glucose and the appetite the same way that food does. So these are levers. These aren't extras. These are things that you need to have in place to keep your blood sugar regulated so that you don't become insulin resistant. So sleeping 7 to 9 hours, whatever your body needs, but you can't be sleeping 4 hours and 5 hours. On the occasion, it's going to happen for various reasons, but having a lifestyle like that is definitely the clients that I have that are in weight loss programs, if they're not sleeping, there's only so much weight they're going to lose, and they're going to plateau and they're going to get stuck there. You have to sleep if you want to lose weight. Learning how to control your stress. So stress is 10% what happens to you and 90% how you perceive it. So, you know, think about what can I do in my mind? What can I do for myself? You know, getting my nervous system to calm down so that I don't view all these stressors so that it actually is raising my cortisol. You do have more control over that than what you realize. And muscle, the largest site for clearing glucose from the blood. And the more muscle you have, that's your metabolism at rest. So how many calories am I burning when I'm just sitting here if I have muscle versus if I don't? Resistance training you have to have resistance training to build muscle, and you don't have to go to the gym if you don't want to. I'm doing physical therapy right now because of an injury, and I have exercise bands. And let me just tell you, that exercise band, when I first started using it, would make my muscles sore, and it's a band. So it can be the same as even, you know, a dumbbell or not as much load as what the machines are in a gym, but you can still build muscle and body weight exercises. I tell people a lot, go onto YouTube and look up body weight exercises at home. So time under tension, I mean, if you try to do a wall sit for a minute, you know, your muscles will be sore. So you don't have to be going to the gym, but building muscle is non-negotiable. And I added these pictures here because I want people to kind of understand what the process of, you know, insulin signaling looks like. So glucose, so this is what the receptor looks like. So the receptor, insulin sits on the receptor and it kind of like opens up a spot for the glucose to come in. this is a perfectly working insulin signaling process. But here, where we have insulin resistance, so these receptors aren't working. So they're either not out, they're not open, or they're not accepting. We're not accepting you today. So much more blood sugar and insulin stays in the bloodstream because if the receptors aren't even allowing anything in. So that expanding adipose tissue causes immune signaling. There's actually interleukin 6, inflammatory cytokines that fat cells actually make and are released into the body. And this also blunts insulin signals. So there's so many signals that happen in the intestines, in the liver, in the stomach, all the way throughout our body that's informing the rest of the body how to work. And when the cells stop hearing insulin, there's higher metabolic strain. So the ecosystem of the gut. So here, this is one of my favorite pictures. I really, really love this. Comes from Microbiome Labs. So the ecosystem, meaning our microbiome, is another way. So we have this amazing system in our intestines that help us digest food. It helps kill things that aren't supposed to be in there. Actually, some of our microbes make B vitamins. So they're doing very, very important things. Digesting our food, assimilating the nutrients, like pulling the nutrients that we need out of the food, and so that the rest of our systems in our body can use it. And then the rest, hopefully, is made of fiber. Fiber is food for our enterocytes. So the cells need short-chain fatty acids. So short-chain fatty acids come from fiber. So this is energy for the cells and the lining of our intestines to do what they need to do. So here is a picture. So on the left, the healthy gut looks like this. There is the lining of the intestines here. There's a nice mucus lining on top of that. And then anything that's in the gut lumen just bounces through and, excreted through stool. Well, when we have inflammation in our gut, the mucus wall gets broken down. Now there's a hole here. This is the immune system right here underneath of the cells of the lining of the gut. This is where your immune system lives. So your bloodstream is here. So there's inflammatory cytokines starting to be developed here because it recognizes this dendritic cell here, your immune cells, like, hey, danger, danger. So it informs your body to create antibodies against that, whatever that is that's coming into the bloodstream. So that could be the eggs that you eat every single day. Now you become sensitive to them. I could eat eggs 10 years ago. I can't eat them, which is actually true for me. I used to be able to eat gluten. I can't touch it now. So there's so many things that, happen when our gut gets leaky. But also, there is something that I'll talk about here in the next slide that gets released into the bloodstream from the gut lumen that's not supposed to be in the rest of our body. 50% of our microbes are, that's in a couple slides. Hold. I'll get there. There's some gram-negative, gram-positive. Gram-negative doesn't mean a bad thing. They either have a cell wall or a membrane. So when that gets released into the bloodstream, we'll talk about that in a few slides. So diversity and barrier integrity really affect blood sugar. So the diversity meaning how many different forms of microbes do you have? When I run a stool test for somebody, the stool test will show me how many different microbes live in their intestines, and we want it to be plentiful. We want it to be rich. So you can have a small amount of what we think are scary microbes like Clostridia or E. coli. It's fine to be part of our ecosystem as long as the cornerstone bacteria keep them at bay so they don't overgrow and cause problems. but you want a rich diversity of microbes in the gut because they do a lot of different things. And if you have certain overgrowth of bacteria, or there is one microbe called Akkermansia that is keystone bacteria, something commensal, something that should be in abundance in your intestines. And when it gets low, actually, when I see it low on a stool test, I know that that person is struggling metabolically, because when this is so when say you're eating a protein bar and it says 250 calories, depending on what's happening in your gut determines actually how many of those calories you absorb. The fact that it might not be a great protein source and your body can't even use it, that's one issue there. But if it's 250 calories, one person, you've got fast transit, moves through the body really quickly, they're only getting 100 of those calories potentially. Someone else that have a different overgrowth of bacteria that intentionally slow down the movement of food through the intestines so it can pull in more and more calories, can actually absorb more calories than what's listed on that. So what's happening in your gut really is everything to your metabolism. That has to be balanced. And there are ways for you to know when your gut is imbalanced, and, bloating, gas. Now, a little bit of gas can be normal with beans, but, there's a difference. You shouldn't have a lot of gas after every time you eat. It definitely, something's wrong, something's overgrown, creating gas. And reflux, pain in the stomach, pain in the intestines, pain around your belly button, pain in the lower quadrant, constipation, diarrhea. These are all things that would be a clue to you that you've got something wrong in your digestion. And if you don't even have enough stomach acid at the top of your digestive system, well, the mouth would be the top, but into the stomach, if you don't have enough stomach acid to break down the food, you're not getting nutrients from that food. You're not getting what you need for everything to work properly. And you're also not breaking down harmful microbes that you might be ingesting. So you need to have good, strong stomach acid. Stomach acid then sets off actually signals into the body to tell the rest of the body, food's coming, get ready, insulin, get going, bile, get going, telling the rest of the body what it needs to do. And if stomach acid isn't plentiful, it has an effect on the whole entire rest of your digestive system. So what's happening in your gut? Incredibly important. So fiber. We should have 30 grams of fiber per day. You have to be intentional about fiber, because if you check your labels of everything that you eat and see how much fiber is in there, it's going to say 2 grams, 3 grams, 0 grams. So you need to be eating vegetables and fruit. You're going to get more fiber from vegetables, but things like soluble fiber. And if you need to do a fiber supplement, you can, but I'm not a fan of Metamucil or I forget the other one, starts with a C. There's actually food dye in those and sugar. So I don't need my fiber supplement to have sugar in it if I'm just going to swallow it. I don't know why they do that. So check it. And I have on the next slide one that I like better. If you need to take fiber, it will pull water in. And so if you're constipated, it can help. Soluble fiber is helpful for if you're constipated. Insoluble fiber is better if diarrhea is your picture. So making sure you're eating the right foods that support what might be off in your digestive system too is really helpful. I like also sun fiber from Tomorrow's Nutrition. It's a lot gentler on the stomach for people who might be sensitive to fiber. And I always tell people, if you do a fiber supplement, I'd rather you get your fiber from food. But if you did I would always start with 1/4 or half of the full dose, lots of water, and let your body get used to it, because fiber is food to the microbes, good and bad. So if you have an overgrowth of opportunistic bacteria, so bacteria that's supposed to be there but has overgrown and is causing a problem, you're feeding them too. So if fiber creates pain and bloating and gas, then we know something's imbalanced in your gut. So take a peek at what's going on in there with a stool test, or go a lot slower with your fiber. Fermented foods is also a really great way to build up your very healthy microbiome. Fermented kimchi or sauerkraut, not that's just flavored, but it's actually fermented. You could ferment your own food too. Kombucha is a fermented food. It's not a probiotic, it's more of a prebiotic. It's more like feeding the microbes. So what does fiber do in your system, in your body? So it slows down the absorption. So if you have your plate that you're normally going to eat, say I have got chicken and I have rice and I have vegetables. If I eat my vegetables first, if I eat my fiber first, even if you have salad, whatever that looks like, whatever the vegetables are, and then I eat my protein and I eat my rice last, I'm slowing down the blood sugar spike from that rice by 30% because I ate the fiber first. So you can make a difference in how your blood sugar responds by just the timing of how you're eating. Fiber first, fiber, protein first. So if you're going to eat a meal that's a high carbohydrate meal and you don't have fiber and you don't have protein, you're setting yourself up for a blood sugar spike. Blood sugar equals insulin equals fat storage. So it also helps you stay fuller longer, adds volume in the stomach so you feel full, keeps you fuller longer. So fiber also feeds the bacteria, like I just said, and when those are fed, it makes a healthy barrier. So the gut lining, if they're being fed well and that mucus layer is thick, we don't have holes in our guts. So it's supporting gut integrity. Here are some sources of fiber. So they ferment, create short chain fatty acids, and this is signaling to our intestines. So it's like the energy for our cells, keeping them healthy. This is another product that I like, Unicity. When I look it up, it looks like you can even find it at Walmart, it looks like, or they have a website. So I do like that brand, and Thorne makes a fiber, Nutridyne makes a fiber. So just look at the ingredients. I always tell people, check ingredients. LPS, here's what I was talking about that I wanted to mention to you is when the gut gets leaky and we get microbes that enter into our bloodstream. So the gram-negative bacteria have something around them called lipopolysaccharide. We'll just say LPS for short. So when that gets into the bloodstream and into the body, this is called endotoxemia. So this is a toxemia coming from, inside of our gut. We don't just have LPS in our intestines, LPS also in our mouth, in our nasal passages, on our skin. So I don't mean to say that gram-negative bacteria are bad for you, but some of them overgrown, cause a problem. You don't want those in your bloodstream. When they get settled into the joints, we get painful joints. When they they also can make fat cells inflamed. So they swell up fat cells. Also, there was a study done. I was listening to a podcast from Kiran Krishnan talking about a study that they find LPS in the bloodstream being a huge risk factor for anxiety. So, and if you already have a high A1C and your gut gets leaky, you get LPS into the circulation, this is typically one of the huge levers that tips you over into type 2 diabetes. So, and autoimmune disease, I often see autoimmune disease, and LPS. Every person, I don't always check a gut barrier panel on every autoimmune patient, client, but when I do, they have antibodies against their thyroid. They have high LPS in their bloodstream. So LPS does cause a lot of problems in the body. So the gut needs to be sealed, not inflamed. LPS won't get out into the body. So it causes an immune response. So how is it linked to obesity and type 2 diabetes? So the gut's permeable, releases LPS into the circulation. The LPS signaling is linked to fat storage and adipose inflammation. It also can blunt insulin action. So also another thing that gets the cells to not respond to insulin. So fiber is very, very helpful for lowering LPS in the intestine. So also, as we talked about, fiber heals the gut lining too. So it's not getting out into the body, into the system. So, and if there is LPS in the body, there's definitely things that I will do to help lighten that load for people. So what happens in the gut doesn't stay in the gut. So I want you to remember that. So especially when there's LPS involved. So brain fog and low concentration are an inflammatory, lets you know that there's inflammation happening in the brain. When the gut's inflamed, typically the brain's inflamed. So I know when someone's talking to me about brain fog, I want to know what's happening in their gut. So insulin resistance, adipose tissue, so fat tissue inflammation also affects the mood. So if your brain's inflamed, you don't realize that's why you don't feel good. This is why I feel depressed. Or in children, I have seen, even with my granddaughter, when we change her probiotic, there's a shift in the microbiome, and she might have a day where she's a little bit more crabby, or she doesn't know why she's crying. And, so it definitely, shift in the microbiome absolutely affects the mood, pain and fatigue. So I'm always looking, when people have pain syndromes, I'm always looking at the gut. So same root driver, different expression from person to person. So, these are the labs. I wanted to touch on this too quickly. I talked about it a little bit. So the labs that I want to look at that people aren't looking at is insulin. I talked about that before. So, A1C, which is my personal A1C. So thyroid, also TSH is not enough. You need to see a full thyroid panel. I need to see a full thyroid panel for my clients. I want to see free T4 and T3, total T4 and T3, and reverse T3, and the antibodies. So I see, whenever somebody talks to me about their metabolism being slow, very often, I would say 80% of the time, their thyroid is slow. And that never gets checked. The T4 gets checked, and TSH gets checked. That's not the whole picture. I want to see more than that. I like to see the lipid ratio here. I can tell insulin resistance is starting if triglyceride to HDL ratio is above 2. So check your labs. And then the HSCRP. So this indicates his systemic inflammation. And then we need to figure out what's driving that. So, and normal glucose does not mean a normal metabolism. So we talked about that earlier. Just because the glucose looks good, there's a lot more to it. So this is and I'll end with this. This is the program that I use for my clients that are having metabolic dysfunction. And I like this program. It's called Shape Reclaimed. It is a structured program that is addressing all of the drivers of what causes insulin resistance, and then eventually can cause type 2 diabetes. And even for someone that's type 2 diabetic, this is a beautiful program for them. So there's 3 phases in it. It comes with a guidebook. It comes with drops, which I can talk to you about the drops here in a minute. It's customized to your health history. So I look into their health history, what they have going on right now, and I can make this program individual for what they need and how their body's responding. There's weekly one-to-one calls. I think people need support a lot more often than what they get. Not just accountability, but let's talk about recipes. Let's talk about food. Let's talk about how are you sleeping? How can I help? Are you constipated? There's so many things that I'm asking people because all of that's affecting their weight loss. They do a urinalysis every 3 weeks, so I can see how their body is responding to the program. And then we learn through the program what foods their body might not be handling well, what's causing inflammation in their body. And we have a lot of touch points, a lot of conversations so that we're learning a whole lot. They're learning a lot about their body throughout this program. So it's an anti-inflammatory diet. So it's grain-free, sugar-free, but it's also low fat because we want the body to have to find the fat stores and burn that as energy. And it does, it works beautifully. Like I said, weekly check-ins and the drops. The drops are, so this program was made by a naturopathic doctor because his wife was in menopause and had belly fat that she couldn't get rid of, and said, I know that you can find something that can help me. So he researched all of why do people get belly fat and why does it stay? And this program, these drops address so many things. There is hypothalamus pituitary adrenal glandular in there. So it's balancing that HPA axis, that stress response. So there isn't the stress response, calms down the cortisol, but also I like them because it helps with I'm an anxious eater. I'm not hungry. I just want to eat if I'm stressed or nervous about something. When I was in school, I remember for functional medicine, I would sit down for one of our courses and I would want to eat. Well, I'm not hungry. I was anxious, so when I am taking the drops right now, I'm doing Shape right now. It just calms my anxiety. There are Bach flower remedies in here. Bach flower remedies are made, they're tinctures that are specifically for anxiety. So it's beautiful at lowering anxiety, but there's also a lot of ingredients in there that are anti-inflammatory. There's activated charcoal, so it's a light detox, and appetite suppressant in there. You want to take them 3 times a day before meals. I love it. I talked to one of my clients this morning. She said, this is amazing. And normally when I cut my calories and I'm in a deficit of calories for weight loss, I feel emotionally hungry. Like I feel like there's bite behind my hunger. And she goes, I don't feel like that with this. I get hungry, but I don't feel emotional about it. I don't feel hangry. I can say, it's time to eat. So she's having she's like, I don't know what's in these drops. So this protocol is built around biology. So whole foods structured around what drives the insulin resistance, right? So a lot of vegetables. So then we're getting fiber in the diet. Insulin is going to be much lower because we're not eating all of these refined carbohydrates that raise the blood sugar. So it changes the inputs, and it doesn't ask for more willpower. It makes changing the diet and making an anti-inflammatory diet much, much easier. So, and it's a lifestyle modification program is how Shape Reclaim, that's what they call their program, lifestyle modification program. So you're learning how to make changes in your lifestyle. It's not just a quick diet so that I look great for my cruise coming up or my reunion or whatever. It's how do I make changes so that this weight loss sticks with me long term. So, and how you lose it matters just as much as how much you lose, right? So I'm always, and this is the same thing that I tell people in GLP-1. I think anybody on a GLP-1 should have a coach alongside of them, walking them through their program. Muscle can come off with fat. Also, weight loss causes toxins to be released into the bloodstream. So I want to help people counter that if that is happening. metabolism adapts. So, there's a lot of adaptation that happens and people stall out. So, and then if you stop taking that, I'm teaching people this in the SHAPE program just as much if they're on GLP-1. So when you're not having these tools, if you don't make the changes, the weight's going to come back on. Where I like a steady loss, 2 pounds per week, 1 pound per week. This is what resets the weight set point. And so protein with every meal, so important. Consistent windows of eating so that you're not getting blood sugar spikes, every 2 hours, and habits that become automatic. So, so this is one of my clients that did Shape Reclaimed. She really, really loved this program so much. She said, I learned what my body can and cannot handle. So she went from size 14 to size 8. And not only though did she lose the weight, which was her goal, but she completely changed what she knew about food and about lifestyle, and it still carries that through into now. And she said, I can work out now without pre-workout. I'm sleeping through the night. I have a lot more energy. Another one of my clients, this was her quote. She said, I've struggled with weight since 1992. After my 3rd child was born, my thyroid seemed to go on vacation at that point, and I felt sluggish and gained weight, and I couldn't lose it for years, even though I tried multitudes of diet plans. And I do remember her telling me, this is the first time that my thyroid hasn't tanked when I've lost a significant amount of weight doing this program. So weight that won't move can be a signal to look further. It's not really a failure in your effort. It's something else is going on in your body that we need to investigate. Again, why I love being a health coach. So we want to look, weight is one outcome. It's not the whole definition of health. So we're looking at all of these things changing as we're getting healthier lifestyles. So metabolic changes, behavior changes like lifestyle, and it will change how you feel, obviously physically, but emotionally. So I don't ever want people to feel shame about where they are in their metabolic dysfunction, or, as they're walking back, so many things are working against you. So I like to take that shame off of people. And then GLP-1, sure, I've supported. I can't prescribe, but I definitely support if people want to do that. But again, I think people need to have someone walk alongside of them. So I like Shape Reclaimed, and people can do Shape Reclaimed along with their GLP-1 if they get stalled out, because there still needs to be changes in diet and lifestyle that they're not always getting with the GLP-1, because they're hoping it just does all the work for them, and that's not going to work long term. So, and as you know, there is the risk of rapid muscle loss, and so your diet matters tremendously. So that's it. So these are the ideas that I want you to carry forward. Remove the blame. Diabesity reflects interacting systems, not a weak character. So, and support your ecosystem. So it matters what you're eating. Your gut health also matters, and build sustainable structure. So I definitely have a lot of tools to help people to make those changes. So the goal is not simply to lose weight, it's to understand the body and build a way of living that lasts.
I like that. The goal is to understand the body and live that lasts. You can catch Kari at KariLockremWellness.com. Like I said before, the full recording is available at DecentMed.org/functional medicine. And for you, Kari, we have been screen recording this, so your screen recording, parts of it will be on LinkedIn to drive traffic to both you and the summit. And I'll also send you the recordings at the end of the summit.
Thank you.
All right. So our next speaker of the day is going to dive a little bit deeper into heart health. Earlier today, we talked about the cardiovascular system and how it plays a role in diabesity, but we did it from an overall scope. Lorna Ching-Carter, founder or of Optimal Root Wellness is coming up. She is on the way. And yeah, so Lorna will be here. I'm going to share with you her website in the meantime. So this is the website for Optimal Root Wellness. Renew your health, root cause care, empowering you to feel your best. Her specialty is not only gut health, but she definitely focuses a lot on gut health and working with the gut. But she also goes beyond that. It's clear, patient-friendly explanations, quality unrushed visits, advanced non-traditional testing, affordable pricing, direct access between visits, and finally support that continues. Unlike some of her other speakers, she does operate in person. So you can visit the office at 170 North Henderson Road, Suite 310 in King of Prussia, Pennsylvania, 19406. All right, with that, Lorna is here. So let's bring her up to the stage. Hey, Lorna. Got to turn that audio on. There's no audio. I can't hear you.
What about now?
There we go. There we go.
Okay. Thank you so much, Sam.
Do you want me to present from my side or just present? You got it. Because I can share it and then you can control access if you'd like.
I want to be able to control the slides.
Yeah, so you have access. Try to click now.
Okay.
Yep.
Okay, good.
All right, you have the floor.
Great. Well, hello, everybody. How is everybody doing? I hope everybody is well. I just want to, today what we're going to do is I am going to bridge the gap and present the link between diabetes and cardiac health and why cardiac health is very important for somebody with diabetes. And then after I do that, I'm going to dive deeper into cardiac health and debunk some of the misunderstanding that's circulating among the public. So here is my disclosure. I have no financial affiliations with any supplement companies or laboratory. And this presentation is going to be for education only. It does not serve as medical advice for the viewers. Okay, so let's dive right in. So diabetes, I want to give you a definition of what diabetes is and what it's not. First of all, diabetes is more than just elevated sugars. That statement is about elevated sugar is not wrong, but it's way more than just having high sugars. Diabetes is also more than just a risk factor for heart disease. What diabetes is, Sam, I cannot, for some reason, I'm having a hard time scrolling. Okay, so diabetes is considered to be a cardiac equivalent. What that means is that if you have diabetes, type 1 or type 2, you carry the same risk as someone who already has heart disease. Now, traditionally, in the healthcare system, there are 4 ways in which a provider will actually screen you and make a diagnosis of diabetes. The first one is a random sugar check. We draw your blood if it's over 200, and if you have symptoms of excessive urination, excessive thirst, you're feeling fatigue, that constitutes a definition of diabetes. Another way is the 2-hour glucose tolerance test. We load you up with something with sugar, like, an 8-ounce juice or something. And then 2 hours later, we check your sugars. And if your sugars is over 200, you have diabetes. A third way of checking it is in a fasting state. We have you fast overnight for 10 to 12 hours. We draw your blood in the morning. If it's over 126, that is a diagnosis of diabetes. I will say that if your sugar runs between 100 and 125, you're in the pre-diabetic range. The fourth and final way is checking a hemoglobin A1C. And that is done every 3 months. And the definition of hemoglobin A1C is glycation. When you have excess sugar floating around in your bloodstream, it is going to stick to your red blood cells. And the A1C is a measurement of how much, it's a metric that measures how much of the sugar is stuck to the A1C. Okay. Those 4 ways of measuring your sugar is not actually very accurate. So what we have to do to be more thorough is we need to include other things. Fasting insulin is extremely important. I have seen people with a normal A1C, hemoglobin A1C, and an abnormal fasting insulin. Because diabetes is so closely associated with heart disease, your typical routine lipid profile, the total cholesterol, the triglyceride, the LDL calculated, and the HDL calculated, it's important, but it is not a complete picture. It is important to ask your doctor to check a more advanced cardiolipid profile. LDL calculated is insufficient. We need to take a look at the LDL particle number. That is the single most important risk factor for cardiac health. And then after we determine that, it's really important to take a look at the different sizes. The small LDL particles are going to be more problematic than the larger size. And then we also have to take a look at your oxidized LDL, because LDL in and of itself is not the problem. It's when it becomes oxidized. I liken to the fact that, rust, when you have a rusty engine, it's not going to work. So oxidized LDL is the portion of your LDL that is damaged. That is going to be the problem. And also with your lipid profile, there is a way to calculate your insulin resistance score. And that becomes a really important marker for risk stratification. Another thing that is not routinely checked is lipoprotein A. That is a genetic form of your cholesterol, and statins do not actually help to lower that when it's up. The third thing that we really need to take a look at is your iron profile, and to take a look at where your iron is, in particular, the ferritin, the storage form of iron, because that in itself can serve as an inflammatory marker. But I have also seen hemoglobin A1C that gets falsely elevated when somebody is iron deficient. And then checking other inflammatory markers like your high sensitive CRP, homocysteine, sedimentation rate, ferritin, the MPO is really important, myeloperi-oxidase, and then the LPPLA2 activity. It really is an indication of how much you're developing plaque in your blood vessel wall. And then the other 2 markers that I like is a CGM, which stands for continuous glucose monitoring. So your hemoglobin A1C, if it's elevated, it takes an average of what your levels, how much of it is sticking to your red blood cells over the course of 3 months. And if it's elevated, we have a sugar handling issue. So the CGM, the continuous glucose monitoring, tracks throughout the day, 24/7, over the course of 14 days, what your sugar is at every single moment during that 2-week period. And so if you have an elevated hemoglobin A1C, okay, well, during what time of the day are your sugars elevated? Is it first thing in the morning? Is it 2 hours after you eat? Those are all very, very important that you can't just detect on routine screening in the traditional sense. And the final thing I like to check for is fructosamine. Every now and then I do use that. Fructosamine is like a hemoglobin A1C, but over a period of 2 weeks. So if somebody has a lot of volatility or a lot of symptoms, I will check a fructosamine to see how much their sugars are going up and down, swinging, and so forth. Okay, so, okay. Next, I want to talk about why, how insulin is related to cardiac health. And this is where the biggest problem is with diabetes. So diabetes is a sugar handling issue. And because you have a sugar handling issue, you tend to have a lot of insulin. Your pancreas is going to put out a lot of insulin because if your sugar is not getting into the target tissue, muscle being one of them, there's a negative feedback going back to your pancreas saying, hey, we need more energy. And the pancreas assumes that there's not enough insulin to get the sugar into the target tissue. So what it does is it actually bumps it up. So insulin does two things. Actually, it does more than two things, but the main two things is that it will jack up your cholesterol and it causes weight gain. So when your insulin is up, your cholesterol is going to go up, your weight is going to go up, and there's nothing you can do about it. So for people who are taking cholesterol, diabetes medication that targets insulin production, well, the side effects to those medication is your cholesterol is going to go up and your weight is also going to go up. Now, insulin also suppresses the breakdown of fats. So fats are another source of energy, and it suppresses ketosis. So people with a high level of insulin, which is why we check it in a fasting state, it is going to be harder for them to get into a state of ketosis, which is using fats as a source of energy. Now, insulin is also a signaling molecule for adipose tissue. And adipose tissue, which is basically your fat tissue, it's metabolically active. It's an organ that secretes a lot of inflammatory substances under the signaling from insulin. So something that is really, really interesting is when hormones stays elevated in your body for a long time, your target tissue is going to become less responsive. And that is true for reproductive hormones, as well as thyroid hormones, as well as insulin. Insulin is a hormone. And that is where we get coined the term insulin resistance. Okay. Now, I'm going to talk about the 4 myths of cholesterol. Cholesterol has been villainized, and there's a lot of misunderstanding of what it is and what it doesn't, what it's not. So the first myth is cholesterol is bad. In a Framingham study, they have found that patients with so-called normal cholesterol did account for most of heart attacks. Cholesterol is the building block for vitamin D production, for our reproductive hormone production. It aids in digestion, as well as production of cell membrane. Myth number 2, having high cholesterol is genetics. The problem is not genetics, because there is no such thing as a heart attack or stroke gene. The problem is the epigenetics. Your lifestyle, your food, the influences, what you do on a day-to-day basis, that will influence how your genes respond to those variables. It has been said that genetics loads the gun, but your lifestyle pulls the trigger. So something is pulling on your genes such that you end up having cardiac issues. Okay. Even for people with family history, we have to take into consideration that, families, they live together, they eat the same food, they do the same activity, they're living in the same household, exposing themselves to the same toxins. So even if you have a family history, is it the family history or is it the environmental factors that's contributing to it? Okay, next, statin drugs are the answer. Statin drugs do not. It lowers your cholesterol, but it doesn't fix the problem. It does provide a false sense of security to people with cholesterol issues, and it actually keeps you in the sick care system. There were some articles that I found. Here. Let me take a look here. Yeah, so I found, where is that slide here? Okay. Anyway, there was an article, 2 articles that I found. One is the Alt-HAT study. And the Alt-HAT study had shown that people, the majority of the people who actually had heart attacks, it didn't, here, let me just, I really want that slide here. I'm sorry. Because I want to reference that here. Let me take a look here. I'm going to pull it up on my phone here. So what they have found is, in terms of primary prevention, a lot of people are hearing that if you take a statin, it's going to lower your cholesterol and it's going to increase your lifespan. What they statistically found is that it only increased your lifespan by 0.16%, which is not statistically not significant. They also found in an Alt-HAT trial that 18% more people died in the statin groups compared to those who were not in the statin groups. Okay. Now, the 4th myth is you can't improve cholesterol naturally. That is not true either. There's a lot of things that you can do naturally that you could actually improve your cholesterol without taking a statin. Okay. Now, cholesterol is actually not the culprit. I stole this from Dr. Jack Wolfson's analogy. I've heard him speak several times, and he talks about how you have a rainstorm, a thunderstorm, okay? And when the rain falls, it's going to fall on your roof, and it's going to fall to the ground. So what happens when that occurs? Every time it rains, the rain does not cause any damage to the house because you have a roof to protect it. It falls to the ground, and what happens when the rain falls to the ground? It makes things grow. So you can think of the raindrops as being cholesterol and your roof being your blood vessel walls. You need to have a strong roof to protect from the rain causing damage on the inside in the tissue wall. But you also need a cholesterol to fall to the ground. You also need the water falling to the ground to make things grow. And you think of the raindrops as being the cholesterol. Okay, so the rain will make things grow in the ground. The roof needs to be strong. Now, you probably have heard, some of you have heard, lower for longer. Some cardiologists will try to lower your cholesterol down to 30. There's no long-term safety data to prove that 30 is better than 90. Not, at least not that I know of. Okay, so homeostasis. Your body likes balance. It doesn't like it when it's too out of balance. Some of the examples is that you have a built-in sympathetic versus parasympathetic nervous system. The sympathetic being fight and flight and rest and digest. Your immune system likes that balance. When we're too stressed, we become sympathetic dominance. That poses a lot of problems. Another example of homeostasis is our immunity. We have a pro-inflammatory and an anti-inflammatory immune system. So when we're trying to fight an infection, our pro-inflammatory immunity kicks in. Once the infection is done and over, our anti-inflammatory kicks in to repair the tissue damage around that infection site. Another homeostasis example is having our sugars out of range. Hypoglycemia versus hyperglycemia. Hypoglycemia, we become very weak and dizzy when our sugar bottoms out. Hyperglycemia, we get ourselves into a lot of problems, long-term consequences. Now, from a cardiac standpoint, oxidative stress needs to be balanced with antioxidants. Many disease process occurs on a cellular level at the membrane, and when things become inflamed, the cellular membrane becomes inflamed. And what that does is that the good stuff can't get into the cell, and the bad stuff can't get out of the cell. So the oxidative stress that is built inside the cells will become very, very problematic because the oxidative stress within the cell produces free radicals. If the free radicals cannot be neutralized by the antioxidant that your body should naturally be making, it starts creating damage within the cell. And that becomes toxic to the mitochondria. It becomes toxic to your DNA. And that is where the epigenetics come in and destroys the DNA and all the stuff that's going on in the cell. The other thing is that a lot of people have oxidative stress that is way, way beyond the scale that exceeds what our body is able to produce in terms of antioxidant. So oxidative stress produces free radicals, and free radicals has to be neutralized in our body. And so when we don't have enough antioxidant to neutralize that free radical, it will neutralize with healthy cells, and that process is called aging. Okay. So the bottom line is imbalances in our body causes illness. Now, the single most nefarious culprit is ultra-processed foods. what they have found is the more carbs you eat, the more progression of heart disease. And the more saturated fats you consume, the less progression of heart disease. So for somebody who's eating a lot of carbs, well, not only are you progressing your risk of heart disease, but your insulin goes up and it becomes more difficult for you to utilize fats. And there's a concept called metabolic flexibility. Metabolic flexibility means that your body has the ability to utilize different types of energy sources. So metabolic flexibility, if you're presented with carbs, it knows to process carbs for energy. But if you're consuming a higher fat diet, it knows how to utilize that fat into energy. The problem with the ketogenic diet is that if you're not metabolic flexible enough, you're not going to be able to utilize the ketogenic diet for weight loss. And that's why a lot of people, after starting their ketogenic diet, within 48 hours, they tend to crash because they're not flexible, metabolically flexible enough. Next. Now, the statins, I do not recommend the statins. Contrary to what is going on in the traditional sense, the traditional healthcare system, I do not recommend statins for cholesterol. And the reason, part of it is because statins will deplete about 10 to 15 different nutrients in your body. And those same nutrients that is needed in your body are going to create mitochondrial fatigue and your inability to create, in a healthy sense, create energy that you need to function. Okay, so the mitochondria is like your powerhouse in your cell that produces energy, the ATP. With the nutrient depletion, I'm going to dive right into some of the nutrients that is really important for heart health. Okay, the first one is vitamin B12. Deficiencies are more common in people with cardiac disease, mainly if your B12 level falls below 140. There are 64 to 74% more deaths among individuals who have vitamin B12 deficiency. Okay. Vitamin A. People who have the lowest level of vitamin A carry a triple risk of heart disease. Okay. Omega-3. An index greater than 8 carries 68% less risk for acute coronary syndrome. A Framingham heart study in 2018 showed 39% risk reduction of heart disease among people with healthy levels of omega-3. Choline, which is found in animal products. It's found in your cell membrane. It's essential as a building block for cell membrane, and it's needed for brain neurotransmitters. It produces something called acetylcholine, and that becomes really important for brain health as well. Now, Dr. Jack Wolfson came up with 4 pillars for a healthy heart. It's eat well, live well, move well, and get rid of toxins. So I'm going to go over briefly each of those pillars that I think would be important to all of us. The first one, eating well. Food is actually powerful medicine. He advises that we all eliminate processed foods and adopt natural foods. He does recommend seafood, meat, organ meat in particular, eggs, and raw dairy, avocado, olive oil, coconut oil, and coconut in any form, nuts and seeds, and cacao. Each of these carry nutrients that is needed for our heart health. And I tell my patients some tips because it's not easy to change your diet. So what are some ways that we can go about eating healthier and adopting a healthier diet? Well, first of all, eat at home. You know what's in your food, and you don't have to put all those chemicals in there. Call the restaurants ahead if you are going to eat out. Do your research and find out, hey, does your menu offer gluten-free options? Vegetarian options and so forth. And when you're traveling, plan ahead. I know for my family, I prepare food ahead of time, and I travel with food in my cooler. So, and then when we do, go on vacation, I will look for places to stay where there's a kitchen, and I look for the closest, healthy food stores where I can shop and so forth. Plan your day. Do not buy any junk food. If you buy it and you put it in your pantry, I'm going to eat it. Anything that's in my pantry. Fasting. Fasting is your friend. Fasting is a natural way to do a detox, to eliminate chemicals out of your body. And I tell my patients intermittent fasting, restrictive eating, so that eating all your meals in an 8-hour window, and then outside of that window, 16 hours, it gives your body a chance to eliminate all the toxins on a cellular level. Eat organically. And yes, organic foods are more costly, but there's ways that we can shop and eat organically on a budget. I tell my patients about the Clean 15 and the Dirty Dozen. Anything on the Dirty Dozen, you should shop organic sources. Anything on the Clean 15, you do not have to. And also look into your drink quality water. Not the tap water that comes out of your faucet. The Environment Working Group has put out a platform where you go onto their website, you type your zip code, and you can actually figure out what is in your public water. And even if you have well water, when you travel, use that platform to see the places where you're going to be staying, what their water system is like. The hotel, talk to them. Do you filter your water? And so forth. Okay. The next pillar. Okay, I think I missed it, but the next pillar is called living well. Movement is really important, and sleep hygiene, sleep regularity is really, really important. Not just getting your 7 to 8 hours of sleep, is sleeping regularly, especially getting good quality sleep between the hours of 12 and 3. That is the time that your body goes through a healing phase. So for people who are sleep deprived or who are doing night shift work, it's important to get that regular routine sleep pattern going in order to allow your body to heal. Now, outdoor time, movements is also really, really important. I looked into the Blue Zone. Blue Zone are places that are reported with unusually high number of healthy people living into there's a higher percentage of centenarians. Those places, there's 5 identified: Okinawa, Japan; Sardinia, Italy; Icaria, Greece; Nicoya Peninsula in Costa Rica; Loma Linda, California. And those group of people live a lifestyle where they adopt plant-rich diets, routine, natural movement, spending time outdoors, having strong family and community connections, a sense of purpose, limited smoking, moderate food intake. Compared to our modern society, our movement, many of us, we go to the gym. And think about what you're exposed to. You're not exposed to natural lighting from the sun. You have EMF exposure. A lot of us are walking around with our phones in our hand. The chemicals that are being used to clean the equipment contains a lot of toxins, and some of us wearing our outfit, fitness clothing, we're wearing plastic clothing. So we're being exposed to a lot more toxins than we realize. But movement outdoor is the best way to get exercise. Okay, movement of toxins. We are exposed to a lot of toxins. We need to get the stuff out of our body. There's 3 routes in which toxins enter into our body: our skin, what we put on our skin, the air we breathe, and the water and the food that we eat and drink. And microplastic, the BPA and the phthalates are huge. It's in our water, it's in our cleaning supplies, it's in our beauty supply, skincare beauty supply, and we come in contact with them every single day. Also, heavy metals. Environmentally, we are exposed to that in our water. Also, people don't realize that when we get contrast studies, MRI with contrast, CAT scan with contrast, we are exposing ourselves to chemicals. In our soil, we are exposed to a lot of mold. Mold is a source of toxins that is making us become sicker and sicker. So with all these toxins that are entering into our body every single day, it is important that we do liver detox, because as these toxins are building up in our body, it is doing a lot of damage to every part of every organ in our body, including our heart. Okay. Okay, think well. It's important to get rid of negative emotions. Many people in our society in today's age, we're very, very stressed out. We go to our primary care, we get antidepressants, medication, anti-anxiety medication. Psych meds are not effective. And the negative emotions, the stress that we put ourselves under, this is a risk for heart disease and stroke. And I even say, with the way our stress levels are in today's age, we're no longer one nation under God. We are one nation under Prozac. And there is a condition called broken heart syndrome, also known as Takotsubo cardiomyopathy. Cardiomyopathy means that our cardiac muscle is sick. It's no longer functioning. So, okay. Now, I have some questions. Some people have some questions to share. So I am going to answer some of those questions. How do you treat high cholesterol without using statins? I actually use red yeast rice and also supplements for mitochondrial support, and also closing that gap of antioxidant needs, because our oxidative stress is much greater than the antioxidants that our body can produce. So there's a gap, and I close that gap by giving my patients the antioxidant supplements containing antioxidants. Next question. How reliable is an A1C used to track diabetes? The A1C is only part of the picture. In and of itself is not reliable enough. I have seen false negative and false positive. I've seen cases where the A1C is well over 6.5, making the person look like a diabetic. But what I found out is that they were also very, very iron deficient. So our red blood cells has a lifespan of 120 days. And when you're iron deficient, your body still needs a way to deliver oxygen to your target tissue. And so the red blood cells try to stick around beyond 120 days a little bit more. But with sticking around for a little longer, you're going to have more of those glycated red blood cells sticking around, floating around, and that will actually falsely elevate your A1C level. So, okay. Explain why high blood pressure is bad. High blood pressure is your body's way of maintaining homeostasis. As I mentioned before, blood flow is necessary to deliver oxygen to the target tissue. And so if every single day you got the blood flow, you're exposed to the mechanical shearing of the blood pushing through the blood vessel, as well as the chemical toxins in your bloodstream coming in contact year after year, your blood vessel wall, the integrity starts to break down. And so it's between the chemical exposure as well as your chemical exposure as well as the mechanical shearing that actually will cause more and more damage to the health of your blood vessel wall. And so therefore, your body's trying to maintain a homeostasis, and with more and more damage, it's going to do some vasoconstriction to try to maintain normal blood flow. Okay, last question. I've been told that my high blood pressure is due to genetics, but it does not make sense that it spiked over the past few years, but had been previously normal. Please elaborate. So I have people that come in that will tell me, okay, my blood pressure has been running 120 over 180 when I was in my 20s and my 30s. I was a little stressed out. So now my blood pressure is more like in 128 over 89. But just in the last 5 years, my blood pressure has gone up a lot. What is happening here? So in a traditional sense, the healthcare system will tell you that, oh, it's all genetics. When they don't know what is happening, they just, blame it on genetics. It's actually disease process do not happen. It happens over a period of time. And by the time you have symptoms, that's usually at the end of a disease process. Disease occurs very silently over time. And so there's a lot that's been happening over the last 3-4 decades with, the toxin exposure, the stress that we're under, all the inflammation that's happening in our body is causing this mechanical and chemical damage to our blood vessels. And so with years and years of pounding against causing this damage, is no wonder that eventually things will break down and your blood pressure is going to go higher and higher to maintain homeostasis for oxygen delivery. They have found that blood vessel wall damage begins in utero. And doing an endopath ultrasound to take a look at damage to your vessel, they have found evidence of damage to the blood vessel as young as age 10 in a person. So another question came in. Explain why calcium score screening is important. So calcium score screening, what that does is it takes a look at calcium deposits in your coronary artery, because the more calcium buildup, the smaller the lumen of the diameter of your blood vessel wall, less blood flow can get through. So calcium score, the higher the number, the more hard plaque is built. And so that is part of the risk factor that is used to determine where you stand. So, Sam, I think I am finished unless there's more questions. Okay.
Hey.
So if you have any further questions, people can get in contact with me. I do offer a free discovery call for 20 minutes. You can just, go onto my website, push on, click on that link and schedule that. And then we can spend some time. I can answer all your questions, to take a look at a little bit briefly at your situation, your health issues, and, go from there. So, Sam, I think I am finished. Unless somebody else has more questions. Okay. Sam? Okay. Okay.
Yeah. So I just want to recap for the last 10 minutes on what Lorna talked about. So the first thing I'd like to talk about is the younger generation, 15 to 25. 15 to 25-year-olds typically have the problem of mental health related issues. How does understanding their heart health and their relationship between blood sugar and obesity play a role in mental health issues related to the youth?
Well, a lot of it is neural inflammation. When your body is stressed, your brain is part of that body. Yeah. So it's really important to control your inflammation in your body. So when you have an inflamed gut, you have inflamed organs, your blood-brain barrier becomes compromised, and all the chemicals that you're being exposed to are going to go into your brain, and that is going to impact your level of how you function neurologically. I have a lot of people that would tell me, I cannot do the things that I used to be able to do. And we're talking about young people in their 30s that are, reporting brain fog, memory loss. Memory loss, dementia used to be a disease of older people. So if you started having symptoms in your 60s, like 67 was considered young, I am starting to see signs of dementia among people as young as 30. And a lot of that is because of the chemical exposure, the sugar. Sugar is very, very inflammatory and toxic to our health. Not to mention the insulin, the effects of insulin, but the sugar alone is very inflammatory.
And is this dependent on sex, or is it both sides?
It's both sides.
Wow.
Yeah.
So what if you were to give one advice for someone that's 15 or 19 years old? They really aren't thinking about their health that much. They're probably eating poorly, because I remember when I was in college, I ate poorly. But what advice would you give them?
Well, you need to change your diet big time. I think it's important to, well, a lot of it is your mindset too. Like, how committed are you to change? We eat to live. Too many of us are living to eat. We're addicted to foods, and we're addicted to sugar, and we're just kind of letting that continue day after day. Which is not good. I would say to work with a functional medicine provider who could help you sort all this stuff out. I personally will spend about 2.5, 3 hours with a new patient, because I want to educate them. I want to help them to understand what is going on inside, and to help them to really, truly understand why they're having their kind of symptoms. And when you do have that knowledge and understand, that empowers you and motivates you to change. Yeah.
It's interesting to that point, because as kids, we go to the doctor, right? But there isn't a trend of sending your child to see a functional medicine practitioner just for checkups, just to improve their health. As we age, we're prone to go to see a doctor, see a pediatrician, and prioritize our health as children with the traditional medical system. But we aren't trained to go to an acupuncturist, or to see a chiropractor, or a nutritionist, or a functional medicine practitioner. And when you think about diabesity and this crisis that we are seeing, especially among children, and I think you probably see kids in your practice, why do you think that is?
I think it's also because we're so used to utilizing insurance and just paying a copay. I spend so much time with my patients that I just don't have time to talk with insurance companies. And so that's one thing. The other reason is because I don't think that our society as a whole is forward thinking enough.
Yeah.
The little bit that you invest today in your health, you're going to be dodging huge problems down the road. You're not going to be faced with nursing home and big hospital bills. And even if your insurance, covers all that, I mean, it's just not quality of life.
Yeah.
Yeah.
That's very true. So how do you think that we can fix it?
We can't.
Well, I will say this, what we're trying to do at DecentMed
Yes.
is we're trying to create a new insurance system. Because to your point, that's where it boils down to. It boils down to insurance, because especially where we're at right now in society, we are in a recession, whether the news wants to admit it or not. We're venturing into a deeper recession economically. People are losing access to healthcare. They're going to lose access to insurance. So as more and more people lose that, the balance or the advantage that traditional healthcare had over holistic and functional medicine will drop, because people will learn, oh, wow, I can see Lorna for much less than going to a traditional doctor with insurance. So I think that's part of it. I also think that people, and we've talked about this in multiple summit presentations today, I think that people need to start taking charge of their health and stop putting their health in the hands of doctors and others. And how do you help your patients take charge of their health?
Well, I empower them with a lot of education. There's a lot of support between visits. So if somebody has a question or don't know what to do, we try to troubleshoot things. And from a resource standpoint too, I try to be very mindful of cost. I discount all my products when people come in to see me, so that it helps them to become more affordable. And individuals, I think a lot of it is also education. When people understand their symptoms, why they have the kind of problems that they do, and if they understand what they have to do, I think it kind of motivates them.
Exactly.
To take steps. I mean, this is not something that could be fixed overnight, but it's a process. It's a commitment. And I know that that this works, because what got me started in functional medicine was my own health issues. And I was not getting the solution. And I just did a lot of research on my own. My doctors told me that, there's nothing you can do. It's your genetics. I wouldn't settle that for, I pulled myself out of it. And so I know that it works. And so not only am I speaking from clinical experience, but also from personal experience.
And I think that's what separates traditional medicine from functional and holistic medicine, is in a lot of cases, and this is across the board with our different modalities, is with the stats being as jarring as they are, 830 million people, that's almost 2 times the United States, or I think that is 2 times the United States, dealing with diabetes, 1 in 9 adults living with a condition.
Yeah.
It takes people saying, well, I tried XYZ and it didn't work, so now I'm going to try functional medicine. Now I'm going to try energy healing or acupuncture or chiropractic or functional nutrition or whatever it may be. And really our goal is to switch that to, instead of I tried everything and it didn't work, to I am trying this first. And then you can go with others, because the reality is we need both. If I break my bone, I'm not going to go to see Lorna. But 80% of diseases are attributed to diet and lifestyle. And a lot of diseases that people are chronically living with, where they're limping to the grave almost. They get to retirement age and they're not enjoying retirement because they're in a home or their health is fading. That is where someone like Lorna, like Kari, like Angela, like Lori, like Dr. Loomstein, like Dr. Volner, who is going to close us out, they can help you with your problems. But I think it starts, like you said, it all boils down to education. And that's why I highly encourage people to look at this slideshow. It will either be available on our website at decentmed.org/functional medicine, or we'll put it on optimalrootwellness.com. That's a conversation I'll have with Lorna off platform. But these are things that are extremely impactful, and they're easy things to do. I mean, you look here at tips, eat at home, because I know that when you eat out, you don't know what oil they're cooking with. You don't know who's making the food. And, that's the other thing I found is call a restaurant and say, I'm allergic to soybean oil. I am deathly allergic to these oils. Can you cook something else? And if they can't, then don't go. If not, because people need to make these restaurants aware. That's the problem, is that people just accept the fact that a lot of these restaurants are filled with toxins and toxic oils. And then it's all about mitigating your sugar, eating organic. And I like that point about fasting, because I do intermittent fasting. I know Angela talked at the beginning of the day that intermittent fasting for women differs, but I highly encourage that. But with that being said, we're going to bring our next speaker to the stage. Lorna, thank you so much for joining us today.
You're welcome.
So our next speaker is Dr. Teresa Volner. And I don't know if she can make it, because I know that she is running the office all herself. So I'm going to pull up her recording. And Dr. V, if you can join us, we would love to have you. Dr. V will be at our roundtable at the top of the hour. So she will be there for that. I'm pulling up her recording now. Oh, wait. Let me see. Is Dr. V in here? Okay, Dr. V is here. Okay. I'm trying to find your recording, but it was sent to a different email, so I'm trying to forward it to myself. All right, let me... All right, so I'm pulling it up now. And if somebody can please just verify the audio. Here we go.
Hello and welcome. We are going to be talking about how DNA is affecting your weight loss goals, your success or failure in it, and especially those who have had problems with their weight since childhood. Most of the DNA research has happened then. I am Dr. Teresa Volner. I'm owner and founder of Total Care Chiropractic in Overland Park, Kansas, as well as Total Care Health Solutions coming online. Woohoo! This is for educational purposes only. You need to consult your healthcare professional or a geneticist or specialist like myself in order to get to the other side. We also do DNA testing, advanced DNA testing. We'll talk about that later. I will share my screen. Okay, looks like that is happening. Good. Weight. Why is weight loss so difficult for some and easy for others? It's a real struggle, and it's amazing to find out it is really DNA driven. Again, I'm Dr. Teresa Volner, Total Care Health Chiro and TotalCareHealthSolutions.com. Invest in yourself during this time so that you can have some absorption of what we're talking about. And boy, you never really get a break anyway. So welcome. You're here because you want to know how to fix your weight, your blood sugar, or prevent these things from tackling you. So it's super important that you block out all distractions and give this time back to yourself. Is it just food choices, TV, exercise, parents, chemicals? Are we at the mercy of our environment? Do we, some people, we know people like this too, could eat as much as they want and never have a problem, and whatever they choose. And others, we have to measure everything. And it seems quite unfair, but let's dive into what it is not. Because we've been told, you go to the doctor, you get a diagnosis of pre-diabetes, and you're like, just lose weight. That's all you hear. Just lose weight. Go talk to the dietitian. Just lose weight. And when the dietitian meets with you and they go over your plan and then you come back not losing weight, they go, you must have cheated. Everything I taught you works. It works all the time for everyone. And this is not true. She'll say, or he'll say, you have a lack of willpower. You're binging at night. You're greedy. You have a greedy stomach. You're just having too much. No self-control. And it's your fault. Everyone's putting it back on you all the time. If you knew what I knew, you would have better tools to make choices, because you don't know how your body is reacting. And these messages that we get through our entire lifetime, gee, I still cringe just a little bit when I remember that my brother said how ugly I was all the time. Of course, siblings, we're ugly, we're mean, we're just everything to each other. But no one else can talk to each other like that. But we carry this. It stays with you, the shaming, and it's very devastating. And it affects your self-esteem in other areas. And once you hit menopause, that weight retention and the weight regain, even if you lose weight and you just cheat a little or change what you're doing, then you have a predisposition to face up to double the rate of weight regain, because menopause, hormonal transitions, naturally accelerates visceral fat accumulation. And that's the fat that is around our organs. So, acknowledgement. Someone else told you these messages, your friend shared it with you, or you've heard others being told these messages. You needed these tapes in your head yourself. Forgive yourself, forgive the others, because you have to let go of the resentment. Resentment creates inflammation, and we'll talk about how inflammation is affecting too. But this is not our message today. Put it away. Explore a different narrative. For what we really need to know is we're moving from blame to biology. And we'll find out more about that. How do genetics impact weight? This is our new narrative. And we're going to go through some core concepts about genetics so you can get an idea of why it's so cool. And it's been studied for over 20, 40 years now. And genetic testing in medicine is not new. We test for the BRCA gene for breast cancer. We test for cystic fibrosis genes in those who might inherit that, or sickle cell. We test genetics all the time, but only one at a time, and it's quite expensive to have hospitals do this for you. So the core concept is about heritability. Are you inheriting everything from your parents, your grandparents? And what can you do about it? This nature versus nurture. So nature is your genetic heritability. We'll talk about genetic variation in a moment. But nurture is your environment. Were you raised in a sedentary household that drank a lot of beer and ate a lot of ribs? I'm not sure. That maybe you grew up in a household where there was no television, no one ever sat down, and it would have been a different environment for food as well. And maybe you eat out all the time because no one's at home. You're always going to the ball fields. There's so many different nurture aspects, but we're going to see the difference between what nurture contributes to weight challenges and what nature, your genetics, contribute. So DNA variation is, and we'll talk of it as a blueprint. It's your map. And so your mapping of your genetics, 99.9% of your genetics is identical between all of us. And so in 2003, the research expanded our understanding of the code, the DNA code, or your genetics. And it's a language. The draft of this was like a language of letters, like the alphabet. But in our alphabet, we have 26 letters. In other cultures, there's more letters or less letters. But in genetics, there's 4 letters. And these 4 letters pair up in different ways. Either CC, CT, TT, A, G, AA, GG, etc. There's these different combinations, and this genetic combination is our alphabet, and we write with this blueprint who we are today. We use these genetics to make amino acids, proteins, enzymes, hormones, our brain messengers called neurotransmitters, and it defines how our body works. Some things can be different. So in that 0.1%, we differ. And it means our spelling is different from each other. And then the significance of that is there's 3 to 4 million places in our DNA that has these spelling changes. So it's a lot. And sometimes we use the words mutations. It has kind of a doomsday effect on our brain thinking about this. But it is not really doomsday. It's just we didn't have all the information. We were not born perfectly perfect. That 99.9% that we have fingers and toes and hair and eyes. But we have these 3 to 4 million places in our DNA that are different. And here's an example of how one spelling change can make a huge difference. If you are trying to take your coat to the cleaners, but someone thought you said goat, and you end up with a very clean goat, but I'm not sure that's what you want to wear tomorrow. This idea of nucleotide spellings can change how something functions in our body. And so for myself, I have a spelling change in a gene that affects how I can consume dairy products. And so now I can't. And but that gene didn't trigger until after I passed puberty. And this is an interesting point. That type of change in the spelling changes means that I now have an inefficient function in how I process an amino acid or protein in milk and sugar in milk and everything in milk. So the spelling changes mean we have efficient function in pathways, but we also can have inefficient function in different pathways, including how we detoxify our body from food coloring, air pollution, toxicity to paint, smells, and things like that. And it can change the way everything works in our body. And a simple explanation of a complicated system is never good. When you hear someone say, all you have to do is fast for 18 or 20 hours a day and eat only 4 hours a day, not everyone can do that. Matter of fact, it is a genetic change that says this particular person cannot fast or you'll land that person in a hospital. And so just having one explanation to solutions is dangerous for some people. And that's why those of you who have had such a difficult time are challenged about these pathways and how they function. And so the understanding of that 0.1%, what does it give us? More knowledge about ourselves and how our own body functions. It gives us insight into who we are and how we respond to the world around us. And this genetic expert, Dr. Yael Jaffe, and I actually do my testing through her lab, so you're aware. And it's genetic testing, of course, very private, not revealed to anyone else. Just so you know, the safety is very high on our list when we're dealing with our genetics. And so this understanding, self-knowledge, now that I know what my body is reacting like, and I'm not just throwing the latest media knowledge at my body, I don't have to worry about, should I fast? Should I go on keto or low carb or high fat, low fat? What should I do? This self-knowledge now is more available than at any time in history, and I believe it will become the future of our medicine. So that 0.1% is triggered and turned on and off concerning our environment, the world around us. And so everything we do in our day, every millisecond of our day, is affecting those genetic, that 0.1%, the food we eat, the calories we eat, the air we breathe, supplements we take, how we get into cold water or not. I tell you, even in the summer, it's hot as can be outside. Do I want to get into a freezing cold swimming pool? Very slowly. Whereas someone else, like my husband, he's a fish. He can jump into cold water in cold weather. He just loves it and his body responds well. Whereas my body would respond with a severe headache. So there are different things, the resilience of our body, how we respond to traumas, everything in the world around us is affected by that 0.1% and how our body can process that information. So how we respond with everything we encounter is a representation of that 0.1 genetic variation. And so then we look at another term called epigenetics. And this is still part of that genetic code that doesn't change. That's that 99.9% that in our alphabet of A, T, G, and C. Our code itself doesn't change, but epi means above the code. Epigenetics, that 0.1%, is still 3 to 4 million switches. And how the genes are switched on and off is kind of like how we turn on a light switch. We eat something, we trigger a switch in our gene, it makes a protein, and then the protein does something in the body, and it's super fantastic. I find the more I know about this body and your body and how the world works, it is miraculous. And it's super hard to get sick if everything is working good in your switches. So I love this information and how we could find out. And all these epigenetic influences are surrounding this person, how you're exposed to disease, how your body responds, how your mood states are affected, toxins, how they bombard your body, how your diet makes a change, and the percentages of how each one of these things affects us is part of that epigenetic switch, turning on and off genes. I personally had cancer when I was 23 years old. Scary, scary, scary. Just got married, and I had invasive cancer into the uterus, which means it would have been difficult for me to have children. And the prescription at the time was to remove all of my parts. Well, I wanted children. So, of course, I went for second and third opinions and landed with solutions that were working for me. I'm here. I have 3 grown children. I'm excited about them, loving children. But it was scary at the time. And how was it that it was so easy for my body at such a young age? And that was influenced, and I've only been doing genetic testing for about 6 years now. But the genetic influence was overwhelming. Once we started doing DNA testing and being able to map out that influence, it was easy to see how I genetically am predisposed to getting cancer. I have not had a repeat of cancer because once you know what to do with your body, then you can stay well. You can help assist your body in the deficits it has and supplement them and change some of the things you do in your lifestyle in order to complement your own personal DNA. And having a geneticist, a specialist in genetics, help you define that. And if you've had genetic testing before but don't have it specifically connected to your health, perhaps we can take a look at that test too and see how it applies. So epigenetics is about choice. Things we do in our life affects if those switches come on or off. And you want the good switches on and you want the bad switches off. The switches that cause heart disease, stroke, brain deficits, cancer, Parkinson's, all of the things that could happen. You want those things to turn off, and you want the good switches that are protective against diabetes, that are protective against IBS, that are protective against autoimmune diseases and cancer. You want those to turn on. So our genetics plus our choice equal health. And what we expose ourselves to can change those gene switches. And even things we're unaware of. Perhaps you've moved into a moldy house and all of a sudden your health decreases and you can't find out why without more tests. And boy, I tell you what, for mold, I had radon in my house. And once we put in a mitigation unit, I saw up and down the buildings, what does it look like, this mitigation unit? All the other houses had them. And the house we happened to move into didn't. And it was affecting my health because, gee, I have to be paying attention now that I know my genetics. And so all the other things that we choose, smoking, excessive alcohol, recreational drugs, the food, the exercises, the relationships, anger, resentments, frustrations, change the chemistry in our body, thus changing epigenetic switches. And there's 3 to 4 million of them, but guess what? Health and weight have this thing in common. Genetics plus choice also equals how our weight is affected. So it's the same formula, the same journey. There's so much research. And so we're going to talk about leptin in the mouse. There was a mouse called the OB leptin mouse, and it was missing the leptin gene. And when you don't have a high functioning leptin gene, and leptin is a chemical in our body, our brain releases that says, I'm content, I'm satisfied. If you do not have that, or it's very low, you can eat and eat and eat and eat and eat and not feel full, not feel satisfied and content with your food. And so they took this OB leptin mouse and injected leptin protein into the mouse, and it changed the outcome. And the trigger only occurs when you're exposed to food. When exposed to food and you feel you're never satisfied, you have a deficit then in this leptin gene. And small children, when they find this out, that when they're excessively overweight at such a young age, 2, 3, 4 years old, they start injecting leptin protein and it changes the outcome for the child. So that's a whole different research. And then what about our parents? Did what our parents eat contribute to that deficit, that challenge? And so they have another mouse that they did research on, the agouti mouse, and it did not have enough B12, B6, B2. It did not have B vitamins in it. And so the epigenetics of a lack of B vitamins is affected by diet. And so this agouti mouse would eat and eat and eat and not process and be inflamed. And it created a lot of inflammation. And nerve damage, B12, B9, are definitely related to the nervous system, B6 to allergies, B2 to tremors and other things. And so when the agouti mouse had a baby, that baby would inherit this lack of B vitamins, and that would affect their ability to process homocysteine and inflammation, and would be more easy to gain weight. And then what about twins studies? They have the best information for showing us how environment is affecting your health, your weight. And so 2 mice given the microbiome of twins with different weights, because they have the exact same genetic pattern. And then the microbiome determines if we become overweight, because the 2 mice that were identical, one with the microbiome from the intestines of the overweight twin, and not obese, but just overweight, would then lead the mouse to become overweight, even though the mice were given the exact same foods. And so weight is a very, very complicated issue. The genes you're born with affect it, the epigenetics from what parents ate, and then the microbiome effect of epigenetics, because the microbiome then is triggering also those genes to turn on and turn off. But even in the same family, is nature affecting genetics? Or nurture is everything we do in our life, our TV, our exercises, our mood. And so the code doesn't change, but some of the things, even in the same family, are affecting that. So who's to blame is always the question. You go to the doctor and the doctor says, it's your fault, you're eating. Your dietitian says, it's your fault, you're eating. And they create a lot of guilt. And then you're like, but my parents were overweight, so I just inherited this and I'm doomed to this. Are your parents responsible? And so it's so cool to see some of our research, the evidence for strong genetic influence on childhood obesity and adiposity. So that's just another word for fat deposits. Despite the force of obesogenic environment, only 10% is not genetic. So then your parents, they feel guilty. Well, I'll tell you what, guilt is horrible for us parents. Could I have done something different? Could I have fed something different? Could I have caused them to go exercise more? We were in a tough neighborhood. All those things we blame ourselves for. Only 10% of the influences of weight is not genetic. So give yourself a little break and let's move from blame to biology, because 90% is genetic. 90%. And that's a little convoluted to some degree, because in that 90%, we have psychosocial issues, we have other environmental issues, but only 10% of our weight problem is not genetic. So what part is genetic? So hair color, definitely part of that 90% genetic, but weight specifically is in a range. So when somebody says a specific number of 50% is your genetics, or whatever combination they try and give you just one item, they're leading you astray, because the weight problem can be from 40% to 80% genetic, because each person has a different combination of those epigenetic switches. And that's back to that 0.1%, where there's 3 to 4 million different epigenetic switches. So which one is yours? Your inability to exercise and get success, or your inability to have methylation from B vitamins, like the agouti mouse? One diet isn't good for everyone, and there's no magic bullet. That's why when you have such difficulty and you try and try and try to lose weight and it doesn't happen, you find this truth that it's much more complicated. And so where do you fit? The research shows that there are 4 groups of people in genetic testing, in genetics research. And so there is, we'll talk about the top one and the bottom one, and we'll be very disappointed about when we talk about this bottom one, people who are genetically resistant to gaining weight, and they remain thin. Matter of fact, they can be so thin that they look sick. And that challenge is where they're trying to gain weight because they have had such a hard time holding weight on their body, and their clothes are constantly falling off. They can eat anything they want and still remain thin. But their challenges are just as much as the top person who is genetically sensitive to obesity. And it's part of medical genetics when it's genetic obesity and you can't lose weight, that you're just trying to figure out how to stay healthy through the challenges of medical obesity. So the top one and the bottom one, the genetically resistant to weight and the genetic obesity are both very rare. This is only 10 to 15% of the population. So let's look at the 90% of the population. So there is a strong predisposition for a lot of us to have weight gain. It's matter of fact, it's easier to gain weight than it is to lose weight. And I fit into this category. I can gain 10 pounds in a week. It is not hard for me to gain weight, and it's really difficult to lose weight. And so having a predisposition to diabetes and hypoglycemia and all kinds of cancer and all kinds of genetics I have, having that predisposition to that strong weight gain resistant to weight loss has been quite a challenge forever. But then there's those who only have a slight predisposition to weight gain. So when they gain weight, it's easier to lose weight. And so they rarely move into obesity because it's just easier for their body genetically to lose weight. And these are the four main categories in the research. And so here's another research study done in 2005 in Japan. And it was 154 Japanese men that were just overweight. They were not obese and they were not too thin. They were just a little overweight. And for 2 years consistently, so these low sodium diet. And they required them to do more than 1 hour of exercise a day to get at least 20,000 steps equivalent. So they did excessive exercising. And if you think 10,000 steps a day is hard, 20,000 steps is way hard. And to get that aerobic quality exercise is crazy for a whole hour a day. So the results of this research of that 154 Japanese men, they all complied with the program perfectly. There are 4 outcomes. 24% of them lost weight and maintained it. This is our perfect outcome, how we would always love to experience our relationship with weight, is to be able to lose it and maintain it forever even. But 23% of them lost weight in the first 6 months, but they rebound and gained all the weight back by the 24th month. And so some of that would create huge challenges for us when we try and try and try over again. Most of us have lost 200-300 pounds in our lifetime because of that yo-yo effect. And then 39% were super slow, very slow at losing weight. Matter of fact, their first 6 months, they did not even get half of the way. They did not even lose much weight that first 6 months. And then at 24 months, they reached the same weight loss as group 1 and maintained it. And so if I was working on a program and I didn't lose very much weight in that first 6 months, I would want to give up. And of course, this is Japan, so no one quit the program. But even at 6 months, I would not have even wanted to go the full 2 years. But if you maintained this behavior for that 2-year mark, you would have lost all the weight and maintained it. This is even more interesting. 14% did not lose any weight the whole 24 months. And I don't know about you, but I definitely would not have lasted past 6 months, but I would not have stayed on the same plan for 24 months. But in their research, this is what they found, that in these men, there were gene variations, that 0.1%. And so we're going to talk about the genes in a little more detail, but you can see how having genetic testing is beneficial when you have challenges in your weight loss, and what can you do about it? Because there are things you can do, and working with an expert to map this out and help also encourage you to keep working at it. Because even if you're in that last category that you don't lose weight at all, we can use the genetics to help support your body to remove or to lower the risk factors that come with added weight. The risk factor of cardiovascular disease, cancer, diabetes, those things. So some of the genes, the adrenergic, it's your adrenal glands, they resist and rebound again, or the weight loss with exercise. And so there's challenges to some of that. There's also increased appetite and a snacking behavior that comes with the MCR4 gene, and then increased fat storage. So your body may be one of those bodies that makes it easy to store fat and slow to lose it. And then you may lead to binge eating or addictive behavior with the DRD2 and then the FTO gene, which is increased weight with inactivity. So the advanced DNA test, we all lose weight and gain it back, maintain it in different ways. Testing reveals how we respond to our environment, that 0.1%, and it's different depending on the genes each person had. Genetics affect behavior and choices as well, because if you have that gene that wants to snack all the time, it's our relationship with our food. Then we deal with what are some steps we can take to help support that. So the epigenetics determine how our relationship is with food, satiety, which is that sense of feeling full and satisfied, and then hunger. Some people hunger very slowly, some get ravenous, and then some can eat a cheeseburger and feel content and satisfied, and some people need 3 or 4 and still don't feel satisfied. And then our ability to release fat and fat stores also change how we deal with our weight. And those of us who gain weight easily in our arms and legs, but we don't gain weight in our body, actually reduces the amount of disease processes we have, because we're not gaining weight in our visceral organs, hindering liver function, hindering pancreatic function, hindering how our body is operating. But if we gain most of our weight, our fat storage in our body and around our organs, we are more prone for disease processes. And then when we do maintain a fat storage, we also increase inflammatory reactions. And when we have an increase in fat cells, we have an increase in inflammation and white blood cells that are roaming through our blood, creating more problems. And then that energy expenditure at rest, some of us run at a higher metabolism. And then during exercise, some of us can boost that metabolism, but not all of us can use exercise to maintain our weight. Weight gain and weight loss resistance is very rare. So that those two categories where it's extreme, where we can never lose weight or we can never gain weight, those are extreme conditions and do require a little more intervention. But most of us can work with our genes. Now I'll work with the first fat gene here that was found. And we call that the buffet gene, kind of, the FTO gene. And it's how we respond with food when we're exposed to it. And I have this gene, and I could go to church potluck and have one of everything. maybe 2 of everything, have 3 of everything. When we're exposed to food, our body has no limits. And the locus control around food, it's decreased by exposure. You ever go to the boardroom and they put donuts or bagels or something out in the middle of the table, and you know this is not something that is healthy for you, or your body has a negative reaction to gluten or whatever it is. And you just sit there and you sit there and you sit there during the meeting and you're smelling it and you're like, I just can't control myself. Your locus of control around food decreases by being exposed to it. So having no food at the table is easier for you if you have the FTO gene, but others can get one plate and feel good. And so some of the spelling changes in our DNA epigenetics, the TA combination can't control at all. And then there's the TT combination that has more control. So the change in behavior to control is genetically predispositioned. And so there are techniques around this FTO gene that help you succeed if you have that gene. The MCR4 gene, it's melanocortin 4R gene. And so it creates greater hunger and less fullness. It's like you have a greedy stomach that is never content. And so the FTO and MC4R gene, the research has been going on with this for decades, especially in children, because that's when we start to see the effects of that hungry tummy, that hollow leg, you may say. And so you can lose the shame around weight challenges because it is genetically driven. The DRD2 gene, and there's several of them, DRD3, DRD4, they're dopamine receptors. And dopamine is a brain messenger, a neurotransmitter that is our feel-good hormone. And so it can be stimulated by several things. And it's one of the genes also that lead to addictions. But not necessarily just talking about drugs and alcohol, but even food addictions, carb addictions. But there's other ways to stimulate neurotransmitter dopamine to feel good. So when we do something that feels good, we are stimulating it. So when you dance, when you watch a hilarious movie and laugh, when you feel satisfied after you eat, you are stimulating dopamine. And so carbs stimulate dopamine. So that's why that's the first thing we have when we're having a tough day is that carb or sugar, because that's what sugar is, what the brain eats, glucose. And so it's like, I'm not feeling happy. I want to feel happy and content. Let me have a cough drop. It's technically a medicinal thing, but it has sugar in it. Let's, have a little bagel or something. But if you get up and do some jumping jacks, that will also stimulate dopamine. And it's related to addiction behavior. We call it comfort food. We call it cravings. We call it a lot of things, but it can be leading towards addiction. So other ways to stimulate dopamine receptors, you can use exercise, meditation, you can dive into cold water. There's other ways to stimulate dopamine for satisfaction and contentment and happiness. There's a gentleman who did a whole research project on what makes people happy research. The PPARG, it is a genetic switch that is our thrifty gene. It helps you consume energy in large quantities and store it for a very long time. So this is kind of the hunter-gatherer gene. You're not near food. You live in an environment that has drought and scarcity. And so then when you eat, everyone finds a huge amount of food all at once, or you kill a deer and feed it to the whole environment. The gene, when you consume energy, you store it and then you hang onto it because you're not going to get fed for a long period of time. And so then you can survive in scarcity. But it doesn't help us when we live in our cities and we're next to McDonald's and you can call DoorDash and get food delivered, and there's an abundance of food. And so especially in the United States, we have a challenge with obesity because we have plenty. So when you have this particular gene, especially that C spelling change in that gene, you have a really hard time losing weight. So knowing what your genes have is so important. And you're thinking, well, genetic variation, it should change. Evolutionary biology says it takes between 184 and 1,840 generations for a human population to undergo a meaningful genetic change. Genetics don't change, and they don't change fast. I come from a creationist background myself, and I believe you are created amazing as you are. But what part of that creation do we need to support in our behavior is part of my research. And so it's pretty awesome. Genetics don't change much at all. And we need to support our genetic variations. So that ADRB2 gene, the adrenergic receptors, can I burn calories easily while sitting? And sometimes you might see someone who is a little ADHD and they're tapping their feet, they're constantly in motion. They're creating a whole different way to burn calories. But those of us most of us are at sedentary jobs, sitting at least 8 hours a day, and then we go home, cook, and sit more. We may go to the gym for a half an hour, but that half an hour is not making up for our calorie burning capability. If we cannot burn calories efficiently while we sit, then we gain weight. And that's how that adrenergic receptor is affecting us. And then inflammation. The more fat cells we have, the more inflammation we have, the more white blood cells are around those fat cells, waiting to munch up anything that should not be in our body. And so when we gain weight, we gain inflammation. And it's almost impossible to lose weight when inflamed. So when we have a difficulty in our genetics for reducing inflammation, like the MTHFR gene variation, what can we do to lower that inflammation to lose weight? So unlocking weight loss by lowering inflammation for those who have methylation challenges and other challenges in inflammation is the key. And there's the tumor necrosis factor alpha gene, specifically when that one, it's like the granddaddy of inflammation. So we must drop the inflammation to lose weight if we have this genetic variant. So the struggle in weight is real. The advanced DNA test helps you to understand your genetics, your genes, and how they're affecting your body. And then we can help you create and manage the best intervention for your body. If someone says that 18-hour fasting is your perfect solution, or to eat only 10% carbs, or they have the perfect diet for everyone, run away fast, because it isn't true. There is this blanket of research that can say eating a little healthier might help everyone, but we are all different. We have personalized solutions for each one of you, especially when you've had such resistance to weight loss. What we can examine as well is how can you support your body with supplements and such in order to create more success and reduce your overall health challenge risk. So here's a picture of me with my mom. and my sisters. I have a brother too. And as you can see, we inherited a lot of genetic challenges, but one of them is dopamine. Even my sister told me one time, I'm eating bread. Don't tell me to stop eating bread. I love bread. And that carb helps to stimulate that dopamine receptor. And so we have dopamine challenges in our family. And it's a challenge then to stay in control of our weight, because that craving is never going to go away. And there's different things that we could do, but if you have to be willing and on board. And when you're here learning about this stuff, you are willing. But my sisters are great. They're so intelligent, and do amazing things for the family and for their families. So it's not a reflection on them as human beings, just saying. But even myself, it has been so hard to find tools to help me stay in check with my weight. So even starting using a continuous glucose monitor recently has helped me lose 14 pounds, just having an accountability partner that I'm wearing. So there are tips and tricks to helping us be able to eat a certain amount of bread and have our dopamine receptors be happy, as well as lose weight, because now we have something that can help us measure the inflammation, because that's the other challenge we have in our genetics, is that inflammatory reaction. You have to lower the inflammation to lose weight. But they're beautiful, they're wonderful. And those genetic changes also help us to understand what disease processes that we're at high risk for. Instead of waiting until my mother was diagnosed with Parkinson's, now if you get your genetic testing done, you'll know if you have the same sensitivities or not, and what you can do to help prevent. Soon, I just completed a book, Components to Reversing Diabetes, and using DNA, metabolism, food to help, and coaching you through to help you get transformation, vitality, and longevity. We will have a link to that pretty soon. But if you're fascinated by how genetics are affecting you, feel free to reach out. From biology to blame. No, the other way. From blame to biology. Let's remove the stigma from our weight, because weight itself doesn't even determine your total outcome for disease later in life. But if you want to talk to me about it, we have a free session we can schedule. talktoDrTess.com is my calendar link. Or if you happen to be in Kansas City area, you can stop by the office. And TotalCareHealthSolutions.com will give you more information about DNA testing. So it's been great to talk with you today. And I will do another one of these videos again for how it's directly related to the genetics of diabetes. We've also done one for the genetics of menopause. I mean, that like quadruples some of the challenges during menopause and weight as well. So there you go. I look forward to seeing you all. Schedule a call. I look forward to it.
With the remainder of our time, I want to bring up the star of the show, Dr. Tess Volner herself, so that she can talk a little bit about her presentation and answer some of my questions and just add some of her thoughts. So, Dr. Volner, you have the stage.
Hello. So glad to be here today. And thank you for posting that video. And what questions might you have surrounding what you've learned today?
So I'm going to ask the same question that I asked Lorna. So related to the 15 to 25-year-old crowd, really it's a crowd that doesn't really think they need to go to the doctor, and they don't really think about their blood sugar or their relationship between DNA and sugar. What would you speak to that crowd, the 15 to 25, that typically their biggest problem is related to these bad boys and mental health related issues?
And those actually are affecting dopamine hits as well. So that's one of the things we know is how that screen is triggering dopamine and trying to create some calm in the brain. And so once we know what the challenge is in the brain, we can create that calm without even using the phones and creating an addictive behavior. So that's pretty much the solution there. But one of the things we know in that age 25 to 35 group is you've been through a lot of stuff in your short life already, a lot of things that create stress. And so then there's this underlying stress that you just add to having children, new career, change of location of living. You just keep increasing and increasing that stress level to where life does not feel easy. And part of that challenge in dealing with stress is how those genetics appear and process in your body. And so once we know what those genetic triggers are, then we can add things to your life, a supplement, for instance, maybe a supplement, maybe a food, maybe an exercise regimen, maybe something that is going to work for you. One of the things I do know that your age group is fascinated by is how to prevent repeating the same disease processes again, because they look at their parents and their grandparents and they say, you know, I wish you would have quit smoking sooner. I'm sure that's what it was that triggered your problem now. Like my mother, she smoked for 50 years and her cardiovascular system is, yeah. And sure, she could have quit smoking sooner, but the DNA trigger was already there. The smoking just turned it on. And so if you now in your youth do DNA tests that are clinically relevant SNPs that help you know what is triggering, what is missing, what can you support, you will have the supplements you need. You don't have to waste money, waste time, waste all this effort, lower your stress by supplementing the missing pieces. The missing pieces you don't know until we test. Just like knowing I have that lactose intolerance gene. And it wasn't just lactose intolerance, it was a complete dairy intolerance. But the severity of that genetic expression changed with age and with events in my life. I happened to have been going through menopause during the same time that I was having stress with COVID. Everything was shut down. How do we work? How do we meet our people? My children didn't want to have me visit. And you know, I love those guys. So it was rough. And so once you know what to support, then, or even what to change, I feel better now than when I was 18. I feel better now than when I was just a few years ago. I ran into a new health change that even my doctor said, it's all in your head. It wasn't. It was a virus. But no one was going to do the testing. So I had to do all of the work myself. And that's where you got to be your own best advocate or find a functional medicine practitioner, in my case, a genetic specialist that's going to help you target what you need to deal with. Maybe we find food sensitivities and other heavy metal toxins you don't know that you're exposed to. And so the advanced DNA test is deeper than just DNA alone. And we're offering it half price today at $750.
If you want to put the link, send me the link in private chat and I'll put that. You can visit it at totalcarehealthsolutions.com. Before we get to the roundtable, I have one last question for you to that point you just made. And I was talking with Lorna about this as well. So as you know, a lot of young people are averse to the doctor because there's a massive distrust in the traditional medical system among people that are 30 and younger. Someone that's 29, I can speak from this because I am right in the middle of that age group you said. And you're completely right. I mean, we went through 9/11. We went through COVID. We've had the first Black president. I mean, we've gone through a lot of things in our young life. And like Dr. Loomstein showed, from 1990, and I'm 96, to today, because of what happened 30 years prior with the advent of fast food and the supersizing and everything else, you've seen a lot more young people have ADHD, a lot more older crowd have Alzheimer's, and a lot more people are having diabetes. So my question is, how can we incentivize the youth and parents to take their kids to see a functional medicine practitioner, a chiropractor, an acupuncturist for checkups and for pediatrics instead of going to a normal pediatrician, so that kids can start at that young age and seeing that holistic and functional medicine is the way to go as they grow instead of going to a doctor in their young age?
It's about changing belief systems. And part of the change that's occurring now, that functional medicine 20 years ago wasn't even a phrase anyone understood.
Yep.
Never heard. So now, since we do have that distrust of the system, we're more likely to be seeking out other methods. And some of those are acupuncture, a naturopath, chiropractic is much more popular now, but it's also much more accepted since insurance pays for it. So some of the challenges is, how do you pay for it? Because concierge physician is basically what's going on. It's not covered by insurance. Vitamins are not covered by insurance. Supplements are not covered by insurance. The testing that's alternative is rarely covered by insurance. And I like to use the word integrative rather than alternative medicine, because I believe it's the future of medicine. We're going to be working together. More and more physicians are taking training that has to do with the National Institutes of Health research, because what I do is researched.
Yeah.
I don't recommend things that are, I don't recommend snake venom. How about that? I think it's proven to be poisonous. But National Institutes of Health, since the 70s, has been researching alternatives because they know, and even the predictions of cancer rates and diabetic rates have surpassed what they expected to occur by 2025 and 2030. And they're expecting a 100% cancer rate by 2030. And obviously all of the styles of treatment have not proven to be perfectly effective in every case. And we've had some of those deaths through our clientele, and it's tragic. It is tragic. And they've had to search for alternatives on their own in order to find solutions to extend their life, especially when people are dying in their 50s and they still have 10, 12, 15-year-old children at home. It's horrible. It's very horrible. But there's not enough research and not enough alternatives. And it would be great if we could get funding to make most of the therapies that we've been using over the last 20, 30 years. Some of my mentors have been using over the last 70 years. in order to help people walk through a cure, as opposed to hopefully the cure not being worse on you, because some of the chemotherapy way back then, they were just trying to kill cancer before they killed you.
Yeah. So I want to, oh, sorry.
I don't know. I could go on, but
yeah, I just want to start the roundtable and add some other practitioners to this conversation. But before that, I just want to make one announcement when you're brought up insurance. If you go to decentmed.org/about, you'll see a 5-minute video where we explain how DecentMed is working to create a new insurance model that prioritizes holistic medicine. I'm going to Idaho next month so that we can start building this apothecary so that we can give stake to our providers, as well as create a model that works for holistic medicine. Because like you said, if we can change the acceptance of insurance, then people will completely choose you. They will choose Dr. Loomstein. They will choose Angela and the rest of the practitioners. So let's start it off, Dr. Loomstein, with what are your thoughts on what Dr. Volner was talking about?
Oh, she and I agree. We've had long talks.
Yes,
we agree. The problem is that you are fighting the mother archetype, and you're fighting you're fighting the chemical companies, you're fighting the drug companies, and you're fighting one of the strongest lobbies in Washington, D.C., which is the AMA. And the AMA controls state medical boards. And the state medical boards, you can do okay as a chiropractor as long as you don't go too far. And the way they do that is they limit the number of sessions they're going to pay you for. So at least I still think they do that. So you got to be arranged that this is a political fight, and there are more of us than there are of them. And while I don't want you to strike me dead, RFK has done a good job in terms of bringing to light the problems with the with our sickness system, because our health system is working exactly the way it's supposed to. It is exactly. We are treating chronic problems with acute approaches, and that's why we're sick.
It's funny you say that. I want to bring Angela onto the stage as well. You hear a lot of young people say the system is broken. And to your point, it's not broken. It's working by design. So, yes. Angela, what are your thoughts on this topic of why? I mean, 830 million people have diabetes. That is twice the population of the United States. I mean, that's 1 in 9 people in general. About 33% of Americans have short-term or occasional insomnia, yet alone if we dive into obesity, it's an even bigger number. But why do you think it is that so many people are dealing with these kind of things? And I want to bring Lorna as well to the stage.
Yeah, I mean, I think it's really a reflection of the lack of government restrictions on food, and the kind of food that's being sold, being promoted, being advertised. It's, if you look at other countries, like in Europe, they have bans on certain types of foods. They have bans on food dyes. They don't allow advertising certain foods to children. They don't allow ads directly targeting children. They don't allow pharmaceutical companies to advertise directly to patients. And in the United States, all of those things are allowed and more. So when you have a situation like that, it is inevitable that people are not going to be eating the right foods. They're going to be snacking all the time. They're going to be doing things that are really counter to maintaining good quality human health. And the saddest part about this is that the companies, these fast food companies, these snack companies, processed food companies, they know exactly what people should be doing to live healthy. And that's why they're doing the opposite, because they don't want people to be healthy. You can't make money when people are healthy. I mean, the reality is you can actually make money from people being healthy through preventative services, but I guess in their minds, they can't make enough money. So they really want to keep people sick and in the dark. And they feel like, this is how we can kind of exploit the situation.
I would add that food is engineered, and I'm using that word, engineered, to be addictive.
And the companies that are producing the chemicals, there's over 100,000 chemicals approved every year to be poured into our environment. And it's more than $1 billion industry. Whether it's food-related chemicals, your laundry soaps, which cause cancer because of the fragrances, the artificial things, even the dye that is in the vinyl chair you might be sitting on is set by lead. And so you're exposed to heavy metals without even knowing it. It's way more lead than what is allowed in paint for children's toys, and your child might be munching on your purse as you're waiting at the doctor's office. We're just exposed. And so if we also believe that the FDA is a good and faithful servant and doesn't allow things in our grocery store that will harm us, then we're also delusional. But we really believed that for a long time, and we were eating Fruit Loops like crazy. There's a reason it's not spelled like fruit. It's not. There's no fruit in it. And the more doctored your food, the more doctoring you'll need.
Yes, by design.
Yes.
An estimated 10,000 or more chemicals are allowed in the U.S. food supply, though federal regulators do not have an exact count. So, I mean, what's your thoughts on that?
Federal.
Well, I think depending where you live, you could write your congressman and your senators. It won't do any good here in Texas. But if you live up north, especially in states like Pennsylvania or Massachusetts, in Ohio, Illinois, they can affect change. I mean, they are working on that. It's ridiculous that we have a measles epidemic again, and we've had people now dying from the measles. It's just nuts.
So, Dr. Loomstein, you talked about vitamin D3. And as you know, vitamin B3 helps with the immune system. And as more people are having more diseases, like you just brought up with measles, or like the millions of people that have chronic disease every single year, what can people do to improve their immune system as, again, we venture into fall and as, we just work to fight a lot of the chronic diseases that are out right now?
Well, exercise is one. Breathing through your nose is another. Doing breath work is another, because it increases your lungs. You have to have, as I said before, you have to have calcium, magnesium, potassium, and sodium in your body. The body won't work without those. It'll go bye-bye. You also have to have oxygen. So by working on breathing, you can increase the capacity of your lungs, because most people today don't breathe well. as far as sleep, in this study that I'm looking at the Cliff Notes version of this lady. She was talking about people today get less than, I'm trying to remember, but it's some like 3 or 4 minutes of deep sleep. And the younger they get, the younger the people, the less they have. And it's interesting that we have an epidemic of colorectal cancer among young people. To me, that says they're not paying attention to what's going on, what they're putting in their mouth, because what's coming out isn't helping them.
So I want to bring Lori Graham to the stage. She's a functional nutritionist, and she specializes in lowering blood sugar. So, Lori, can you talk about some ways that, and she works a lot with postmenopausal women. Can you talk about some ways that people can improve their immune system? Because Dr. Loomstein brought up breath work, and here controlled breathing, and this is from Buteco. They said, controlled breathing techniques support the immune system by lowering stress hormones like cortisol, reducing chronic inflammation, and improving lymphatic flow. What are some ways, especially for your target market, that postmenopausal women can improve their immune system?
Well, if you keep in mind that the vagus nerve runs between the brain and the intestines, and it's bidirectional, our intestines are a huge part of our immune system. And so I want to acknowledge what was said before, in that the brain, if you're stressed, is going to send a signal down there and change both the distribution and the variety of bugs, so to say, that are in the gut. So for a postmenopausal woman, when we lose estrogen, we're not getting the effect on our gut in terms of our microbiome. And that's why a lot of women that I see complain of bloating, they'll complain of gas, their bowel movements change, and it's really because of the decline in estrogen. So first of all, I think it's prudent for any woman to kind of address these changes in perimenopause and in menopause, when they're still in that window of time where most clinicians would feel good about giving estradiol to help support through that midlife transition. And once you're through the transition, if you've been on hormones, you can certainly stay on hormones. But the challenge that I understand is with women that haven't started estradiol within 10 years of menopause, getting the benefit of that estrogen. So it's important then to lean into a whole foods diet, rich in lots of fiber. And if you're not coming from a place of having had lots of fiber in your diet, you have to start slowly, because you'll overwhelm, your gut, and you'll get more symptoms. So my position is probably to take a gut microbiome lab and know what you need. I just had a woman yesterday, and it was clear she couldn't lose the midlife weight because she didn't have enough short chain fatty acids and enough butyrate, and there's competition between certain phylum in the gut. So it's complicated, but without testing, you would not know what supplements to give or what foods to emphasize. But as a general rule, certainly to support the immune system, you want to have a lot of plants. Plants are really wonderful to help the gut in terms of your immune system.
So here's a question for the panel. How do you differentiate between an underactive immune system and a dysregulated immune system? And how does that change your protocol?
So there's many things that can create underactivity, your stress levels, your lack of sleep. Maybe you've been not doing your food prep and eating out too much and perhaps in the wrong locations. A friend went into the hospital, so you're eating on the run and being stressed. So a person in a year's time can really only handle 1, 2, maybe tops, a third huge event, a move, a death, a change in job. But when you start pressing into more high stress items for the year, you've really dropped into more lack of function, not just needing a little support, but needing a lot of support to help rebuild an immune system.
I would look at a dysregulated immune system as someone who actually goes a little bonkers. They react to everything. You see that sometimes in allergies, but a lot of times you'll see people, particularly in the mental health field, and it doesn't take much to have them go off, and you don't know what it is that triggered them off, but I will guarantee you it was something in their internal environment and their external environment. And you find with these people that they have inflamed brains, they have inflamed guts, they don't eat well, and they sure as hell don't sleep, because that's why they end up doing what they do.
Angela?
I was just going to say, I think the other factor that when I think about someone who has a not active immune system, I often think about what might be causing the immune system to not respond appropriately. I always think about the fact that it might be a little bit overwhelmed. So, several people on the panel talked about different factors that can contribute to that. And I think another factor would be infection that is in the body, and even cancer, that the immune system really, with, lots of infection and, the development of cancer, really can almost collapse a little bit, because depending on the growth of the cancer and the speed at which it's growing and the growth of the infection in the body, a sepsis-like situation, that can easily overwhelm the immune system. And when the immune system gets overwhelmed, when you have sepsis, then that's when your organs start to shut down. So it's really looking at, what types of situations that are really causing the immune system to be overwhelmed. And then when you're talking about a dysregulated immune system, I always think about the correlation between your immune system and your nervous system. Mm-hmm. And maybe that goes a little bit into the emotional, psychological side of things, but it's also very physiological. Our nervous systems can become easily dysregulated with multiple stressors weighing down on us. And I know from even my own experience, getting that nervous system to become more regulated improves digestion, it improves overall functioning of the immune system, and so many other bodily processes. I mean, there's such a close connection between our nervous systems and the way our body functions, if it's not doing well or if it's doing well.
The other thing I wanted to mention is that it's really important to improve our antioxidants in our body. And if our body cannot handle the extra oxidative stress, whether it's internal or external, we're always going to have that gap between the demand of dealing with the oxidative stress and the antioxidant that is needed to neutralize those free radicals. So I mentioned in my presentation that there's a gap, because anytime our body is stressed, whether it's toxins in the environment or our own stress, whether it's our mental health or something, generating it, we're going to have free radicals from oxidative stress, and those free radicals are not neutral. It's actually, it takes the antioxidant to neutralize that. And if that does not happen, those free radicals are going to neutralize with healthy cells, and we call that anti-aging. I'm sorry, we call that aging. Sorry, my brain's a little bit tired.
We're working on the anti part now.
Yes, it is. It's aging. So that's I think that's huge. And the little things that we can do to adopt a healthier lifestyle, basically what we're doing is we're getting rid of that low-lying inflammation that our immune system has to deal with on a daily basis. And, and by doing that, we could increase our immunity to fight the kind of battles that we need when, there's infections.
Mm-hmm.
Yeah. So I'm big on, when people come in, I can kind of easily spot what their cortisol level is going to be like, what their immune function is. I immediately will give them liposomal glutathione. I give them SOD just to stop the damage, to support their immune function, and give them close that gap of need and supply for the antioxidant that their body can't handle producing.
And the more severe the incidents, like you said, what their body is needing.
Yeah.
I had an incident where I had a viral infection, but no one could find it for a year and a half. But because I was so ill, I was supplementing with powdered green drinks that had probiotics and all the nutrients in it 3 times a day. When the package says, you just need 1 scoop once a day, I was doing double scoops 3 times a day. And within 10 days, 90% of my pain was gone. I had pain like I had MS. And I didn't have MS, but it was a viral infection. And so when people are walking in, I'd love to say, oh, you can just eat your way to health. And I do recommend eat with the season. Like, we're moving into fall. We need to eat the fall vegetables. And in the spring, you need to eat all the happy, colorful fruits and vegetables. But if you are really ill, if you are losing function and your doctor is saying, you're fine, there's nothing wrong with you, just go home, rest, you're going to be great, which is what my doctor told me. I'm glad she retired. And I said, I was here and now I'm here. I was here and now I'm here. And I don't know why. And nothing I normally do, just the usual pop vitamin, extra vitamin D, little quercetin, which is an onion and garlic and lemons. And, it was not working. And I had to take matters into my own hands. I had to ask enough people enough questions to get where I needed to go. And it took a huge round turn of events to get there. But that's where we have to be our own advocate and not give up. If your doctor is sending you home and you're septic, that's a hospital visit. You have to advocate for yourself, stand up for yourself, and not just accept the status quo. Because each one of us is different. Our body is responding different. It's why I got into doing DNA testing, because even when my husband had a stroke, they were going to send him home with some typical medications that he didn't even need. He did not have elevated cholesterol. He did not have a high calcium score. He did not have all these other things. What he did have was chronic inflammation blocking blood vessels to his brain because there was no clot. There was no bursting of blood vessels. And the medications they would have put him on, I stepped in, would have killed him, would have led him into dementia, would let him into loss of muscle strength. I think he's living longer now that we avoided those things. But you have to be your own advocate. And how you asked that question earlier about how do we gain a trust to even go to the doctor to try and seek out what we need? I will tell you, it can feel tough when you hear these really outside the box stories about how I was here and now I'm here and no one's helping me. And you have to keep seeking. You have to keep seeking because someone will listen. I've had really great doctors in the past, and I will have another great doctor again the next time I'm ill, if so. But learn yourself and start taking steps daily yourself. My husband's DNA said his blood vessels are sensitive to inflammation, and they close up. And that's pretty much what happened. His blood vessel closed. He had what looked like a stroke, and then it reopened, and they couldn't find a cause. And so each person has their own DNA SNPs to flip on and off, and how to do that, to supplement if necessary, until you can get to a more maintenance style for your health.
So what about testing? I know that multiple of you have talked about testing. Kari talked about testing. Lori is a major proponent of testing. So is Lorna. But as I've seen in Lorna's story, like you've said, Dr. V, I think even with Angela's story as well, is that a lot of times conventional tests
I'd like to say
labs,
something.
Yes, ma'am.
We're frozen.
You're not frozen anymore. There you go.
Okay. So I'd like to actually just say something about the immune resilience and then talk about testing. So first thing is, if most of the people in this audience are healthy and you're still working and maybe you can afford some money to spend on personalizing for yourself, if you're not feeling ideal, tackle it when you're younger. When you're younger, you will lay a foundation that's strong for the future. That's number one. Number two, I'd like to make the point that during COVID, the research that came out was largely that those people that were more overweight, and we were talking about diabesity earlier, they were the ones that struggled more, and the people that were of normal weight and eating a healthier diet seemed to recover better. So whatever condition we're in when we have an insult will make us better or less resilient. Obviously, if we're in a better state of health and we're not having the inflammation that's tied to the obesity epidemic, then we're going to move through a stressor with greater ease. So with regards to testing, sometimes we have things going on like a mercury toxic burden, and you don't really notice because maybe you're doing most things right and you feel kind of normal. I had that happen to me, and I just did something called the NutriEval, which was a test to look at your vitamins, your minerals, your amino acids. But they happened to test in urine mercury, lead, cadmium, and arsenic, and I was high in mercury. And my body was holding on to it. And, you know, this was 15 years ago, but that could catch up to me, you know, much later in life. And so if you can swing it, definitely do some testing to know how your body is functioning. The other thing I would say, I've done a lot of research when let's say I have somebody and their presentation is a little out of my wheelhouse, like my husband and some stuff that's going on with him. And, you know, using AI and just being real specific about wanting your natural approach or your functional medicine approach to what's going on will educate you so that you can go to the doctor and have an intelligent conversation. And, you know, I had a doctor tell us, I don't think that I'm the right doctor for you. Why? Because we wanted to know what was causing what was happening as opposed to just taking a medicine. So, you know, I think, first of all, testing, and I said this during my presentation, you can go through the insurance model to do some testing, but you can't do a stool sample that's ever going to look like what you do through traditional medicine. You could test for certain micronutrients, but you cannot do a panel that's as varied and as complex as the NutriVal. And, you know, even when an OBGYN does a test on a woman's hormones, we should be looking at blood, we should be looking at urine, we should be looking at saliva, and not every OBGYN has that perspective. So the best thing I recommend is get educated and plug into AI, but ask the question from a functional medicine or an integrative medicine kind of perspective. And you'll get a very different answer. I mean, if you forget that and AI hasn't kept your information, believe it or not, you'll get a different answer if you don't qualify that you want to do this from a more integrative approach.
The other thing I want to mention is that conventional testing is not always accurate. Case in point is tick-borne diseases. You know, people come in, I tested negative for Lyme. I said, that's because it's a false negative. It's not because you don't have Lyme. And even if you tested negative, and if you're truly negative for Lyme, what about co-infections? Those are things that I have been dealing with for the last several weeks with people coming in. I guess it's because it's the summer season. We're in tick season here in the Philadelphia area. Pennsylvania is very endemic for Lyme disease. And I have so many people that are being misdiagnosed and are just currently taking antidepressants because their PCP just does not know what to do. So it's good that we're doing testing, but I think it's really important to know and recognize false positives and false negatives and truly understand how you know, the reliability of those results. And even if somebody truly has a negative testing, there's infections out there that are hard to pick up. Bartonella is one of them. It's intracellular. So if you don't have it, if it's not flaring up, chances are you're gonna test negative for that. You know, I have a couple of cases where somebody is just dealing with a lot of issues with anxiety to the point where, you know, you know, they're taking psych meds. But they also told me that every time they take a course of doxycycline, they're feeling better with their anxiety. So, you know, I correlated the anxiety with infection. So we delved deeper into it, and we finally, after multiple conversations, we said, okay, I think the anxiety has to do with Bartonella. No, even if your doctor just checks for Lyme, I mean, they're not gonna be able to pick up the co-infections if you don't check it, and it's not being done. So I did a specialized testing through MDL, and it did come back. It was, I didn't do the PCR to look at the infectious load, but the immune system shows that it was heavy. And I don't want to use antibiotics. I want to use herbs to, there's some, really good stuff that I'm researching right now that I know it's going to be helpful. Yeah. And the other thing I want to say is that in terms of immunity, along with checking for someone's blood for specific infections, we also have to not forget to check for those low-lying infections that nobody thinks about, but it does impact how our immune system works. I've checked for Epstein-Barr, mycoplasma, which is walking pneumonia. I treat those if I see that it's positive. I use antivirals, herbal stuff to get rid of that before actually treating the real infection. Yeah.
Of course, by treating that, you make the immune system strong enough to fight the other.
Yeah.
Right. And it really has to do with your body load. How much you're impacted by all the things that are attacking you on a daily basis. And I use the word attack because we are attacked.
Carly, do you want to chime in since you have just joined us?
Well, what's the topic? Sure.
Well, we were going immune system right now, and lack of immunity or overabundance, overactivity of the immune system.
Well, I'm seeing when I talked about this a little bit in my presentation, is I see autoimmune and LPS typically coincide in so many people. So when I see autoimmune antibodies, they can't come down. If you're talking about autoimmune, immune system in general, I'm looking for infections. You probably already talked about that, but yeah, and that's LPS isn't an infection, but I am seeing that cause problems for people. And then or mold, what's your environment? What's driving this? If I can't find a virus or an infection, then I'm looking environmental, because there's something. I have somebody right now that's young and so sick, and she was exposed to mold as a child, exposed to mold in her dorm room, and she just can't get on top of, her immune system is just not able to counter that without any intervention. So she's been, it's coming out in gut problems, a lot of some histamine things, but it's coming out causing problems with her gut. But it's environmental toxin exposure. Yeah.
Awesome. So you've already touched on things we haven't even gone into yet. So,
oh, good.
Autoimmunity at the same time. Autoimmunity is your own body attacking itself, and recognizing your own body to be destroyed. And trying to slow that down can be a challenge, can be a chronic situation, but it also can be a trigger in your DNA and needing support there as well.
There is a phenomenon called molecular mimicry. And, you know, sometimes people with autoimmunity will have, it's like when you recognize that you have one autoimmunity causing symptoms, chances are you have other silent autoimmunity that isn't where you're not symptomatic yet. And molecular mimicry within your immune system is huge. So, like, case in point is somebody who has gluten sensitivity or don't tolerate gluten very well. Yep. I see thyroid issues for a long time. You know, people will be like, yeah, I have to. And when I got into the space, I learned that the amino sequence has, there's a resemblance between the amino sequence of a gluten molecule, compared to thyroid. So your immune system sees that sequence, produces antibodies, and then it comes in contact with the thyroid and it thinks it's gluten. So I think that the phenomenon of molecular mimicry definitely feeds into autoimmunity. I've even had people, you know, tell me I get so sick with, you know, gluten ingestion that within an hour I start to lose my balance. It's that same phenomenon where the molecular mimicry with your cerebellum, you know, obviously they have, you know, a leaky blood-brain barrier. So all that stuff is crossing over. The gluten is crossing over. The antibodies are crossing over. But I think that autoimmunity can perpetuate itself. It's not just linear, but once you have something, it's not being addressed, it just exponentially become greater and greater over time.
And some of that can be triggered as a DNA SNP, dealing with leukocytes and other challenges there, but also environment, because those who live in the parallel line around North Dakota, northern Montana, they're more prone to autoimmunity than those living in the South. So there are more pieces to how that is triggered. And just because you're susceptible does not mean you have the expression of that autoimmunity. But again, it's a weakness that shows up and adds more autoimmune issues with it. So very good to recognize your own self, your own body's needs, and how you can be, again, your advocate for just getting the answers and then step into the solutions. Because even though I knew I was lactose intolerant and should not be consuming dairy when the church youth group went out for ice cream, I had some and then I suffered. And so that's the social aspects have to be recognized, that if you really want to stay well and longevity for it, you need to just bring your own alternatives so that you don't feel like you're missing out, that you don't feel like you're not being able to gather socially because you have this new definition of what your body has needed all along.
And I just wanted to add something related to autoimmunity and identity and trauma, because there was a really interesting conversation that I saw recently with Gabor Mate, who is very well known therapist, works extensively with trauma. And the conversation was about why are 80% of the people who have autoimmune diseases, why is it that 80% are women? And he basically broke it down, talking about, you know, the whole idea of autoimmunity from a self-identity perspective, from a psyche perspective, is turning against self, right? I mean, the body is turning against itself, but it's also a lot of times the core can be, or the alignment piece can be with the psyche is the person is turned against themselves, and often that is reflected. And he described the characteristics of many people who have autoimmune diseases, like the personality characteristics, the behavior, and the characteristics were people who always put themselves last, people who are always serving everybody else, who deny themselves the things that they need, whether it's food, whether it's compassion, whether it's just a basic level of self-care. And he said, when you look at how society, the expectations that society puts on women, he's like, there should be no surprise that 80% of women have autoimmune diseases, because society expects women to sacrifice ourselves, to care for others, to care for children, to care for spouses, to care for parents, to care for family members. This is particularly true for women in midlife, who are often sandwiched between multiple caregiving duties. And when you think about what happens with the reduction of estrogen in midlife, that is often when a lot of autoimmune diseases occur for women, because of that hormonal transitional change. So it is a multifaceted issue for sure, and there's multiple factors that play into that. I do think a lot of times there is a particular type of person who is more at risk for developing an autoimmune disease, and these are the people that are historically sacrificing themselves, their time, their energy. They don't see the need for self-care. That is, I think, a consistent pattern.
Yeah, wouldn't it be nice to create a program in functional medicine that supports the mom of, I have a close friend who has an low functioning autistic child and autoimmune disease. And, no surprise, right? If she had the genetics and she has a gluten intolerance. And so it was a perfect storm. And I don't mean that in a positive way, but a perfect storm of, yes, pushing her over the edge into autoimmune, that antibodies that are astronomical and won't come down. And it's right. I would love to start thinking about that. How do we start supporting these women in advance before they get to that point?
Yeah, I would even say, how do we start supporting these girls?
Yeah, right.
Really want to head off stuff.
Teenagers.
Let's start working with the young women.
Mm-hmm. Mm-hmm.
We tend to praise that sacrificial behavior, and we don't praise self-care. And that's a change we can make, so that these young girls will know. And we tend to try to draw them away from being self-centered and selfish, and that can be good, but let's create a more balanced approach to it, so that less shame is involved and more appreciation is in there.
Yeah, I would even argue that the whole idea of labeling self-care as selfish is problematic.
Yes.
It is not, particularly when you look at different genders, I think that is something that is often put on girls and women. It is not so much put on boys and men. And I think societally we need to shift away from, again, saying that taking care of oneself is a selfish act. It's not a selfish act. We need to have compassion for ourselves, because for people who have chronic health conditions, that is, in my experience in working with clients, is like the utmost important thing. Many of them don't even understand the concept of self-care. Helping them understand that in order to heal, you need to dedicate the time to eat properly, to get sufficient sleep, to exercise, to connect with other people, to identify what makes you happy. It's difficult for people who have never even thought about what makes them happy because they've been so busy trying to make other people happy.
I remember the first time I said no to my husband. I had been at school all day and then clinic, doing clinicals. And it was about 8:30 that I'm walking into the house and the 3 kids are going nuts and he's trying to fix a toilet. And he goes, "Can you help me?" And I said, is this a long event you want help with or a short one? He goes, "I don't know." And I said, then no.
Number 813.
Oops. My answer is no, simply because I must eat first and then I can help you. It wasn't that I was saying no forever, but you have to have a healthy boundary, a balance, or you're not going to be good for anyone. You do have to do that self-care as a real care in order to refuel to serve someone else.
Yes, put your oxygen mask on first.
Yes.
Yeah.
I think we need to do something with young girls. One of my careers was I was an Uber driver for about 6 months. And on Friday night, I'd pick these kids up, and boys and girls together. And I would say to the girls, why do you let them talk to you like that? I mean, calling them whores and sluts. And that's in the music. That's in what they hear. And we need to have, we need to get a better ideal for how women are perceived, and particularly how young girls are perceived.
Yeah, agree.
Start someplace. I don't know where.
That's pretty good.
Mm-hmm.
But doesn't hurt. It's not. Yeah. I said it's gotta bother me.
Yes.
It's pretty brilliant.
So this has been the DecentMed Summit addressing diabesity. We concluded today with our great speakers. So I just want to give everyone a 1 or 2 minute outro where they can say anything that they're working on or announce any big updates. So we'll just start with who's to the right of me. So we'll start with Lorna Ching-Carter, founder of Optimal Root Wellness. I'll put the website in the chat.
Well, I think it's really important to be educated. When you have some issues and you're going to see your primary care or whoever, a specialist, that you do your own research. And even if what they're recommending is not working, it doesn't mean that it's the burden is not necessarily on the patient. I think it's because our healthcare system is just not set up to do a deep dive the way functional medicine and holistic medicine are, the practitioners are trained to do. So I think it's important to look for the right person who could work with you and validate your concerns and your symptoms. I am currently writing a book on healthy roots. And what I realized is that, the name of my business, Optimal Root Wellness, is about addressing your physical health. But, what I realized in the last several weeks is that healthy roots is not just for the physical body, but it's also for your mental health. It's for your spiritual health, your relational health with other people. And if things are not going smoothly, we all go through bumps and challenges, but if there are issues going on, we can always trace back to an unhealthy root. So, yeah, I mean, there are practitioners out there that will work with you and do a deep dive. So, yeah.
Samuel.
Next is Dr. Volner.
Hi. Dr. Teresa Volner, a total care chiropractic and total care health solutions, and specializing in diabetes because it affects so many things, that inflammatory response. And if you go to totalcarehealthsolutions.com, there's some free resources to help you look into how to start managing blood sugar and blood pressure. You can click there, and eventually there'll be a button there for a book that has just been completed. I don't have it. It's at the publisher. How about that? It's at the publisher any day now. We're going to have books about components to reversing diabetes, using your DNA and coaching and emotional things. The winners in diabetes helps to appeal to every aspect that's affecting your health, your weight, training and adding interval training into your life, nutrition, navigation, using a coach, emotionals, issues, and spiritual issues even. And then rest to rejuvenate, because even 1 hour of sleep deprivation, and Dr. Loomstein mentioned that not very many people are getting deep sleep each night. So that rest is so important to lowering inflammation, lowering your weight, helping your circulation, helping your heart and your brain, as well as having smart, safe, successful goals that you can reach each day. Some of us are able to pull our health into alignment in a few weeks, and some take a little longer. But don't give up. We have the tools, many tools. If the tools you have aren't working, we can guide you to more of those tools that can assist. Total Care Chiropractic, Dr. Teresa Volner, at your service. And if you want to talk to me for a moment, free, go to talktodrtess.com. talktodrtess.com. I'll be glad.
Dr. Loomstein.
Yes, I'm going to say something. I don't know how much this has been covered, but there are simple things we can do to stimulate and protect our situation, our environment. And I will tell you that on today, which is August the 27th of 2026, it is another day that it is over 100 degrees in many parts of this country. And it's temperatures are particularly elevated in other parts of the country. You need to stay hydrated. Drinking water is the simplest thing you can do. You don't gulp it, you just simply take it and sip it during the day. Staying hydrated will go a long way to making you able to navigate the environment that you're in. Again, at Biotech Institute, we treat metabolic diseases. We have a very good track record with diabetes. We can get you off of your meds and A1C down to 6.4 in 3 months. And if you go to the website, which is biotechinstitute.net, you can schedule a half-hour meeting with me, and it is complimentary. So thank you, and I enjoy being here. I learned a lot from the speakers. It was a great idea and a great time.
Angela Forrest.
Hello. Yes, my name is Angela Forrest. I am the founder and senior health advisor with Robust Health Advocacy. I specialize in working with individuals with chronic health issues, particularly women in midlife. And I do take a very holistic approach. I totally agree with a lot of the comments that have been made during this roundtable, particularly as it relates to looking at disease through the lens of a holistic approach. It's not just a physical issue. When people are bringing symptoms, a lot of times there's an emotional component, there's a spiritual component. And so I work a lot with clients across multiple areas of their lives. I like to know, I ask them to talk to me about all areas of their lives as part of the work I do. And this fall, I will be offering a 12-week online program, 12-week robust health program, where I'm going to be covering a lot of these foundational health concepts that I typically use in my individual coaching. So I'll be talking about the basics such as diet and exercise and movement and sleep, which is critical for healthy functioning of the body. But I'll also be getting into relationships. We talked about a little bit about that, establishing boundaries, stress management, trauma release, life purpose, having things that bring you joy, doing things that bring you joy and satisfaction. All of these things, including personal health advocacy, which is, I have an entire course on that, and that will be included in the 12-week program, which will include a series of modules for each of the 12 weeks and a live weekly facilitation that I will lead, along with being part of a community of other people who are trying to establish a solid foundation. And these foundational health elements have been well researched and well studied, that show if you align with these core health foundations, these pillars of health that I like to call them, that you will be able to not only restore your health, but maintain health or, quality health for the rest of your lifetime. And we are living in times where, as many have already said, the human species, all species of life, really, our entire planet is under stress, is under duress. There's a lot of environmental toxins. There's a lot of pathogens. There's a lot of vectors, insects, ticks, mites, mosquitoes that are disease carrying. And so being able to take a holistic approach and remaining resilient and having strong immune systems is really critical at this moment in our history. I also do free consults as well. And so for anyone who is interested in wanting to meet with me, feel free to go to my website. You can also reach me via email. My email is robusthealth78@gmail.com. And again, it's been an honor to be able to participate in the forum and to be able to listen and to contribute to very proactive, committed, compassionate practitioners.
Kari Lockrem.
So Kari Lockrem Wellness.com is my website. And what I'm working on right now, I do have a couple of ebooks that I have on my website. One I brought up today a little bit, not the ebook, but the point about GLP-1 and supporting people through GLP-1. It's happening so much, and people are just getting them, and they are not being coached through it. And that's scary to me. I want people to have coaching through it and to know what to do when they get off of them, so they know, what lifestyle changes they need to make so that so their metabolism isn't just damaged by the time they get off of them, and try to add things back in and they're having a hard time. So I also have a hair loss roadmap ebook on there too. So I talked about that a little bit today. And my Shape Reclaimed program, it is a great alternative to doing a GLP-1. It does have homeopathic drops, and a lot of support, a lot of touch points. So you are supported throughout the whole program. And it's an amazing way to learn lifestyle change that you can carry on, that you don't, that it keeps the weight off, but also not just the weight, but also your health, your blood pressure staying down, your, anything else that has gone up because inflammation. So it's a good long-term program. It gets you, the drops help you sustain being able to make these changes in your diet and your lifestyle, so then you can carry them on when you're not doing them anymore. So it's a great program for when people need a lot more touch points, a lot more coaching throughout. I love, and a lot of things come up throughout those meetings that I have with people once a week. So are there other things going on in your health that need to be addressed? So then we can, go into larger programs if needed, look at labs, and if there's autoimmunity, that takes a little while to unwind, or if there is gut issues, so that typically takes a little bit of time. So yes, please go to my website, and I do a free discovery call for 30 minutes if anybody wants to see if we're a good fit. And so, yes, thank you for having me be a part of this summit on diabesity. I definitely think people need some guidance here, and so I'm so happy to be a part of it.
Thank you to all the great speakers today. You can catch the full summit at decentmed.org/functional medicine. This has been Addressing Diabesity. Join us next month for our next summit on stress management. And finally, to catch our headliner, Dr. Tess Volner, you can visit decentmed.org/chiropractic. Everybody have a great night.